Good morning. Sorry.
Good morning, Rajiv. Can you hear us?
Yes, good morning. How are you, Rakhi?
All good. Great.
So we have an extra 5 minutes because Krishna Kumarji is not joining, right? So in the morning first session, we have 5 minutes extra.
Morning, Nirja.
Good morning, Nirja.
Camera, please. Ticket. I just run the laptop.
Can you hear me clearly? Rakhi, I just want to confirm you can hear me clearly.
Hi, Rajesh. Morning.
Hi, Nirja.
Good to see you. So Rajiv, I am going to be just calling Dr. Rehan because he had called me late last night, to say that he had some urgent government meeting he had to join, but he would try and join around 10:15, 10:30.
Okay.
Message him and reconfirm. So
Okay.
my suggestion is that because we don't have the first two after you, so we sort of request us, you set the overview and then the second.
Can you hear me? Because sometimes your voice is. Just want to be sure that.
We can hear you. We can hear you.
Okay. Good morning, Dr. Warrior. So you're confirming that Dr. Trehan will be joining, right? I just want to.
I'll just reconfirm with him because what he had told me was that he would get late. He had to join another urgent government meeting, and that if he could extract himself out of it, then he would join a little late. So I'll just reconfirm that.
Yeah, I think otherwise it might become a little lean, the entire thing, or we'll end up having to discuss something more. Namaste, good morning.
Morning.
Dr. Vaidya.
Morning, how are you, sir?
Dr. Warrior, can you hear me clearly?
Yes, yeah.
You can hear me clearly. Okay, that's
yeah,
good.
Sure. Can you hear me?
Yes. Very good.
Okay, good. Today I was able to directly join the meeting.
Join in the morning. Yes.
Yeah.
Excellent. Even I ensured that I could come in a little early. And Rakhi,
And that's what I also thought like that.
Yes. Rakhi, one clarification I needed from you. Rakhi, can you hear me?
Yes. Can you hear me?
Yeah, I can.
Yeah.
So what I would like to know is when different speakers have to be brought on screen and showcased, etc. Your IT team would do that.
Yes. So I will be initially announcing the names. I will welcome everybody, and then I hand it over to you. And then you give your welcome remarks, and the normal I will invite them to give their welcome address. But the other section will introduce the speakers, and hand it over to you to moderate.
Yeah, so the question I wanted to know, all the panelists, their mics would be unmuted, their videos would be seen, right?
Yes. Only
so I don't have to do any of that. Yeah.
No. Yeah. Only panelists, they will have their video and audio, both will work.
Okay.
And they have the right, and we want them to continue to put on their Welcome, Dr. Simon. Welcome. We cannot hear you. Yes. Great.
Okay, now you can see me and you can hear me, right?
Yes. Good morning, Dr. Simone. Good to see you.
Good morning, Dr. Simone. Good morning.
Good morning. Very nice to be here. Thank you.
Yeah, thank you.
Thank you for taking time out and joining us. I think it is early morning there.
It's a privilege.
Thank you.
Thank you for taking time out early morning and joining us. Thank you so much. It means a lot to us.
Thank you.
So Dr. Simon and Dr. Warrior, just two things and two updates. Padma Shri Krishna Kumar ji, he may not be able to join today due to some sudden, developments at his end. And Dr. Trehan might be delayed a little bit in joining. So I think we may have, Dr. Simon, you have about currently 15 minutes, which has been allotted to your slot. So in case we have a little extra time, we may request you to even take another 5 minutes. You could go up to 20 minutes, Dr. Simon. Huh? Is that fine? So
yes,
you could
this
expand.
Is perfect. It's actually when I did my when I tried to bring the content across, it was around 18 minutes or 19.
Okay.
So anyway, it will be okay.
That's great. That's great. So about 20 minutes, I think if you plan that, I think that will be great. And Dr. Warrior, we have not spoken on the vote of thanks. So I think in one sense, summarizing what everybody has spoken and then thanking them, both those things you could kindly do.
Yeah, okay.
Right? Or so that the key points coming, or depending on the time available, I will message you. So just watch out for your chat box.
Yeah. Okay. All right. Yeah.
While others are speaking, should we keep the camera on or off?
You can keep your camera on, that's fine, because there are a lot of people seeing, so they'll be able to see everybody. So it's good to keep, the panelists should keep their camera on.
Only the mic will be off, yes.
The mic, and you can turn it on when you have to speak, that's right. Are you planning to have a presentation, Dr. Simon? No,
I was also requested not to have one, and that not to have one.
Sure. I asked because you said you're timed it to 18 minutes, so that is why I asked.
I more or less, I mean, I will try to make it within that.
So, Dr. Simon, just so that in the time available, we have a session on human resource development, which is happening in the evening between, I'll just tell you, from 4:30 to 5:10 Indian time. That means 1 o'clock, 1 p.m. to whatever, 1:40 your time. And originally we wanted you also to be there, but then we felt it was too much. You have a keynote speech and again to come late in the day. But if you can join, because the education part is very important, and if you could also just join in, and if you have any questions, and then later on, I think that discussion, because what you've done with Sama in Switzerland is really a path-breaking step. So that needs to be factored in. And then from 5:10, we have the meeting with 5:30. We have the Secretary AYUSH joining for a sum-up session, right, where we summarize the outcomes of the day.
Okay.
But your views on education, particularly education in Europe, right, for Ayurveda, are very important. I presume you'll be covering that in your address, right? How to really look at Ayurveda and Ayurveda education as well.
I mean, I do mention it, but I do mention it as a margin because too many things have to be said. But it will be mentioned all through a little bit, but not in detail. Nothing really very specific.
That's fine.
But it would be possible for me. I have medical consultations all through the day, but normally between 1 and 2 there should be a break. So it can be possible to join. But where to join? Which is the right link?
Same link should help you to come.
Same link. And you said from 2 on secretary will join,
Yes,
is it?
from 2 p.m. 2 to 2:30 p.m.
2 to 2:30 p.m. Okay, so I mean I can postpone, and what would be my role between 1 and 2:30?
Actually, currently we have this half-an-hour slot, and it may get quite packed. So what I thought was that what we discussed was maybe some of those points we would cover in the morning in brief, and then in the evening session, then subsequently offline we will consult with you, Dr. Simon, on the education part. So today between
offline people can chat, can ask questions. That's what you mean.
That is right. Exactly. Yeah.
And that would be from 1 to 2.
It would be from 1 to 1:40.
Okay.
I'll just tell you 1 second. It's there in the program. I'll just tell you. It's from, yes, it is from 1 o'clock to 1:40.
And then what happens from 1:40 to 2?
There is a small break for people to reconvene, get the notes together.
Right, then I can eat something, okay?
That is right. Yeah. The program will be sent to you.
Yes.
Yeah.
Okay, fine. So I will be joining.
Great, wonderful.
Rajiv, hi, Nija.
Hi, Nija. Good morning to you.
Morning. I have a little update for you.
Yes.
Dr. Rehan is actually scoring really badly in Delhi NCR now. So he's actually stuck in the jam. So he will also therefore. I will give you a message.
Okay, he'll be joining the session, but a little late. Okay, great. So should we change the sequence of speakers, Nija? So after Dr. Simon speaks, we will request Dr. Kotecha to speak.
Yes, please. And then Dr. Warrior can come in, and then Dr. Rehan can come in after that. And then you...
Okay, so Dr. Warrior, you may have to do the speech. After that, there'll be one more speech. Dr. Trehan will be speaking after you.
After this thing, Thanksgiving.
Yes, in one sense you could do that because Dr. Trehan is caught somewhere, so he would join immediately after.
Okay.
Yeah?
So, all right. Anyhow, you'll be calling the name, is it not?
Yes, I will ask you to do that. Yeah.
Okay.
We can ask Rajiv, we can ask Dr. Rehan to come in and
Your voice is a little, breaking up. I can hear others, but your voice is getting cut.
Oh, okay. Sorry. No, so what I was suggesting was that we allow Dr. Rehan to come in and Dr. Warrior to do the closing as was planned earlier. So,
okay, we can do that. Yeah. Okay.
Yeah.
Right.
So I'll just message you once Dr. Rehan has joined.
Yeah. Okay, it's 10 o'clock now. Should we begin right on time?
Yeah, we're just waiting to see if the secretaries join.
Okay, that's right. Moment he joins, I think we can begin and then.
We're just calling up his office to check if he's
Sure.
कर लिया है.
Namaste. Good morning. Okay. Welcome, Dr. Kotecha. Rakhi and
good morning, sir.
Good morning. Good morning, everybody. May I welcome
Good morning,
everybody
sir.
to
Good
Global
morning.
Ayurveda Conference.
Morning, sir.
Yeah. Good morning. Good morning, everybody. May I welcome everybody to the Global Ayurveda Conference 2020, Resurgent Ayurveda Leveraging Global Potential, organized under the aegis of India Healthcare Week. May I especially welcome Padma Shri Vaidya Rajesh Kotecha, Secretary, Ministry of AYUSH, Government of India. May I welcome Dr. Simon Hunziker, Director, Swiss Ayurvedic Medical Academy, Dr. P.M. Corrier, Member CII Ayurveda Governing Council, Head Kerala Ayurveda Panel, and Chief Physician Ayurvedeshala. May I welcome Mr. Rajiv Vasudevan, Chairman CII Core Group on Ayurveda and Managing Director and CEO of Ayurveda Hospitals. Dr. Narendra Khan will be joining us shortly. May I request Mr. Rajiv Vasudevan to kindly give his welcome and opening remarks. Thank you.
Namaste and a very good morning to my co-panelists, my esteemed co-panelists, and the persons who are attending today's Global Ayurveda Conference 2020. We have a very exciting day ahead of us. But before we get into that, and before I go into my given duty of welcoming my esteemed guests to this particular inaugural session of the CII Global Conference, what I would like to do is to place in context what this whole thing is about, right? So this is the third edition of the CII Ayurveda Conclave, which we have earlier held in 2018, 2019, and now the third one in 2020. In 2018, the inaugural event, we had then outlined a Vision 2022, which was really looking at a pan-India, pan-Ayurveda sector, right? Cutting across products, hospitals, wellness, then looking at the sunrise sectors within Ayurveda, whether you look at veterinary Ayurveda care, agri-Ayurveda, Ayurveda equipment, really looking at the pan-sector potential of Ayurveda. Why did we do this? Because we felt that there was a need for Ayurveda sector to be represented in its totality, in its largest size, and then to offer a policy platform where the decision makers, the policy makers and government get a chance to sit and engage with industry across the country on one day or 2 days, and then deliberate on the important issues confronting the industry at that point in each of these subsectors, and then to decide what is the way forward. I'm so glad that we have the esteemed Vaidya, Padma Shri Vaidya Kotecha ji, who's present today to right from the beginning to the end. Of course, he'll be taking a big gap in between, but to ensure that this important deliberation is given the due importance, that from the spirit of openness and the wisdom which comes from an open mind. So today, as we stand in 2020 August, while we come through a pandemic, a COVID pandemic, we can see that there is a new resurgence, there is a new confidence, and all this is translating into very focused activity in different stakeholders, whether it is a private sector, whether it is the government, whether it is the colleges which are building up the human resource development resources for the country, for Ayurveda. All of these sectors, there are big challenges. I don't want to sugarcoat the challenges we have before us, but yet there is a very good sense of optimism in the fact that Ayurveda can translate this crisis into an opportunity. If you look at the level of activity, I call it the threshold level of activity. There is a concept called bridging the chasm, which means there is a valley, you have to cross the valley. I think 2020, in one sense, after 4 years of Dr. Kotecha driving the Ayush ministry, we are reaching a point where we are able to probably bridge the valley, where Ayurveda is today in terms of public perception, in impact, reaching that point of threshold impact that it will register in people's minds and say Ayurveda is there for real, Ayurveda is a serious medicine opportunity. It is not an alternate system in the country of its origins. It is a mainstream system. People start considering that possibility. So when you look at the challenges and the opportunities before this sector, which are many, some of the things will be, I'm sure our colleagues will be talking about in the course of day today, but definitely capital availability for industry is going to be one of the key issues. whether it's a working capital to weather the storm, the short-term storm that we are going through, working capital access for manufacturing industry, services industry, wellness industry, all of them. Where is the working capital available? If people want to invest into asset building, into capital investment, where is such capital available? So I think we have a need to really look at the funding requirements for the industry. We have challenges in terms of employment. There are human resources coming out. What will be the short-term impact, medium-term impact of employment? Building skills in this human resources, both medical, doctors, and paramedical staff. We have to look at the evidence building, because we are reaching a point where the government has taken very key firm steps. I'm sure Dr. Kotecha and others will be talking about it, but building evidence. But what are the opportunities? Just on 15th of August, our Honorable Prime Minister announced the National Digital Health Framework. So with the NDHM coming in, how does it impact with an EHR, PHR, everybody having a health card? How does the AYUSH grid fit into that? Right? So we have a tremendous change happening in healthcare in the country. How does AYUSH fit into that scenario? The fact that public awareness has gone up for Ayurveda.
Good morning, sir.
Very clearly. Doctor,
Good morning.
Dr. Warrior, can you please mute your phone?
Yeah, sure.
Yeah. So the thing I would say is that public awareness to communicate the efficacy of Ayurveda and the safety of Ayurveda, right? So there has been, I will be talking about the fact what the government has done to ensure accurate communication. The fact that the APEX national program for universal health coverage, the Ayushman Bharat PMJ scheme, hopefully sooner than later will also bring the above the poverty line people. About 1 billion people will get covered under PMJAY sooner than later. If that is going to happen, how does Ayurveda and other Ayush systems play a due role there? Because it is not a favor being done to Ayurveda. It is a duty to the people of this country that an effective system which treats the root cause of diseases at the whole person level is made available to the people of this country. So no favor to be done to Ayurveda or Ayush, but as a legitimate right of the people of this country, not only of the Ayurveda sector. So I'm sure this will happen. And therefore, I want to come to the fact that we are talking about a time in 2020 when you're looking at accelerating and building the value, the credibility, and the growth potential for Ayurveda. So I repeat, how do we build, how do we accelerate the growth, the credibility, and the value that we generate in the Ayurveda sector? So unless we come together and look at a pan-Ayurveda sector, which is looking at products, services across the spectrum, right? Ayurveda foods, Ayurveda diet, Aharam, Viharam, Aushadam, Kriya, all the elements of this across both curative care, preventive care, promotive care, and bring it into one umbrella and really show for human beings, animals, agriculture, bring in the totality, we become a mega industry, which will attract for employment, for revenue generation. So with this as a opening remarks, I would like to share with you that today we have a very exciting array of sessions. Apart from the fact that we are going to cover pharmaceutical industry, Ayurveda pharmaceuticals, Ayurveda hospitals, Ayurveda wellness, Ayurveda human resource development, Ayurveda startups. In addition to this, we are going to have two very interesting sessions. One session is meeting with representatives of states, Gujarat, Orissa, Kerala, right? The key people in those state governments who are driving the healthcare initiatives relating to AYUSH would be coming in, in a subsequent next session, they would be with us. In addition, we have a central government perspective. Apart from Dr. Kotecha, we are fortunate to have Mr. P.K. Pathak, who is also going to come and talk in terms of the center and the state, the dynamics which is there. And the other very important session will be with the Delhi Health Minister, which would ensure that we get a perspective of how Ayurveda was being used in these COVID times. So across all these states, you get that picture. So industry and government picture you'd be able to get. So with this, let me now, so I encourage everybody to participate in the whole day session. It is packed. Each session is very focused. Each of the session chairmen will come out with very clear recommendations. And in the concluding session at 5 p.m. today, we would be in a position to 5:30 today, I'm sorry. We would have the good fortune of being able to present the recommendations of the chairs of each of the sessions to Vaidya Kotecha ji, in terms of what we expect, in terms of what we can do and what we can do together. This is something we want to summarize in the session from 5:30 p.m. to 6. So with this, I go to my given duty of welcoming our esteemed speakers. Padma Shri Krishna Kumar ji from Ayurveda Pharmacy unfortunately could not join us today due to some preoccupation. His blessings, his sannidhi, as we say, sanidhyam, is definitely expected, and in his absence too, because he's a father figure to the industry and his good the days ahead. Is guys by
Good morning.
early
Can you hear me?
rebirth, Indian or parts of India, but great believer in Ayurveda. So, yeah, good morning. Relentlessly working on promoting Ayurveda in the Swiss Federation. Dr. Simon?
Good morning. Yes, good morning. Namaskar from Switzerland.
Yeah.
Can you hear me?
My introduction.
Yes, Dr. Uzik, we are able to hear you.
Okay, thank you. Because I have some broadband connection issue right now. I couldn't hear you anymore. So kindly give me a sign in case you would not hear me. Thank you. So, yeah, Namaskar from Switzerland. Respected Secretary AYUSH, Dr. Rajesh Kotecha ji, and even in absence, dear Krishna Kumar ji, a father figure, dear, yes.
Dr. Simon, hold on. Just hold on, Dr. Simon. 1 second. Dr. Simone is a WHO nominated expert in Ayurveda, and she is the founder, president for the Swiss Ayurveda Medical Association. And for almost 20 years now, she's been promoting Ayurveda, authentic Ayurveda in Switzerland. So with these words, I would now like to request Dr. Simone to share her views in the next 10, 18 minutes. Please go ahead, Dr. Simone.
Thank you. Thank you. Sorry for the inconvenience. There was some broadband issue and I couldn't hear you. I thought I was supposed to speak. So then, okay, now we start for good. So then, Namaskar from Switzerland. And first, I'd like to address respected Secretary AYUSH, Dr. Rajesh Kotecha ji, and even in absence, dear Krishna Kumar ji, who is a father figure, dear dignitaries of CII, dear colleagues and guests, it's a great privilege for me to address this gathering today from Switzerland. I would like to thank CII for giving me such a generous tribune in this auspicious gathering and debate. I do believe that your action will meet with success and bear fruit in the bold and noble cause of spreading one of India's greatest legacies, first to its own people and then to the world. Today and future generations worldwide will be in need of India's various soft powers, and Ayurveda is a major one. I will briefly expose the status of Ayurveda in Switzerland, its vision for growth in Switzerland and Europe by our foundation, and the support from the Indian government that would ease the process. In Switzerland in 2009, there took place a popular vote because the people claimed for having the right of free choice of treatment. And this generated a new article in the Swiss Constitution integrating complementary and traditional medical systems in the public health system. This is a unique situation in the West so far, and we very much hope that other countries will join. Today, after many years of regulation, we start implementing practically the process. We have now government diplomas called federal diplomas for high-level training in Ayurveda for therapists and medical practitioners. We are going to regulate a PG certificate for like a specialization for medical doctors. We have had the first government exams running for the former. All these professions are reimbursed by basic and complementary insurances. We have revised the law on therapeutic products to bring Ayurveda medicines on the market as medicines and not only as food supplements.
Excellent.
We have submitted a list of 400 plants and formulations, classical formulations, to the government for recognition. They will be reimbursed then by the insurances. We have a leading training program in the country. We have different schools, but I would say one leading program. It's all by Indian teachers, syllabus inspired by CCIM syllabus and WHO benchmarks, and it covers over 5,000 training hours. We have CME running in Ayurveda and conferences where Indian doctors are always present. That is the status today. The next steps would be to more integrate Ayurveda into public health settings and develop research. But this will happen once physicians will be trained in more numbers. So the process is still beginning, and somehow we emphasized first on regulating the training for medical practitioners who are fully trained in Ayurveda, like a Vaidya in India. Not first for physicians who would have a complementary training in Ayurveda. We have that privilege in Switzerland that we have the professional category that WHO benchmarks named the category 1, type 1, which are people who are not only practicing Ayurveda as a complement to allopathy, but as a full medical system. So when it comes to COVID, it clearly showed that the people are looking for preventive care, and they are strongly turning themselves towards traditional and complementary medicines to find that help. So Ayurveda organizations in the country would give advice how to boost immune systems, and people were actively taking it. I think that was very clear. And when it came to management of acute situations, the government had clear guidelines. It would only take place in specific public settings in order to prevent the spread to continue. So we would not be in a position to care for on the curative side, but definitely on the preventive side, and that's what the population was looking for. Then when it comes to the vision and growth in Switzerland and Europe, according to the vision of our foundation, Ayurveda Foundation, the first thing is to say that people are truly keenly interested in Ayurveda. This is a fact, and it is a growing fact over the last growing process over the last decade, I would say. And increasingly, physicians are interested too. Now, so far, according to countries' policies, the Indian government or local organizations or people would like either to set up chairs in Ayurveda or to integrate the practice in private or public health settings, or do research. But this was mainly due to or related to individual initiatives, to one person who in an institution would have that interest. Few countries are there where there is some regulation and some recognition at a higher level, but mostly it's been very locally limited or limited to individual initiatives. Now, our vision for the future for Switzerland and Europe. For Switzerland, we did it. For Europe, I think it's to come, is that one should not start with the end of the cycle, means research, integration in public health settings, but the beginning of the cycle is regulation. From there, quality education, because only good regulation allows quality education and allows quality medicines. So without quality medicines, even quality educated people can't work. And we need regulations for both of them. And once we have quality education and quality medicines on the market, the end of the cycle is going on its own. It means quality services, integration, and research. And that will be a sustainable way of evolving. So in Switzerland, we were privileged in having the possibility to regulate. And from there, we were able to develop quality education programs. And now we're working towards getting quality medicines on the market. And then the rest will follow. Now, universities, yes, but not only. Because typically in Switzerland, the training of these professionals is entrusted by the government to government-recognized private schools. That gives us a lot of freedom. In this way, we were able to connect with Indian Vaidyas, Indian masters, and ask them, what would you ideally wish to have in a top-level Ayurveda program? Not limited by any constraints of any, now government institution or public institution. And also, private professional school allows kind of a Gurukulam setting, the way we traditionally are supposed to transfer the knowledge for Ayurveda. And typically our training program, Met Vaidya, that is, has the scope to train a Swiss and international elite with this 5,000 plus hours, is taking place in a private school. So that's the vision of growth for Switzerland and Europe. And then when it comes to the support from the Indian government, again, we look at it for Switzerland and for Europe and then India and global. For Switzerland, we will definitely need an intergovernmental dialogue to be set up where private sector obviously also shall participate. We won't need it for regulations anymore, and even not really for quality education, because already it's happening all with the Indian, I would say, Ayurveda elite. But we would need it to finish the process of bringing quality medicines on the market. The law has been revised, the lists have been submitted. These lists were made by Indian experts. And now what we need is a fine coordinated strategy to approach the Swiss government and administration. But for this, we need to be guided by a senior country representative of Ayurveda. It's not me, but a legal advisor, someone who knows the system. This to overcome the hurdles that obviously are on that path. And we have such people in the country. So if the government and even the private sector of India agree to collaborate, I think that might be an effective step. And the second important point on that path is to update monographs of medicinal plants and documentation of formulations, which have been very nicely already prepared in the Ayurvedic Formulary and Pharmacopoeia of India, but to reach really international standards where we have a documentation where we can say, okay, see, we have state-of-the-art documentation, here it is, that's what we want to get recognized. I think if there can be some upgrading done, it would help a lot. And then the third point, largely hugely discussed over the last decade, is ensure the quality control for export for medicines. That's a very sensitive point. It, of course, concerns safety. of the products, the packaging, the labeling. And sometimes I feel in these debates, we are so much overwhelmed by the idea of ensuring safety, packaging, and labeling that we don't speak about the quality of the Ayurveda product, the Ayurveda quality anymore. I mean, if we want to deliver this quality service, then it's not enough to have quality education. We need not only nicely packed medicines, we need top Ayurveda quality, because then we will have the results and that will make us succeed. Then we will be credible. And for Europe, we do believe that if in Switzerland we can finish up establishing these benchmarks in collaboration with the Indian government and private sector, and have it on the Swiss market, be it on the educational market and the medicines, then the spread to Europe will not be so difficult. So that's an important step. Yet then behind, of course, the intergovernmental dialogues with other countries, European countries, will be important to be done by the Indian government. And in case it's not possible directly to go to regulatory steps, and yeah, I mean, then we can at least, perhaps one could emphasize on pushing for quality education, because AYUSH together with WHO have made very nice benchmarks for Ayurveda. I was a WHO expert and co-rapporteur in the Ayurveda group, and I can really state the work that has been done is commendable, is useful for any country. And the Indian government, while doing that effort with other European or other countries, can definitely take this as a foundation. And of course, then the quality medicines, where we do believe, as I mentioned earlier, that whatever we will be able to do in the Swiss market will be helping in these countries. And then the last point to complete my interaction is for India and for the global Ayurveda scenario. One thing could be done that would have a very strong impact, especially in times of repeated epidemics. This would be cohort study conducted in India. The only place where you can really do that is in India. The cohort study means there would be, for example, 10,000 Indians in an Ayurveda group in North, 10,000 in Central India, 10,000 in the South, and then 10,000 in each place is in the normal group, allopathy or whatever. And the people in the Ayurveda group, they would go by Ahara, Vihara, Aushadha in Ayurveda. Means when they have a problem, a health problem, it would be tackled with Ayurveda, unless the doctor would feel now it needs another intervention. And then yearly follow up of these people over 5, 10, 15, 20, 30 years. Normally, such a study should show that the Ayurveda group has stronger immunity, can be treated with less side effects, has less chronic degenerative disease. And that would be an extraordinary boost, one of the strongest impacts on population, scientific community, and policymakers for Ayurveda. So thank you very much for giving me that time for your patient listening, and looking forward to listening to the other speakers.
Dr. Simone, thank you very much. I think it was a very crisp, very focused set of recommendations and position updation from you. I'm sure that we'll be taking most of these suggestions forward to government formally as part of our representation. Thank you very much. I'm sure Secretary Ayush would also respond to some of those points. Dr. Naresh Trehan was supposed to speak in the order of speakers, but I guess he'll be joining a little later in the conversation. I have indeed great pleasure on behalf of the CII and the Core Ayurveda group at the CII to welcome our esteemed keynote speaker for the day, Padma Shri Vaidya Rajesh Kotecha. He, in the last 4.5 years that he's been in office, has been a transformational role. He's played a transformational role for the sector, right? At a key time when the sector was looking for direction, if you can look at step by step, you can't build Rome in a day. But I think in terms of building Rome, the foundation layer by layer, what Kotecha ji could really do is to bring in that new enthusiasm, new direction, focus into all the elements of government planning and execution. He's been a change maker who's taken responsibility for the Ayush sector. You can see in recent times, he's been very forthright in telling no claims, build evidence. Without building evidence, no claims. When people come out with advertising in Ayurveda on magical remedies, how his ministry has gone out very unequivocally to tell, no, this is not permitted. This is not faith medicines. This is a science-based approach. It's a very knowledge framework. We don't have to call it alternate medicine. So a person who's proud about the tradition, Padma Shri, Vice Chancellor, a former Vice Chancellor of an institute of national importance, one of the 10 best universities in the country, he has brought in a new direction. I'll give you a couple of key points. Getting Ayurveda into the armed forces medical services, getting Ayurveda into the railways, ensuring most recently that the insurance outreach, but in addition, things like the Jana Ushadhi, right? Getting 6,500 stores where the common man can buy Ayurveda medicines. These are small steps, but in one sense, opens up the mainstreaming of Ayurveda sector. In the context of Atmanirbharta and Atmanirbharta in healthcare today, Ayurveda gives us the best possible opportunity. In this context, we would like our visionary Secretary of AYUSH to talk about his vision, goals, and action plan for Ayurveda, particularly the next 2 years and the next 5 years. So thank you very much, Dr. Kotecha, for being here today, and kindly commensurate this, please. Thank you very much. Dr. Kotecha?
Sir, kindly unmute yourself. Sir, kindly unmute yourself.
Yeah. Am I audible now?
Yes, sir.
Yeah.
Thank you. The CII team, the respected panelist, I can see that Honorable Minister of Health, Government of Kerala, Mrs. Reja teacher is also here. So welcome, ma'am, and thank you for participating. Dr. Simon Hunzikar, Rajiv Vasudevanji, Dr. Madhavan Kutti Warriorji, other dignitaries, and all participants. It's a privilege, it's a pleasure for me to be here on this day of a very important event about visions, goals, and action plans into the sector. So Rajiv ji have actually set the tone in the beginning, and it is very crisp, very precise. So it helped also me to look at my perspective, what I'm going to talk. Dr. Hunzikar also, she was very crisp, and it's a very eye-opening, very informative talk given by her. And she rightly said that whatever we are able to do in Switzerland, we can easily percolate it into European Union and further to the rest of. It's a window for Ayurveda to go global. So thank you, Dr. Hunzikar, for this important insight. I would like to begin with the recent developments. We all know that our country is facing this, not our country, globally, everybody, all the humankind is facing this pandemic of COVID-19 crisis, and India is no exception. So from the beginning only, we were very much on board for the mitigation of COVID-19 in country, and there was a very specific strategy. Rajiv ji rightly said that we have tried not to put big teams, but we have made a strategy based on available evidences and science. So there were two types of strategy we have put forward. One is immunomodulation. In lot of Ayurvedic professionals tells it immune booster, but when we tell immune booster, it is misinterpreted by our modern counterpart think they're messing with the pathology of COVID-19, and then we are actually damaging the people who is infected, because then they are probably more susceptible to cytokine storms. But it is not true. We all know from Ayurvedic sector that when we talk about immunomodulation, we talk about rasayana, we are talking about Vyadik Samatva, or we are talking about adaptogens, and it is all together different approach than immunity boosting, what from the perspective of modern medicine. So we have, based on lot of empirical evidences, we have projected Guduchi, Ashwagandha, Pipali, and so many other candidates for the prophylaxis purpose. And we also have initiated a lot of studies on add-on therapy or standalone therapy of Ayurveda for the management of COVID-19. You won't believe, but it was a very big mega effort. This mega effort is in the just some example that we have initiated a study at 91 sites only by National Institute and Research Councils of Government of India. But other than Government of India, we were working with several states, several other universities, and altogether around 150 sites. There were different studies. Could be a standalone of COVID-19 or prophylaxis or add-on therapies. So there are different designs, right from randomized control trial to prophylaxis study to open label study to observation studies to even social study on impact assessment of AYUSH intervention for immunity. So a lot of different designs of studies. So we started with establishment of an interdisciplinary task force headed by Vice Chairman of UGC, Professor Patwardhan, and it contained all different sectors of scientists, including AIMS and CSIR and ICMR and all other big organizations, and AYUSH representatives also, including CCIAS. So this task force has really delivered a great deal of different standards, clinical protocols, designs of studies, etc. And we have worked with Ministry of Welfare, Ministry of Science and Technology, Government of India, and through CSIR, we have initiated several studies on Ashwagandha as a prophylaxis, on Guduchi as a prophylaxis, or as an add-on therapy, Guduchi Pipali or IU64. Now we are in the middle of all these studies. We have initiated also prophylaxis studies, and these prophylaxis studies, the sample size is more than 250,000 across the country. This is all about different candidates, including homeopathy, Unani, Siddha, and Ayurveda medicines. We also initiated several studies on yoga intervention on COVID patients. So when we talk about Ayurveda, there is a 150,000 sample size across the country. I want to cite just one example, an interim outcome of such mega efforts, that we have collaborated with Delhi Police. Delhi Police have 80,000 police personnel working as a frontline warriors into Delhi. Delhi is one of the hotspot, and there is more than 150,000 patients of COVID-19. So these people were given an Ayuraksha kit having Chavanprash, Shanshamari Vati, Anutel, and an Ayush Kvat that we have recommended as a self-care, which contains the cinnamon and tulsi and black pepper and cinnamon, tulsi, black pepper, and ginger. So, and then we are recommended to take with either jaggery or take with either raisins and and it was very popular. So we have given this to 80,000 people, and over the 2 months period of time from the baseline and after 2 months, the interim results are outstanding and actually unbelievable, because when we started, they had a lot of incidence rate, and it came down to up to 4 times it came down in 2 months, where the general population of Delhi, it went up to more than 2 times. So in general population, it went up to 2 times, and in Delhi police, it went down 4 times. So this is, and whereas this comparison is also not good, because general populations are not frontline warriors. These are the frontline warriors. And then mortality in Delhi is when we took at a baseline on 20th July, it was 2.92. It came down further. For general population, in Delhi police, it was only 0.47, 0.47. So these are the the impressive outcome of prophylaxis of large sample size. 80,000 sample size is not a small number. So such kind of results we are getting, and then we are in the process of finalizing the data, etc. Another example I want to cite is about Ayush Sanjeevani application. We have launched an application known as Ayush Sanjeevani, and our aim is to uh, to have an impact assessment from social perspective. How much is the acceptability of Ayush intervention, self-care guidelines, etc. in the people of India? And we were expecting, we had a target of 5 million data set, and by the date 31st July, it was our closing date, and by 31st July we had received 15 million data sets. In place of 5 million, we got 15 million data sets. So, and then the initial results, which is still under process, but 93% of these respondents have acknowledged that they have used some of the other Ayush interventions and they were benefited. So this is very big, kind of an impact assessment study. And never happened, these kind of studies. So I will also, mention the attention of Government of India, even from the highest position. Our Honorable Prime Minister have mentioned, encourage the people to follow the advisories of Ayush Ministry, the immunity promotion advisories, self-care advisories. These advisories were so simple, easy to understand. It was in the heart of the people. They were already doing it, like haldi wala doodh, the milk with turmeric, or taking warm water, or applying ghee on the nostrils, or taking this Ayush Kaya as a herbal tea. On those kind of simple remedies, we have taken it very seriously. And one of the important inference that we are looking for is that in India, though numbers are spreading very fast, but in India, the most numbers of more than 70%, more than 75% of the infected COVID-19 people, they are asymptomatic, which is not common in the rest of the world. So this could be probably, we still are looking for inferences from our studies, but primarily we can see that one of the contributory factors, the following of the immunity guideline by the Ayush Ministry, and that is keeping the people either asymptomatic or mild symptom. Now most of the patients do not need even hospitalization. They just stay home, and they are recovering in just a few days. And it's like, it is true in the tune of 90%. Only 10% people are requiring hospitalization, and out of 10%, only 1% are going into complications or severe symptoms. So the mortality rate of India is coming down every day. This is another kind of example that beginning it was more than 3.5%. In some states it was up to 7%. Now in our country today, as on today, it is only 1.91%, and it is coming down on almost every day. In last 1 week, it came down from 2% to 1.91%, and we are hoping that the country per se will be able to bring it down for less than 1%, which are the great achievement when we look at the country perspective and when we compare with the global statistics. So I'm sure that I spoke a little bit at length about researches, but I thought that it is good to disseminate such very important information to the audience, because now we are trying to get these interventions, because we have a lot of now generated evidences, there are a lot of empirical evidences. We are trying that these interventions Ayurveda and Yoga should come into the national protocol of COVID management, and we are trying for that, and hopefully it will come in next few days. So this is a greatest thing. When we look at the vision, goals, and action plan, let me put some important facts on board. Rajiv ji already mentioned something, but to make things institutionalized, there are two ways to approach. One is that you take some short-term measures, issue some notices, or do some corrective actions, but without making the things institutionalized, long-term achievements are not possible. So, for example, we have initiated, the first ever the upgradation of an institute like Gujarat Ayurveda University as an institute of national importance. This is first in AYUSH, and it is to be done by the act of the parliament, and it is the bill is approved by the government, and it is passed by the Lok Sabha, and it is pending with the Rajya Sabha. So probably in this session it will be passed. This is one thing. So at least we have one institute important which is able to carry forward the important benchmarks in the area of education and research. The other thing is that we have also initiated two bills for the reforms in education. Dr. Hunziker rightly said that quality education is the key, and then we also look at possibility of Guru Shishya Parampara, or those kind of traditional teaching also. So we have incorporated that provision into the new bill, and this bill also, it was introduced last year in the Parliament, and it was referred to the Select Committee of Parliamentary Committee, and it is cleared from there, and it is again put into Rajya Sabha, and it is cleared by Rajya Sabha. Now it is pending with Lok Sabha. So in this session, 3 bills of AYUSH will be cleared, and this will set a big benchmark in the area of AYUSH education and research. Third thing I want to mention that Dr. Hunziker also mentioned about quality medicine, upgradation of pharmacopoeias. We have definitely attention about that. There was a glitch into the regulation because in our pharmacopoeia there was 3 agencies working in the same area, and there were some conflict of interest. Then there is some issue with the these 3 agencies. One is Homeopathy Pharmacopoeia, one is Pharmacopoeia Laboratory of Indian Medicine, and one is Pharmacopoeia Commission of Indian Medicine. So recently, last month only, in the month of July only, in the month of June only, the government of India through the Union Cabinet, Cabinet has approved our proposal to amalgamate, to make this one unit of Pharmacopoeia Commission, and then this commission will be only one agency and not 3 agencies. They are all clubbed together. So we will be able to now to deliver quality contents and quality delivery in the area of pharmacopoeia standards. This is a long-term agenda, and this will ensure the quality medicines. There is one more thing coming up, and that is also institutional kind of the upgradation in the area of AYUSH. That we have put a proposal against the Union Cabinet about introducing the AYUSH Pharmacy Council Bill, which is regulation of AYUSH human research in the area of pharmaceuticals, human resource of pharmacies and manufacturing, and also the pharmacist of AYUSH. So it is at the last stage. Probably Union Cabinet will take up very shortly. It will also come into the Parliament, and then this is another benchmark that we are trying to achieve, and I am sure that it will happen. One more thing I want to mention is about long-term approach about the quality medicine is to arrange the quality raw material, quality plant material is a raw material for the industry. It is a big problem as of now for the industry, that industry is not getting good raw material, quality raw material from the cultivators or from the resources, and it is an unorganized industry. That problem, because that brings in possibility of the biological load, heavy metal contamination, etc. So under the Atmanirbhar, the Self-Reliant India package declared by Honorable Finance Minister of India, one of the package is 4,000 crore scheme of cultivation of medicinal plants. So I want to mention that we have taken this as an opportunity, and just wanted to mention that 4,000 crore is 2 times of the annual budget of AYUSH Ministry. So they have given us the responsibility of a scheme for 2 years, is the 2 times of the budget of the regular budget to the ministry. So we have, we did work with several other stakeholders, including the Rural Development Ministry, science organizations like CSIR and ICMR and ICAR, Agriculture Ministry, and CII and so all stakeholder consultation is done. His financial approval is also done. We were agreed for extending scheme in place of 2 to 3 years. So 3-year scheme will be there, and it is also in a final stage going to the cabinet. Probably, hopefully, it will come into next 2 weeks. So this is a scheme where we have put like a backward integration or forward integration. So as a matter of backward integration, we are connecting industry and farmers, and for forward integration, we are also connecting the farmers to the industry and making a supply chain of quality planting material. So we are trying to provide the quality material for the planting to the farmers, and farmers are encouraged to plant. And then we are also creating a mechanism of buyback guarantee from them, from the industry. We spoke with industry. I am very happy to communicate to disseminate this information through this forum that industry's response is very warm, and lot of industry, AYUSH industry, Ayurveda industry, they have committed for coming forward to invest and to provide the buyback guarantee to the farmers. So this is that we are working. One more thing is that there is another scheme when we talk about the wellness. There is another institutionalization we are trying to get is through championship services sector. In championship services is a commerce ministry, is a coordinating agency, but the idea is to make India as a world-class destination for services. One of the services is wellness tourism or the health tourism. So we all know that in health tourism and wellness tourism, the contribution of AYUSH is enormous. Thousands of people coming to India for the treatments of Panchakarma in Ayurveda, or having yoga retreats or yoga training in India. In the particularly, some cities are becoming like epicenters or having benchmark institutions like Mysuru and Rishikesh. So thousands of people are coming. So we have recently launched this in championship services, and all, including the foreign institutional investors are invited for investing into this sector, and government of India will be happy to provide the support through interest subsidy if somebody is taking loan, or providing the IT support, or providing the skilling to the paramedicals of AYUSH, and also the AYUSH professionals as an entrepreneur. So we have tied up with MSME ministry, and already we have started with the training or entrepreneurship development into the AYUSH professionals. One of the important thing of this championship services is that we are also trying to establish incubation centers. So one of the incubation center for startups are coming in Holy Institute of Ayurveda, and all through this platform, I want to invite the private entrepreneurs and the industry to come forward for establishing incubation center. This is also one of the important that we are looking for. And AYUSH CII only have initiated this, in the year of 2017. CII, with the help of ENY, they did initiate a study in which they have visualized that if we have concentrated effort and is a organized effort, then probably in the 3 billion industry of AYUSH can be taken to $10 billion in next 5 years. So we are actually on it, and we have planned accordingly. For example, the Invest India Invest India is now coming to Ministry of AYUSH, and then we are creating a separate vertical. Invest India professionals are now will be sitting in AYUSH ministry and helping the AYUSH industry and AYUSH ministry to work together and to propagate and to facilitate industry for investment or facilitation or ease of doing business or single window system. All these things are happening. It will happen in next few weeks. So this is another vertical about these championship services. One more thing that we also want to mention, that in Drug Control General of India, CDSCO, Central Drug Standards Organization. In CDSCO, recently Government of India have created a vertical of AYUSH. We all know that this licensing is to be done by the states, but then some states, it is easy to get license of spurious products. So we are trying to develop a mechanism that if some proprietary medicine is there, if some research-based medicine is there, this vertical will be able to qualitatively look into those evidences and provide go ahead to the states for the licensing. And also we are trying to also develop a mechanism of easing of the COPP marking or WHO GMP benchmarking for industry. So we are trying to ease. The last week only I had a meeting with the Drug Control General of India, and he also agreed that we need to do some ease of doing business into this area because it is so complicated. So from the complicated benchmarks or complicated procedures, we are trying to ease it so that more and more industry can get COPP, and that also caters the agenda or suggestions of Dr. Hunzikar, who mentioned about that there should be some benchmark of the products we exported as a qualitative product. It's not only labeling and requirements of other regulatory thing, but the medicines should be actually qualitatively good. So that area also we are trying to cater. I want to mention also that in addition to all these efforts, we also um, we are also into the healthcare, like in entry level. First time in the history of India, because in 2017 the national policy mentioned AYUSH sector should be mainstreamed in. So we are having that mandate, and we all know that this Pradhan Mantri Jan Arogya Yojana, that is the providing insurance scheme, insurance benefits to the large portion of the Indian population, in the tune of like two-thirds of Indian population is covered, and this is a free insurance scheme by Government of India. So Ayush intervention or Ayush schemes, Ayush insurance was not covered until now, but now we are at the final stage of negotiating with this agency. They are now about to declare these packages of Ayurveda and other Ayush sciences, and I want to compliment say Rajiv Vasudevanji for contributing immensely into this area. And he and his team, actually Dr. Warrior is also here. He was also there in the team. We have requested this team to help us devising the packages of Ayush, and then they did wonderful job. Very, very crisp, very detailed packages they have developed, evolved, and in principle agreement is already received from this Pradhan Mantri Jan Arogya Yojana. Other vertical of the Ayushman Bharat is having 150,000 of health and wellness centers, and in these centers, all of these health and wellness centers, there are packages of wellness is having Ayush, particularly yoga, and 10 wellness centers are given to Ministry of Ayush as a standalone Ayush intervention. So at entry level of healthcare and wellness and preventive health, this is first time in the history of Indian government that it is happening, and we already have started. We are working with the states. Honorable Minister of Kerala, Srimati Shailaja, is here, and I'm happy to note that also one of the active partner, and we are getting a lot of good support from Kerala and all other states, not only Kerala, but states are. And in this year only, we will be able to establish 4,000 plus health and wellness centers. In next 3 years, we will be able to establish 12,500 health and wellness centers. So this is another kind of vertical. And at the end, I want to also mention that all these efforts, as I mentioned, when I started in the beginning of my speech, I mentioned that doing thing as a corrective action is having short-term impact. But if we have an idea of making things institutionalized and then making things correct, and then providing and trying to get quality people on board and quality services on board, or quality delivery system on board, then all these things probably are able to deliver. So that is happening. And there is a last corrective statement that Rajivji, I'm not here since 4.5 years, is only 3 years. So thank you so much, and lots of compliments to CII team, and namaskar.
Thank you very much, Vaidya Kotecha ji. I think it was a extremely enlightening session from you, or talk by you, because going from right from the beginning, laying the context about institutional building, right, at a national level, and planning not short-term, long-term, and all the steps that have been taken, not just in the COVID context, but the larger nation-building context, Ayurveda building context, is much, much appreciated. The fact that in the next few days, we are expecting Ayurveda to be included in the curative aspect of the national COVID protocol would be a milestone step later than, sooner than later, as we say, later than never. It will really bring tremendous confidence, the champion sector program. So many things you have outlined. We'll be noting all of this. And from industry, we just want to thank you for your leadership, for your vision setting, and for working with an open mind with industry and other stakeholders in the Ayurveda sector. So since we're running against our time, I would now want to, after thanking Vaidya Kotecha ji and his entire team at AYUSH, Ministry of AYUSH, who are being very dynamic in addressing the change process in Ayurveda, I would now like to welcome Dr. Naresh Trehan, who is the chairman of the National Healthcare Council at the CII, and an eminent cardiothoracic surgeon, a Padma Bhushan, and a person who's been a visionary in everything that he has done. Visionary not only in the primary field he represents, but 15 years back, much before Ayurveda came into vogue, etc., this primary ambassador of modern medicine, very strongly advocating yoga, Ayurveda as a clear other half, complementary half to modern medicine, how together it can serve the needs of the people of India and the world. So, he is now here to share his views from both the National Healthcare Council angle as well as the overall modern medicine, integrated medicine angle, how we can take this forward. Dr. Trehan, thank you for being here.
Thank you, Rajiv. I must say I really enjoyed the roadmap laid out by Kotecha ji, and I want to take this opportunity to welcome Srimati Shailaja ji, from who's already joined it. Also, she's on the next session, but I wanted to acknowledge her presence and thank you for joining us. And also Simone and Mr. Warrior, and also the additional secretary Pramod Kumar Pathak. So I just want to acknowledge that they are there, and thank you for joining in really to make this a success. So I come from a different perspective to all of you, Kotecha ji especially. That I, like Rajiv Vasudevan said, that I am a believer that we have a huge opportunity to not only use the word complementary, which everybody else is using, that modern medicine and Ayurveda can have complementary role and all that. I think that is too primitive a thought process. I think we need to go to the next step, which is actually convergence. Convergence ultimately into fusion. So I would say that out of India will emerge the new medicine, which will either be known as Med-Ayu or Ayu-Med, and we would have actually converged into therapies. So we bring to the table a strong science from both sides. We know how strong and what gems there exist in the AYUSH space. There has been documentation, there is for hundreds of years, there has been practice of it, there has been documentation of it. So a lot of that work has done on that AYUSH side. Whereas about modern medicine, the spine of modern medicine is basically scientific validation of everything we want to do. And that's a good process. Now, what is the problem that has existed in our effort? Because we are one of the few hospitals, for everybody's information, that we have taken that step towards the fusion that Rajiv Vasudevan has implanted his hospital in our hospital. So we are working together. Now, does that mean that we have made significant progress in our idea that the new era medicine will emerge out of India? Maybe not in my lifetime, maybe later. But I have a very strong belief with which I've been working with for long periods of time to say that let's create these two real valuable pieces, do all the validation that we can do on the AYUSH side, do all the validation where we can prepare ourselves to actually create that amalgam between the two sciences, which will actually, I think, will be the biggest benefit to humanity. If you start from that point of view of today, there is no country in the world which has a perfect healthcare delivery system. Even US with all its wealth has got 30-40 million people who are always out of the loop. UK is cutting down from 100 billion for NHS, want to get down to 80 billion, and you know what will be marginalized. And they have a lot of limitations with that. France is teetering on collapse of their healthcare system. So there is no perfect system. And given India and given populations like ours, where we have 4 billion people around us who share the same economic fate as we do, still the fundamental of education and health has to be provided to everybody. So I'm saying two things will happen. One, accessibility will increase, will improve, because there is a whole army of AYUSH practitioners and a whole army of doctors. We are in different silos. We don't respect or regard each other. And what underlies this whole thing is it anxiety of competition? Is it anxiety of being isolated? Is it anxiety that patients may prefer one or the other? I think that those are the things that we need to wipe out, Kotesha ji, and take it to the next step. I, for one, am a frontline warrior for AYUMED. And I think that I believe that we will create that magic one day. But we need, I'm a doer. I don't have the time, unfortunately, because I'm operating, I'm doing this, I'm doing that all day. But I need help from somebody like you, Dr. Kotesha ji, and Rajiv Vasudevan. I always complain to him, and I will do it in public also, that he does not give enough time to this, bringing this thing together, and maybe he has some anxieties which he and I have to work out over lunch or dinner or something. But there is nothing to fear. We know that there are we are practicing on a daily basis. You will not believe the results we have had in trying to combine the therapies in strokes, in neurological disorders, in heart disorders. So we are in metabolic disorders. So there is a proof of it. I'm not saying because I dreamt of it and I'm a believer. I'm saying because I see it. And I see that there are two different approaches. One, we know modern medicine has only one mantra, and that is to disregard the body and say, we know everything, you have a problem, we'll fix it for you. That's the mantra. And then to accomplish that, we will either give poisons, or we'll do surgery, or we'll do radiation. These are the three things, and we are very good at it. And we get good results also. It's not like we don't get good results. But what it means is that it is invasive, disregards the body completely, expensive, successful. These are the three things that are the truths about it. On the other hand, you have all the traditional sciences. That is all that comes under AYUSH, even Chinese, and there are other countries also who have good traditional medicines. And they only believe that they will work through the body to fight the disease. So isn't it a natural logic that if we combine the power of the two, we would be the winners? The patient will be the winner, and we would reduce the cost by half and make it imminently more affordable for the world. So this is just my thought. I don't know, I might go to my grave with this thought and never realize it. But I think that there is something there. And if you, in your wisdom, believe, Kotesha ji, that your ministry will not only look at AYUSH, but will look at the other part of it also and say, where can we find that middle ground where we can actually create that magic? So with that thought, I'd leave you to say, take the lead, sir. If you would do it, we are right behind you. At least Rajiv and I are right behind you.
Yep.
And we have Simone on the other side, with which they have a huge amount of science and organization. And if we can pull Simone into this concept, I'm sure we will be able to make some progress in short period of time. This is so I may be overshooting, but that's my
Right.
Simone. I want to invite you to be part of Rajiv, Vasudevan, you and me, under the guidance of Mr. Kotecha. We may be able to do some things. And it's raining today out here very heavily. That's how I got late, sir. There's all the highways are jammed. But it also says in our Indian mythology, when it rains, things happen, and it's blessing. So maybe this is the beginning of something which is being blessed by the gods. Sorry.
May your words come true in the short term, Dr. Trehan. Thank you very much for an inspirational address. I think it really following what Vaidya Kotecha and earlier Dr. Simone said. I think you really bring it together to say what the future for India to be a world leader in healthcare actually offers. And I hope that even Shailija teacher from Kerala and the other esteemed guests who are here will see that integration which is possible, and how to really make a win-win possible.
But I will take this opportunity to get your commitment that you will put it on first priority and commerce.
Done. Yes, I commit to that. Yeah.
Dr. Trehanji, I want to add something, Dr. Trehanji, that last week only I met the new Health Secretary, Sri Rajesh Bhushanji, and then we did agree on or creating this middle ground. So let's hope for good. Yeah. Mm-hmm.
So if there's anything I can do, I am volunteering.
Thank you, sir.
All right. Okay.
Thank you very much.
Love to see that one day.
Thank you. Now, coming to the conclusion of today's session, I would like to invite Dr. P.M. Warrier, who is a governing council member of the CII Ayurveda Group, the head of the Kerala State Ayurveda Panel, chief physician, member of the Board of Trustees, esteemed senior physician from a legendary institution. Dr. P.M. Warrier, I would request you to take it.
Thank you, Rajiv Vasudevan. Am I audible? Dignitaries who have spoken at the inaugural session and the learned friends who are attending this webinar on CII Digital Platform, a very good afternoon. This inaugural session marks the beginning of an important conference conceived and conducted by CII. Global Ayurveda Conference 2020 being held as a part of India Healthcare Week is an event which has a theme which is futuristic in content and approach. Resurgent Ayurveda, leveraging global potential, is a theme which looks at future with great hope and aspiration. The human population all across the world is passing through a grave situation of health concern. But we are sure that, as in similar past situations, the collective efforts of global healthcare experts will come out with tangible solutions in the present scenario too. In that collective human effort, there are many who believe that Ayurveda too can contribute in a significant manner. Ayurveda, as all of us will agree, is passing through a state of transition. This conference is aimed at taking stock of the Ayurvedic capabilities and track record and plan for the future. It is my pleasant duty now to propose a vote of thanks for all those who made this inaugural session a success. The energetic and motivating Secretary of AYUSH, Padma Shri Vaidya Rajesh Kotecha, is a great motivator for the whole Ayurvedic fraternity. He leads the system from the front. His leadership has provided a sense of direction to the national efforts of Ayurvedic growth on behalf of CII it is my pleasure to express our sincere thanks for his presence and for his important speech on vision, goals, and action plan for the Ayurvedic sector 2020. Dr. Shimon Hansiker has come from Switzerland to be present on this occasion. On behalf of Confederation of Indian Industry, I have great pleasure to express our gratitude to Dr. Shimona for talking about the Swiss experience. Dr. Naresh Trahan, the CMD of Medanta, is a senior healthcare expert from India. His association with this event adds value to the efforts of Confederation of Indian Industry. On behalf of CII, I have great pleasure to express our sincere sense of appreciation and gratitude to Dr. Trahan for his valuable presence and for expressing his views. Sri Rajiv Vasudevan welcomed the participants and made opening remarks. He is actually a part of the organizers, yet as a formal gesture, I thank him on behalf of CII. This kind of an effort becomes successful and achieves its objectives its objectives because of learned professionals like the present audience. It is our present duty for me to express sincere thanks to all the distant audience connected on the CII Digital Platform for the valuable attendance today. And I thank our Honorable Health Minister of Kerala, Srimati Shailja Teacher, for her presence. Thank you, one and all. Thank you.
I think originally there was a small time gap.
Not audible, Rajiv.
Yeah. So I just wanted to check with Rakhi and Deepa. Are we continuing right away, or do we take a 5-minute break?
Sir, I think we can continue right away. We have
yes.
people who have joined. So I suggest we continue, sir.
Okay, that's wonderful. So in which case we are almost on time, and it's been a very, very exhilarating first session for the day. And we have a very different session that is now emerging, which is the session on the role of Ayurveda in the various states public health program, which has come into focus in particular during the COVID crisis, because many state governments then accelerated the adoption of Ayurveda and AYUSH in their public health, community health programs. With this, we are very fortunate today to have representatives from the states of Kerala, the esteemed Honorable Minister for Health and Social Welfare or Social Justice, Government of Kerala, Srimati Shailja Teacher. We have Dr. Bhavna Patel, Director AYUSH, Government of Gujarat. We have Mr. Ashok Kumar Nayak, Special Secretary, Department of Health and Family Welfare, Government of Odisha. And to give the central government perspective, we have the presence of Shri Pramod Kumar Pathak, Additional Secretary, Ministry of AYUSH, Government of India. So when we look at this in the context of, just 1 second, yeah, I'll get my notes. Yeah, so what I would like to request our esteemed speakers who are here, as I introduced each one of them specifically, to provide a status of the adoption of AYUSH and Ayurveda in particular in their states. To what extent was it used in the COVID battle against COVID in your state? What was how was it used? What are the outcomes of what you did? Importantly, what is your vision and plan for incorporation of Ayurveda within your larger health strategy for the state, particularly with respect to public health and also the private sector? So these are the points: the current status, how within the context of COVID it has been used, what is your vision for the future, and particularly with respect to public health and the private sector. Yeah. So we have to understand that there are different levels of maturity in each of the states that we are looking at in terms of the adoption of Ayurveda, right? The supply of doctors, the demand for Ayurveda. So health being a state subject, there is a need to realize, we all realize that the states can take a greater lead in furthering the cause of Ayurveda. So when we look at public health, we also need to look at tribal health. We need to look at urban poor. For example, in a conference organized by the MP government, there was a esteemed speaker, Dr. Abhay Ban, who talked about a disproportionate burden of disease on the tribals, right? So when you're looking at all of this, Ayurveda can be clearly there at the forefront of this larger health promotion, disease prevention, and disease management. So this aspect, and urban poor equally. I want to bring in the final point about NCDs and communicable diseases. So far, Ayurveda has been talking more in the context of NCDs, but I think we have an equal relevance in the context of communicable diseases. And the COVID pandemic has given us the world to see an opportunity, as Vaidya Kotecha shared with us, what credible evidence is now built and going to be presented in the coming weeks and months to show that it is effective. So we see a time for a sea change. And now I would like to request our first speaker for the day to give the perspective from Gujarat, Dr. Bhavna Patel, Director AYUSH, Government of Gujarat. Dr. Patel, please initiate your speech.
नमस्कार, मैं गुजरात में वैद्य भावनाबेन पटेल के यहाँ डायरेक्टर आयुष मीटिंग में एक अर्जेंट जाना हुआ है, तो मुझे रिप्रेजेंट करने का कहा है। मैं वैद्य फाल्गुन पटेल, डेप्यूटी डायरेक्टर ट्रेनिंग एंड रिसर्च। तो गुजरात में जो यहाँ आयुष में कोविड-19 को लेके बड़ी कामगिरी हुई, हमारे माननीय सेक्रेटरी वैद्य राजेश कोटेचा जी ने भी हमें बहुत गाइड किया, और हमारे यहाँ अग्र सचिव माननीय डॉक्टर जयंती रवि मैडम, उन्होंने भी आयुष को बहुत ही प्रमोट किया, बहुत ही कोऑपरेट किया, और आज गुजरात में बहुत बड़े पैमाने पे आयुष की एक्टिविटी कोविड-19 में हुई। मैं कुछ यहाँ आपकी जानकारी के लिए कुछ कामगिरी को बताना चाहूंगा कि मार्च 20 से यहाँ पे रोग प्रतिकारक शक्ति बढ़ाने के लिए काढ़े का वितरण का काम हमारा यहाँ शुरू कर दिया गया था, और जैसे ही आयुष मिनिस्ट्री की गाइडलाइन हुई, उसी समय हमारी मीटिंग यहाँ हमने बुलाई थी 21 से भी ज्यादा आयुर्वेद के एक्सपर्ट की, और एक पूरी गाइडलाइन गुजरात स्टेट ने भी ये कोविड-19 में आयुष के द्वारा ये रोग को रोकने के लिए जो एक्टिविटी है उसके लिए एक मीटिंग हुई थी। उसमें निष्कर्ष हुआ कि सबसे पहले गुजरात में बड़े पैमाने पर आयुष का काढ़ा उसका वितरण हो, जो हमारी लगभग 540 से भी ज्यादा डिस्पेंसरी है, 35 से भी ज्यादा गवर्नमेंट आयुर्वेद हॉस्पिटल है, और साथ में होम्योपैथिक डिस्पेंसरी भी हमारी 150 से भी ज्यादा है। तो उन सब में एक साथ के रूप में हमने काढ़े का वितरण एक शुरू किया, हमारा जो मैन पावर था उसके द्वारा। तो आज आपको मुझे बताते हुए हर्ष होता है कि आज तक हमने 6 करोड़ से भी ज्यादा उसके डोज का वितरण किया है, प्रिपेयर करके बना के बेचा है, तो फ्री ऑफ कॉस्ट हमने वितरण किया है। तो लगभग 80 लाख से 1 करोड़ तक की जनता ने एक काढ़ा हम एक जगह पे 5 दिन मैक्सिमम 5 से 7 दिन तक प्रोवाइड करते हैं, तो हमारी ओर से बना के। तो ऐसे देखा जाए तो 80 लाख से 1 करोड़ जितने लोगों को आयुष डिपार्टमेंट की ओर से फ्री ऑफ कॉस्ट आयुर्वेद का इम्यूनिटी वर्धक काढ़ा दिया है। तो उसका एक ड्रामेटिक चेंज हमें देखने को मिला कि काफी जगह पे इसका जो कोविड-19 का जब हॉटस्पॉट अहमदाबाद था, तो अहमदाबाद के सभी विस्तार में हमने काढ़ा वितरण किया, तो काफी वो फैलने से बचा। आज हमारा गुजरात का मोस्ट ऑफ सभी गांव के लोगों ने भी आयुर्वेद काढ़ा पिया है, जो भी शहर है नगर है उसके हर एक मोहल्ला में, तो हर एक जगह पे बहुत बड़ा काम हुआ। मैं ये भी कहना चाहूंगा कि हमारी जो ऑफिस है, हमारी जो सेक्रेटरिएट, हमारी पुराना सचिवालय बोलते हैं उसको, तो उसकी ऑफिस में जो भी 2 प्रकार के, एक तो न्यू सेक्रेटरिएट में की जो ऑफिस रहती है, मंत्रालय की जो ऑफिस होते हैं, उनके मोस्ट ऑफ अधिकारी, और यहाँ फिर हेल्थ के जहाँ पे ऐसी कचेरी होती है आयुष वगैरह, उनकी ऑफिस के भी सभी ऑफिस जो आसपास की है, उन सभी ने की ऑफिस में भी आज भी आयुर्वेद का काढ़ा पिया जाता है, और हम यहाँ प्रिपेयर करके हमारे आसपास के हॉस्पिटल में वहां वितरण करवाते हैं, पहुंचाते हैं। तो एक पूरे माहौल सभी लोगों ने आयुष की और इस रोग में रोग प्रतिकारक शक्ति बढ़ाने के लिए आयुष के इस काढ़े का उपयोग किया, और उसमें गुजरात में परिणाम दिखने को मिले। और भी एक बात बताते हुए मुझे हर्ष होता है कि गुजरात में हमने उसके बाद संसमनिवटी, जो हमारे मिनिस्ट्री ऑफ आयुष की गाइडलाइन में बताया गया कि रोग प्रतिरोधक शक्ति बढ़ाने के लिए संसमनिवटी का प्रयोग करना है, तो हमने गुजरात सरकार की ओर से संसमनिवटी बहुत बड़ी पैमाने पर हमारे माननीय चीफ मिनिस्टर श्री जी ने भी मंजूरी दी और लगभग आज तक हमने 28 लाख से भी ज्यादा लोगों को ये उसका हफ्ते का पूरा डोज 28 लाख लोगों को पहुंचाया है। और भी हमारी अभी, क्योंकि फिर मांग उतनी बड़ी कि संसमनिवटी अवेलेबल नहीं थी, इसलिए हम पहुंचा नहीं पाए। और एक और भी बात का मैं जिक्र करना चाहूंगा कि जब अहमदाबाद हमारा जो मेन सिटी है, वहां पे एक बहुत ही बड़े पैमाने पर ये कोविड-19 फैल रहा था, तो हमारे माननीय मुख्यमंत्री श्री ने और ऊपरी अधिकारियों ने निर्णय किया और एयरक्राफ्ट से हमारी उत्तराखंड की केंद्र सरकार की जो फार्मेसी है, वहां से संसमनिवटी का हमने 10,000 किलो से भी ज्यादा का ऑर्डर लेके तुरंत मंगवाई और आयुष 64 संसमनिवटी ऐसी दवाइयां वितरित करके उसको रोकने की कोशिश की गई। साथ में होम्योपैथिक भी आयुष का एक भाग है, तो उसके बारे में भी बताऊंगा कि यहाँ आर्सेनिकम एल्बम जो भी हमारी मिनिस्ट्री ऑफ आयुष की गाइडलाइन में बताया गया था, उसका भी हमने 3 करोड़ से भी ज्यादा है उसके हफ्ते के, उसका 4 दिन का हमारे यहाँ के डोज हमने निश्चित किया था, तो वो 4 दिन के डोज के 3 करोड़ से भी ज्यादा उसके पॉकेट बना के उसको परचेस करके बिना मूल्य हमने पूरे गुजरात में वितरित किए हैं। 1 महीने तक वो लेने के बाद फिर से हम उसको रिपीट करते हैं। तो इस प्रकार बहुत बड़ा काम आयुष में यहाँ गुजरात में हुआ। फिर हमने सिर्फ रोग प्रतिकारक काम से ही हमने रुके नहीं, उसके आगे जाके हमने क्वारंटाइन सेंटर में भी काम किया। तो गुजरात में आज तक 30,000 से भी ज्यादा आयुष के क्वारंटाइन सेंटर में, जो लोग क्वारंटाइन सेंटर में ऐसे पेशेंट रहते थे जो सीधे कोविड-19 के संपर्क में आते और हाई रिस्क रहते थे, ऐसे 30,000 से भी ज्यादा लोगों के अब तक के आंकड़े हैं कि उनको आयुष की दवाई साथ में दी गई और उसमें से सिर्फ 100 दर्दी को ही सिम्टम मिले, यानी 30,000 लोग सीधे ही कोविड-19 के पेशेंट के सीधे संपर्क में आए थे जो हाई रिस्क थे, उसमें से सिर्फ 100 लोगों में ही कोविड पॉजिटिव हुआ। यानी आयुर्वेद एक बड़े पैमाने पर कोविड को फैलाने से अटका उसके रोक सका है, ये प्रूव होता है। आगे जाके और भी बातें हुई कि हमने असिम्टोमेटिक जो माइल्ड सिम्टोमेटिक पेशेंट थे, जो कोविड केयर सेंटर सीसीसी और डीसीएचसी बोलते हैं, उसमें दाखिल होते थे, तो उसकी परमिशन हमने ली और उसमें भी हमने आयुर्वेद दवाइयां देना शुरू किया। उसमें काढ़े के साथ आयुष 64 कैप्सूल, जो हमारी सेंट्रल काउंसिल ऑफ रिसर्च इन आयुर्वेद सिद्धा CCRS की एक रिसर्च प्रोडक्ट है, उसका यूज किया। एसटी मधु कन्वर्टी, वो भी एक प्रूव ड्रग है एसटी मधु, इसमें उसका भी यूज किया और संसमनिवटी का भी यूज किया। तो ये चारों का कॉम्बिनेशन की एक यूनिक ट्रीटमेंट प्रोटोकॉल हमने बनाया और उसमें भी हमने आज तक 3,000 से भी ज्यादा लोगों को वो भी हमने दिया है, जिसमें से सिर्फ 42 पेशेंट ऐसे थे जिनको आगे डेडिकेटेड कोविड हॉस्पिटल, जिनकी तबीयत बिगड़ी और उन्हें आगे डेडिकेटेड कोविड हॉस्पिटल में रिफर करना पड़ा, ऐसे 42 पेशेंट हमें मिले। उसमें भी मोस्ट ऑफ ऐसे थे जो कोमॉर्बिड थे, किसी को डायबिटीज था, हाइपरटेंशन था, हार्ट की तकलीफ थी। तो ये भी बताता है कि 3,000 में से सिर्फ 42 पेशेंट की तबीयत बिगड़ी, बाकी सब ये दवाई से ठीक हो गए। कोविड के कोई आगे ज्यादा लक्षण नहीं हुए, कोई खतरनाक उनके कॉम्प्लिकेशन देखने को नहीं मिले। तो ये भी बहुत अच्छे परिणाम आशास्पद मिले। उससे जागने के बाद उसके आगे फिर हमें गर्व होता है कि गुजरात की आज 16 जगहों पे 16 कोविड हॉस्पिटल है, जो 16 कोविड हॉस्पिटल, उसमें आयुष की ट्रीटमेंट एलोपैथी के साथ शुरू हो गई। जिनको माइल्ड टू मॉडरेट तकलीफ रहती है, थोड़े सीवियर भी तकलीफ रहती है, ऐसे जो पेशेंट थे तो वो कोविड हॉस्पिटल में सीधे दाखिल होते हैं, तो उसमें एलोपैथी ट्रीटमेंट साथ में चालू रखते हैं। उसके साथ में आयुर्वेद ट्रीटमेंट हमने शुरू की है। तो ऐसी 16 टोटल गुजरात स्टेट की हॉस्पिटल है जिसमें गवर्नमेंट की ओर से ही एलोपैथी ट्रीटमेंट के साथ में आयुर्वेदिक ट्रीटमेंट दी जाती है। उसमें भी मैंने जो कहा, हमारा काढ़ा है 10 मूल पत्तियादी काढ़ा और 3 संसमनिवटी आयुष 64 कैप्सूल और एसटी मधु। और उसके साथ में हमने जो हमारे मिनिस्ट्री ऑफ आयुष की वेबसाइट पे एक प्रोटोकॉल दिया हुआ है, गाइडलाइंस दी हुई है कि कोविड आयुष की आयुर्वेद ट्रीटमेंट की, तो उस गाइडलाइन को फॉलो करके यदि और कोई तकलीफ है तो और भी दवाई हम देते हैं। त्रिभुवन कीर्ति है, ऐसे हमारी 10 औषधि, तो उसके भी बहुत अच्छे परिणाम मिले। अभी 7,200 से भी ज्यादा पेशेंट ने आयुर्वेदिक ट्रीटमेंट, जो कोविड के माइल्ड टू मॉडरेट सिम्टम वाले पेशेंट थे, जो कोविड हॉस्पिटल में ही दाखिल थे, उनको 7,200 से भी ज्यादा लोगों को ये ट्रीटमेंट आज तक दी गई है, आयुर्वेदिक ट्रीटमेंट। और 3,000 से भी ज्यादा लोगों को होम्योपैथिक, यानी टोटल 10,200 लोगों को भी आयुर्वेदिक और आयुष की ट्रीटमेंट हमारे कोविड हॉस्पिटल में चल रही है। उसमें भी बहुत बेहतरीन परिणाम मिल रहे हैं, लोगों को सीवियरिटी कम हो रही है उसका भी। और हमने अभी रिसर्च काम भी शुरू किया है, हमारी 500 बेड हॉस्पिटल में हमारा एक रिसर्च प्रोटोकॉल भी रखा है और उसका भी काम चल रहा है कि उसके सभी हम डेटा को रख रहे हैं। तो एक गुजरात में माना जाए कि जो हमारा काम हुआ वो बड़े पैमाने पर हुआ। ड्रग की दृष्टि से देखें तो अभी आज ऐसी स्थिति है कि गुजरात में संशमनी वटी आज हर एक परिवार जानता है कि संशमनी वटी एक आयुर्वेद की ड्रग है जिससे इम्यूनिटी बढ़ती है। और हमारे यहाँ लोकल लेवल में जो फार्मेसी प्राइवेट फार्मेसी है उनको भी उतनी मांग हुई कि आज मोस्ट ऑफ फार्मेसी में संशमनी वटी का स्टॉक खत्म होने आया है। यानी बहुत बड़े पैमाने पर लोगों ने रोग प्रतिकारक शक्ति बढ़ाने के लिए ये आयुष की दवाई का उपयोग किया और आज आयुष की मांग बढ़ी है, आयुर्वेद की मांग बढ़ी है। और हमारे जो आयुर्वेदिक स्टोर है, आयुर्वेदिक हॉस्पिटल है, उसमें लोग सामने से अपनी इम्यूनिटी बढ़ाने के लिए जाते हैं। तो ये बड़ा काम गुजरात सरकार में हुआ है। उसमें हमारे माननीय मुख्यमंत्री श्री, माननीय हमारे नायब मुख्यमंत्री श्री और माननीय जयंती रवि मैडम का तो हम जितना चाहे उससे धन्यवाद करते हैं, उन्होंने खूब प्रयास किया। और माननीय सेक्रेटरी साहब हमारे राजेश भाई कोटेचा अभी गुजरात के, उन्होंने भी हमें बहुत गाइड किया। तो सबका धन्यवाद करता हूँ और मेरी बात को यहाँ खत्म करता हूँ। धन्यवाद, नमस्कार।
वेरी मच वैद्य फाल्गुन पटेल। आपने बहुत संक्षिप्त वर्ड्स में आपने सारा इनिशिएटिव्स को समराइज किया। We were of course also interested to know beyond COVID what is the plan for the future, but I think we'll have that in the next possible opportunity, right? When we interact with the Ministry of Ayush, the Department of Ayush, Government of Gujarat, we certainly would like to know the larger plans for the future. But my compliments on the work done by the Government of Gujarat. It is very exciting and very encouraging, right? Wish you all the very best. Now, I would now like to request Shri Ashok Kumar Naik, Special Secretary, Minister, Department of Health and Family Welfare, as part of CII's efforts to ensure that we get a pan-India perspective. So it is not from one region or one industry. It is therefore a special pleasure to welcome a senior government, policy maker from the state of Odisha to share his perspectives on and the status update on his state vis-a-vis Ayurveda and the future plans for the sector in his state. Mr. Naik, could you please come forward and initiate your speech?
We have Dr. Gauri Shankar Prasad Mishra who has joined. Dr. Nair had some issues. May I request Dr. Gauri Shankar Prasad Mishra to please give his address.
Hello.
Yes, please.
Am I audible?
Yes, you are. Yes.
Okay. Due to some engagement, our Special Secretary of Director Ayush could not attend this meeting. On behalf of the Government of Odisha, I, Dr. Gauri Shankar Prasad Mishra, is repenting. So the initiation taken by Government of Odisha is very dynamic and effective. The basic principle of Ayurveda is swastha rakhanam and aturasya vikas. On that occasion, I would like to say that our esteemed Secretary Sir, Shri कोटेचा जी बोल रहे थे जो बात ये अच्छा रहेगा कि जो इम्यूनिटी को बढ़ाने के लिए हम जो दवाई दे रहे हैं, इसी में हमारा उड़ीसा का भी बहुत सारा काम किए हैं, जैसे कि अश्वगंधा और गुड़ की वगैरह. बट almost all the centers and the COVID care centers, hospitals and quarantine centers are managed by the Ayush personnel. Till now, the total numbers of Ayush doctors trained is 3,731, and all those doctors are deployed for COVID duty to different districts of Odisha. The number of Ayush personnel, those who are trained in IGOT is more than 2,229, and the numbers of Ayush medical officers, those who are using their Arogya Setu app, is more than 2,200 79. Under our directorate, the AYUSH manpower, those are trained for this COVID duty. This is around 1,477, and the regular medical officers, those are under working this Health and Family Welfare Department, Government of Odisha. It is around 693 medical officers have been deployed to do various duties in different centers of the 30 districts of Odisha. The total manpower deployed in IGOT is more than 2,229, and the master trainers, we have created master trainers to engage the AYUSH personnel. Those master trainers throughout the Odisha is 30. And moreover, under Mission Directorate in NHM Odisha, the total manpower trend is 1,234, and the manpower working also that same, all the medical officers have been deployed to those centers for work to fight for COVID-19 is 1,234. Likewise, also under the RBSK system, the trained AYUSH doctors are more than 1,020, and all are deployed to COVID centers and quarantine centers for as the warrior, COVID warrior. And these are deployed medical officers and paramedics and all the staffs are doing community-based surveillances, daily basis, and documentation, reporting, and all the data, those who are collected from the field, they are reporting to their higher authorities. And frontline workers, working as frontline workers with all ASAs and ANMs, and working in COVID hospitals also. The premier hospitals, which is also in Odisha, Gopavandhu Ayurveda Mahavidyalaya, they are working in the hospitals. It has been continuing as a COVID hospital. And in Bhubaneswar, that is one homeopathic hospital is also, and medical college is there. That is Abhinna Chandra Medical College and Hospital. There are also those in hospitals. It has been continuing, and all the doctors are also those who are engaged in isolation ward with the specialist. They are working with the specialist in our counterpart. Along with the contact tracing, the most important work is the contact tracing. All the doctors are doing also contact tracings and reporting to the government. Besides, government of Odisha has sanctioned 18 lakhs rupees for free distribution of both Ayurveda and homeopathic medicines. Sansabana Bhatti, which has been is a great medicine effective for this pandemic. 18 lakhs rupees has been sanctioned for distribution of free medicine. Likewise, 18 lakhs rupees also sanctioned for homeopathic, that has been also distributed. But recently in last Rathayatra, it has been free of distributed free of cost to the devotees and also to the workers. And the government has also given one guideline to distribute all the arsenic album medicines in free of cost to the patients.
Yes.
These are the most important things that we are conducting in government of Odisha. Thank you everybody. Thank you.
Thank you very much, Dr. Gauri Shankar Prasad, for representing the state of Odisha. We look forward to greater engagement from the state and promoting Ayurveda and AYUSH in greater measure in the coming year and years ahead. Thank you very much. I would now like to request our esteemed Shri Pramod Kumar Pathak, Additional Secretary Minister of AYUSH, to deliver his special address. He, coming from the Kerala cadre of the Indian Forest Service, has now playing a very important role in the Ministry of AYUSH, directing and supporting the initiatives and the policy making and the initiatives being rolled out under the Ministry of AYUSH. So, a great pleasure in welcoming Shri Pathak to deliver a special address. Thank you.
Thank you, Mr. Rajiv Vasudevan, and Honorable Health Minister Kerala, Dr. Bhavna Patel, Mr. Ashok Kumar Nayak, Padma Shri Vaidya Rajesh Kotecha, and other distinguished participants. It is my privilege to address this August gathering today on the occasion of conference exhibition India Healthcare Week. This session for discussing the role of Ayurveda in public health program particularly is highly relevant in the context of COVID-19 pandemic. I will briefly narrate what are the initiatives taken by Ministry of AYUSH since the onset of COVID-19. In fact, Ministry of AYUSH joined the battle against COVID-19 even before the actual threat was perceived. It started in the first week of March when Secretary Ministry of AYUSH sensed that something is wrong, and he convened a meeting of all the officers. And then at that time, a self-care guidelines was issued. It told that it is better to equip the persons with easily available home remedies, and of course following social distancing, masks, cleaning of hands. Apart from that, immunity boosting should also be promoted. So a self-care guidelines was issued in the first week of March. At the same time, he offered all the institutes under Ministry of AYUSH, all the hospitals under Ministry of AYUSH to Government of India for being 100% converted to COVID hospitals in case the need arises. So he directed all the hospitals under Central Council of Research and National Institute for converting all the to be in readiness for admitting patients if the need arises. Then in the third week of March, we wrote all the around 750 colleges, AYUSH colleges, Ayurveda, Unani, Homeo, Siddha, Swaripa colleges, to offer their services. The hospitals, they are teaching hospitals were there to offer their services to COVID-related cases and equip them, giving them proper training. So whatever training was there, because this was some unknown enemy, we were not knowing with whom we are fighting at that time. So that time, he wrote all the, whatever literature is available, you go through this thing and equip yourself for battling, making this your facilities available to the patients if they are coming to your colleges, to your hospitals. And side by side, we wrote to all the state governments also that whatever hospitals, AYUSH hospitals are there, they should be equipped. That preparation should be made for admitting the COVID patient if the state government asks to admit them. Parallelly, and Government of India constituted 10 empowered group of secretaries, and Secretary AYUSH was a member of Group 4, which was dealing with augmenting human resource and capacity building for management of COVID. So the first, it was constituted on 29th March, and the first meeting was held on 31st March. When the lockdown, the whole country was under lockdown, this group almost daily met, physically it met, and under the chairmanship of Secretary MSME that time, and daily it met daily and evolved the strategies for combating the COVID. So that time we immediately offered that we will deploy all our AYUSH healthcare personnel for the management of COVID. So that time we were asked, are we ready to give the nodal officers for all the districts, around 650 districts? And we wrote to state governments immediately at the time. And I'm very happy, very satisfied that within 2 days, all state governments gave their telephone number, details, email of all the 650 nodal officers and state nodal officers, all the AYUSH doctors, all the details were given. And within AYUSH ministry was the first ministry when no ministry was having any clue what is to be done. They gave details of all the AYUSH officers, and these details can be accessed on the covidwarrior.gov.in. At that time, I'm talking about the 2nd April. Now all the details are available from all the ministry. On 2nd April, only our details were available, around 8.5 lakhs healthcare personnel, which are from consisting of AYUSH government doctors and teaching faculties, AYUSH contractual doctors, AYUSH UG and PG students, the state AYUSH staff, and registered AYUSH practitioner, along with details of state and district level nodal officer. On 2nd April, we offered the services to empowered group of secretaries. Then on 4th April, we conducted a training of trainers, master trainers, consisting, and we are the first to conduct this training. Secretary offered that we will be first to conduct, and Ministry of Health accepted, and the training of master of trainers started on 4th April, in which the official of WHO, UNDP, Ministry of Health, and whatever expertise were available, they make the presentation for nearly 4 to 5 hours, which were attended by nearly 4,000 AYUSH personnel at the time. And many were in the waiting, they couldn't join because the limit was crossed. So that time, first time, a lot of curiosity was there, and we were very eagerly, very enthusiastically, they were ready to join the battle. That time, EMR division of Ministry of Health, they issued the guidelines that AYUSH doctors can be deployed for clinical management. In the last week of March, they issued the guidelines, EMR, they can be deployed for clinical management. AYUSH students can be deployed for surveillance purpose, and AYUSH doctors can be deployed for the management of quarantine centers and isolation centers. So even that time, the roles were very, very well specified. Immediately, we wrote to all the state governments that all the state governments should deploy the AYUSH doctors for the roles assigned to them. In fact, what we wanted, we sensed at the time that probably the burden was very, very heavy on the mainstream healthcare professional. So if AYUSH professional can support them, then burden can be taken off, and AYUSH can also be providing the support to them. So that time immediately it was there. Then on igot.gov.in, we created around 6 AYUSH specific. We told that we want a separate AYUSH training modules so that there should not be any confusion. Then DOPT created 6 AYUSH modules on igot.gov.in, that so that those who are volunteers, they can themselves find out how they can be join this battle against COVID. So we made it available on the igot platform. So that time it was of course, we took a lot of initiative at that time, and all the facilities. Then we also prepared one SOP for the district hospital, district administration, as per the guidance, as per the advice of empowered group of secretaries, and we made it mandatory. We told that around 20 to 25% officers, AYUSH doctors in a district should be deployed, should be roped in for the management of this COVID. And at that time, we also felt, we had discussion, Secretary AYUSH had discussion with the various offices. We told that it will not be proper to deploy our officer, our AYUSH professionals without providing them some insurance cover. So that time, immediately he took up the issue with the Ministry of Health and Family Welfare, and all the AYUSH professionals who were joining the battle, they were brought under the PM insurance cover for if they are joining this. That was a limit of around 50 lakhs if something unfortunate happens. So that also we took a lot of care at that time. And parallelly, we were issuing the guidelines also, self-guidelines, whatever which we were issuing this. These guidelines were translated into 8 foreign languages. We sent it to almost all the embassies were there, and there was a huge response from various embassies. The ambassador contacted the local ambassador of various countries. They contacted, see how can we use it, because they find it at the time everybody was clueless. Even nobody was knowing what steps to be taken to combat it. That time we always advocated that we should take this immunity boosting kit by taking it, and these are all proven. There were research were done. There were scientific evidences were there that they are very useful for the respiratory disorder. So we were repurposing these drugs for the management of COVID at that time. So this was taken. Parallelly, Ministry of Ayush also decided that we should have the scientific background of whatever we are claiming. So interdisciplinary task force, research and development task force under the chairmanship of Vice Chairman Bhusha Patwardhan, Professor Bhusha Patwardhan, and the members from ICMR, CSIR, various disciplines were constituted. Whatever the Ayush researches were to be done, this high-level research body will vet it, and they will carry it, or they will find out, they will prepare the protocols, how this research activities will be carried out. So this, with the guidance of this interdisciplinary task force, now the randomized control trials are going on around 91 sites all over the country. Now they are needing completion. Parallelly, we also started population-based studies, then observational studies. A lot of activities were going on for scientific validation of whatever we are claiming, because it was always felt that we should have scientific analysis of whatever we are proposing. So at that time, and this is in the final stage, and now we are almost in the final stage of completing our scientific studies. Parallelly, we are also providing, in fact, I forgot to mention that yesterday only, Delhi Police has launched Project Niramaya in association with All India Institute of Ayurveda to provide this Ayurvedic facility, AYUSH facility, to the family members of Delhi Police personnel in the 6 major colonies, residential colonies, by deploying the Dhanvantari Rath. So Dhanvantari Rath will be having equipped with AYUSH medicines and consultations, where they will be providing medical paramedic staff, AYUSH doctors from All India Institute of Ayurveda, and then they will be going there, the gynecology experts, ENT experts, dental experts from All India Institute of Ayurveda, and they are experts from various disciplines. They will be going to various colonies in Dhanvantari Rath, and they will be deploying, they will be offering their advices to them. Very simple and very effective advices at their doorstep, by observing all this social distancing, and they will be educating them also, and they will be distributing medicines also. Earlier also, this All India Institute of Ayurveda Sciences along with Delhi Police provided Ayu Raksha kit, which was containing Anu Tel, Shanshmani Bati, then Chyawanprash and Ayush Par. And yesterday itself, Delhi Police Commissioner, he openly appreciated that only because of the Ayu Raksha kit, the incidence of falling ill among the frontline COVID warriors of Delhi Police, who were always on boards, that the incidence of falling ill has become drastically reduced, and wherever they were falling ill, their recovery rate has had tremendously improved. So this is how Ministry of Ayush has joined the battle. But still the battle is going on. Ministry of Ayush has deployed all its power to support it. They are at the same time non-COVID facilities also being strengthened by Ministry of Ayush. So these are some of the initiatives, and we are thankful to all the state government who provided all support at all the time whenever we asked them. And we hope that with this cooperation from state governments, we will be able to control this epidemic, and in the coming years also we will devising a strategy, as Professor Rajiv Vasudevan told, that post-pandemic management will also be done. I also want to mention that for this mental health management, because psychological impact is very much, yoga and pranayama is also being promoted, and that is also we are making equal importance to management of mental health during this pandemic. So this is in brief, very brief, because of time constraint, I have to cut short this thing. They're very brief. The initiative of the Ministry of Ayush is there. Thank you.
Thank you very much, Sri Pathak. It gave us a fantastic view of the very focused timeline, and the timeline by which so many things were done. To imagine that 8.5 lakh persons, the nodal officers in 650 districts, was made available in such a short time after the lockdown, etc. Then the training, and then insurance coverage, disseminating in foreign languages, 8 foreign languages, all of this, and the progress you have made with the Delhi Police, extremely encouraging for all of us in the Ayurveda sector. So my compliments to you and the entire Ministry of Ayush team, which has gone with one mind, single-mindedness to make this happen. And thank you for outlining how the central and the state governments are working together. With this, I now come to the address by our guest of honor, Srimati K.K. Shailaja, teacher, Honorable Minister for Social Health and Social Justice, Government of Kerala. She has become a legend of sorts now in the course of the last few months. And, both not only in India, but globally, I think she has become a very well-known personality for the effective leadership that she and her colleagues in Kerala government have shown in engaging with community, with private sector, public sector, all of them working together to battle this pandemic, right? So with these opening remarks, we have great pleasure in welcoming Srimati Shailaja teacher to share her view. And one point before she begins, I just would like to request her, how does she see the vision, particularly for Kerala, in terms of Ayurveda and modern medicine, breaking the silos, and Ayurveda really being there, not only for non-communicable diseases, but also for COVID treatment, for all the major healthcare plan and integrated healthcare plan for the state. So we would be very keen to hear from the Honorable Minister. Shailaja teacher, please initiate your address. Shailaja teacher, your voice is not audible. Could you please...
Can you hear me?
Yes, we can hear you now, Shailaja teacher. Yes, please.
Thank you, Rajiv ji.
Yes.
Distinguished participants of this webinar and my dear brothers and sisters. First of all, I want to congratulate central government and also the CII for organizing such a seminar on Ayurveda. This is the apt time to speak about Ayurveda, I think so. And it is a matter of pleasure that to participate in this kind of a webinar focusing on growing role of Ayurveda in public health programs of the state. The topic is more relevant, especially in the context of the deadly pandemic that has taken the whole humanity at risk. As you know, Government of Kerala have a very good wealth of tradition in Ayurveda and very good practices here. And also we are promoting Ayurveda. I am very happy to see that central government is also promoting Ayurveda more this time. And we are happy on that. And in Kerala also, we are propagating the principles of Ayurveda. And in our health policy, it is we try to blunt all the systems of medicine. Especially we give a special place for Ayurveda in our health policy in Kerala. And Kerala is unique owing to judicious blend of indigenous practice and surviving tradition of systematic learning, as well as the popular acceptance of the principles and practice cutting across the diverse socio-economic and cultural barriers. There have been several authentic Ayurvedic treaties that had organized in this land, which have been widely acknowledged and appreciated by global Ayurvedic fraternity. And there are detailed descriptions of over 1,500 medicinal plants and as well as 6,000 medicinal formulations originated from here in Kerala. And thousands of signs and symptoms of detailing and diagnosing diseases and is available in Ayurveda here. It is a good traditional value. The distinct legacy of Ayurveda in Kerala has also been sustained so far, so much, so that the entire world is looking towards the state for its diverse possibilities of Ayurveda in current public health scenario also. I'm not saying it is in Kerala only, but all the states have their traditional values like Ayurveda and traditional things. All the states have some values, some wealth of their tradition. We have to collect everything and we have to disseminate everything throughout India. That will be a wealth to us. But the lack of curative medicines for some chronic diseases are existing in the world. Even the COVID-19, no medicine was founded or and we have to find out medicine for this COVID-19 coronavirus too. There is no effective medicine in modern medicine or any other medicinal schools. But Ayurveda, I think we can suggest so many medicines. But the one thing is the lack of the scientific evidence and experiments and documentations, etc. We have to have a remedial measures for that. We have to make everything scientifically proven, and also we have to document everything. In this era that they were existing the lack of medicine for chronic disease, and also high cost of new medications, and also the microbial resistance are there, and drastic shift in lifestyle patterns and emerging trends in disease have shifted the interest of larger population throughout the world to complementary medicines and also alternative medicines. This is an opportunity for Ayurveda, I think so. The average global utilization of traditional and complementary medicines, I think it reached a vibrant figure of 70 to 80% increase in last decade. More people prefer now these indigenous medicines and complementary medicines. This is an opportunity for us, for our country, and also for Kerala. I think this is an opportunity. So the treatment with Ayurveda is considered effective in managing chronic disease and prevention of infectious disease by providing more lifestyle interventions. Its application is communicable, and nutritional disorders in public health can also be beneficial. Well-implemented public health intervention programs, rigorous research, data collection, and documentation are necessary for the effective utilization of Ayurveda in public health initiatives of the country. These modalities are also essential for improving the core complementary of the practitioners of Ayurveda also. I think Confederation of Indian Industry can help in this arena to improve research and to start more research centers like that and documentation centers, etc. I think they can help us. And the potential of Ayurveda and public health management during disasters and various epidemics had come to the forefront on several occasions. Even here in that flood situations and landslide flood, that time we propagate the Ayurveda medicine to get immune, to improve the immunity of the people. We propagate it, and that had a good result also. But owing to the lack of proper documentation, systematic studies, the real benefits acquired could not be presented before the scientific community. Scientific documentation and systematic studies are considered as an integral component of the public health. In the current scenario, COVID-19 pandemic also, the possibilities of Ayurveda were called upon into service by the government of Kerala. Our Honorable Chief Minister convened a meeting, a video conference, among the selected Ayurveda experts from various fields and Ayurveda various strategies for the management of COVID-19 in the state early this year. When the pandemic started in January, we got the first case of COVID-19 in January 30th, and the second and third cases in February 2nd and 3rd. That was our first wave. And we had a second wave after February 2nd week, and a third wave after the lifting of the lockdown. The third wave is also occurring here. When the first wave, second wave occurred here, at once our Honorable Chief Minister convened a meeting with the Ayurveda specialist and the veterans in Ayurveda, and that was a very good meeting. And in the light of the deliberations of the conference, a 7-member task force was constituted for submitting a detailed report recommending the Ayurveda strategies for to contain the COVID-19 pandemic. And under the leadership of Dr. Rajmohan, all the eminent personalities who were the member of the committee, they submitted an elaborate report within no time. They prepared a very good report, and that was a very good document also. That became a very good document also. And they suggested Ayurveda implementation in the prevention and mitigation and rehabilitation, everything. They suggested so many things. And we are now implementing that in Kerala. The report and the subsequent action plan on the basis of the report endorsed by the government and the state Ayurvedic COVID-19 response cell. We constituted a COVID-19 response cell in state level, and we planned to implement the suggestions of the committee. Special emphasis was laid on ensuring the availability of essential medicines mentioned in the approved protocol. That document suggests some important medicines also. They discussed it together and they formulated some special medicines for the prevention of COVID-19. And we try to coordinate all these things and ensure the active participation from all stakeholders and ultimately fortify the campaign of the state against COVID-19 menace. It was also decided immediately to constitute a regional Ayurvedic COVID-19 response cell. Other than the state level cell, we constitute regional cells, and the participation from both government level and also private level. The private stakeholders also participate in our COVID-19 pandemic contain method. And also district level also we constituted the same thing. And we started several new methods or new projects on COVID-19 containment. One is called Sasthyam. It is intended for strengthening the individual protection against COVID-19 below 60. Below 60 age, we are giving some kind of medicine to get immune from Ayurveda medicine. And Swasthyam project is we are implementing this throughout Kerala and supplying that medicine to below 60 people. And for above 60, we had another project called Sukhayushyam, and we are supplying that medicines to above 60 peoples. At first, we supplied our medicines to the community outside the quarantined people or the COVID positive people. At first stage, we didn't give medicines to COVID positive or quarantined, COVID suspected people who were tested and quarantined. The people who came from outside, the imported, and also from other states, we tested them, we traced them, tested, and quarantined them. That quarantined part, we didn't test Ayurveda in the first stage. But in the second stage, we started Ayurveda medicine in the quarantined persons also. This is the pandemic, and we have to get permission from ICMR and other part to try the medicine in positive cases, etc. That is the problem actually. We have to follow the guidelines, World Health Organization and ICMR and the guidelines we have to follow. But we tried Ayurveda medicine in the quarantine people. That's a very good result we got out of that. We are documenting that things. When we try these preventive medicines in some village or in some panchayat, we can say that the transmission of virus is lesser in that part. And also, even if they caught virus, they will be free from the virus within a few days. Within 4 or 5 days, they become negative. That is the net result. I asked the committee to document everything for our future study, and they are doing so. And we started a project called Punarjani, intended for a speedy recovery of the convalescent COVID-19. When the post-COVID scenario, people are facing so many difficulties, and international studies are also coming that the post-COVID cases, they are suffering some heart problems and some other organ failure, etc. They are causing that. And we foreseen that thing, and we are trying Ayurveda to treat the post-COVID patients who are recovered from COVID, who become negative by test. We are giving medicines to that post-COVID patients also. I think it will yield a very good result. We have a project called Niramaya, an official media platform for the propagation of promotive Ayurvedic healthcare activities, and so many people are joining in it, and they are getting all the informations from this thing. And we are starting these clinics throughout the state, this special clinic for Ayurveda treatment. As you know, Kerala propagated Ayurveda not recently. In previously also, we have a very good system here. And when this government came to power in 2016, we decided to make Kerala a total Ayurveda village. And each and every panchayat, wherever we tested that any panchayat, there is no Ayurveda dispensary, we supplied new Ayurveda dispensary, and we created new posts in that dispensary. And now in each and every panchayat, Kerala have an Ayurveda hospital, Ayurveda dispensary or Ayurveda hospital. And we are improving the Ayurveda hospitals also. And we have a project called Adram in health sector, and we are improving the infrastructure and also the clinical practices. Not only in modern medicine, we are also trying this thing in Ayurveda sector also. The slogan of the mission is to make the government hospitals patient friendly and also modern or technologically modern. And we are implementing that thing in Ayurveda sector also. The newly built Ayurveda hospitals are high-tech hospitals, and we are building, we are converting the old Ayurveda hospitals as modern, giving a very good infrastructure and also the equipments also. We are trying to improve the condition, the physical and also the clinical conditions. We are improving so much. And now in this COVID season also, we strengthened our Ayurveda institutions more than anything, and we are trying to implement these preventive aspects to the COVID affected persons. And also the personalized and individual approach give us a very good result, and I think that will be appreciated throughout the society. And also the integration of Ayurveda principles and practice in public health system. We are attending in that case also. And in this interaction, as you said, we are combining all these traditional systems and an integrated system of medicine. We are giving importance, focus to that arena also. And now we want to propagate Ayurveda throughout the world. We conducted an Ayurveda AYUSH conclave in 2019. That was a very good attempt, and more than 35 countries representative from 35 countries participated in that conclave. We were planning to have the second conclave, but the COVID-19 upturned everything, and if it stopped within 4 or 5 months, we can again think about the AYUSH conclave. That first conclave was a very good victory, and so many eminent personalities participated in it. Here we want to improve our research activities also, and we are starting a Ayurveda Research Institute in Kerala. We acquired more than 300 acres of land. We are acquiring. We got 50 acres already in our possession, and the acquisition activities are going on. But we started the building of Ayurveda Research Institute. We got the project is of 300 crores, and we got the first installment 62 crores from KIFBI, and we started the work there. Building work is started there. A very good 100-bedded specialty hospital for research, especially for research, and a museum for Ayurveda things, and also a manuscript reading center. That kind of a very good institution was there. And we are propagating, we want to propagate Ayurveda. And in the business part also, I think we are not utilizing our capacities fully. We have to improve the production of medicine, and also the business part also we have to improve. The CII, I think, helped to improve the production and also the selling of Ayurveda medicines throughout the world and throughout India. That part also we have a hope. Our expectation is very great, and I think we can reach in that aim shortly. And here we are trying our methods in the prevention of COVID-19. I think it will become a very good result and very good document for future for the students of Ayurveda and also the Ayurveda fraternity. It will become a very good document. Once again, I thanks our Government of India and CII. And one request, I want to put forward a request that the Government of India should invest more money in Ayurveda sector. And, and not only the total health sector, I am requesting this Padakji is there, and please try to get more money from central government in Ayurveda sector. And the government alone cannot do everything. In government, either Government of India or state governments, the government alone, I didn't think so. But the CII and other this kind of organization can also help us. And combining these things, private and government, I think we can improve the Ayurveda sector more. Thank you for inviting me for this August webinar and to express my ideas here. Thank you everybody.
Srimati Shailaja teacher, thank you very much for a very, very comprehensive update on, it's been an inspirational leadership from your side. I don't need to repeat that part, and to listen to all the things that you have done. It has been, so before I ask one or two more questions, and there might be some other questions, Mr. Sri Pathak, would you have something to respond to the Honorable Minister? I think Dr. Kotecha may be there or not, we're not sure, but in case Sri Pathak is present, he could respond. Okay, next time, okay, Mr. Pathak has come.
Please.
The Honorable Minister was requesting for greater support for Ayurveda, particularly in the states, and that they would extend their full support. So, if you can kindly respond to that.
Well, certainly, our support is always there under National AYUSH Mission. We are supporting the state government. Now, a new project has also come for the planting of medicinal plant costing around 4,000 crores rupees. So that also, with the support of the state governments, also we are involving them also for this thing. And whatever the support is from the Government of India is required, technical, financial, we are there because we know that this is something without the state government support, we cannot do much. So state government support is very much required, and we will try to get more allocation under the National AYUSH Mission also. That is already we are providing at the National AYUSH Mission. We will be projecting the requirement request to the Ministry of Finance based on our fight against COVID, and we are hopeful that our request will be accepted. Thank you.
Okay. Thank you, Sri Pathak.
Thank you, Padakji and Kotechaji, because I want to express my thanks that recently our state got a 50-bedded Ayurveda hospital through National AYUSH Mission. Thank you very much for that.
Wonderful to know. Shailaja teacher, I have one follow-up point to make and to take your response. See, the fact of the matter is Kerala is well known as the place where Ayurveda is really ingrained into the community at large, right? And it was so nice to hear you say every village, every panchayat is now an Ayurveda village, right? So it's a very inspiring thing to hear. It's my mother state, so I know that. So and all the program, Adram, you're looking at quality upgradation, both Ayurveda, all the programs that you've done, Punarjani. So I wanted to just ask you, if you look at the present, we want evidence to be built, but we don't have a chance to treat. So if we don't treat, you can't build documentation. So it's a chicken and egg, Honorable Minister. So once, let's say the Ministry of AYUSH will clarify, I hope that the Ayurveda government hospitals and private hospitals can treat COVID, number one. Number two, Kerala is a destination for wellness tourism and for medical care as well. A big vision for Kerala to become a healthcare destination could be really built around Ayurveda and modern medicine, provided we can bridge them together, not fighting with each other.
Yes,
so please share your vision on that.
Yes, we have to do that. The first part, This is a newly emerging illness, and the scientific community is studying about the behavior of the virus. It is not over, and sometimes someone is saying something about that. And in Ayurveda hospital, I think the side effects of this virus, sometimes the hypoxia is occurring, and sometimes the heart failure is occurring, and sometimes the lungs are totally infected by this virus, and this kind of complicated things are occurring there. And that is why we cannot insist the treatment in Ayurveda sector. I am hopeful that I'm using some Ayurveda medicines throughout my life, and but I cannot, as a minister, I cannot insist that the treatment should go to the Ayurveda sector because of this new thing. Any failure occur, it may be not because of the Ayurveda medicine or like that, but the entire community may say that they tried, yes.
But madam, the thing is that the number of deaths that are happening, even with the administration of modern medicine, at least for mild, moderate, asymptomatic cases, not only for prevention and rehabilitation, but at least mild, moderate and cases, we could have tried Ayurveda and probably save, like you yourself said, the recovery is quicker.
Yes, I am confident that, but I cannot take a decision all of a sudden. That is the, but we increased the thing. We stepped the next step. We started for the quarantine people. We are giving. They may be positive, and how many have the primary contact. We started, and from the primary contact we can assess how many become positive, how many negative, how many people who use this Ayurveda medicine, what is the proportion of the positive case from there and from outside, that we can assess. For the confirmed positive case, we didn't start it, but as you said, we have to do some experiments. I'm also thinking about that, but
because vaccine is still far away, plasma therapy, everything is experimental in modern medicine also.
Yes.
So Ayurveda could try, and Kerala may become the state to prove that Ayurveda works. Honorable Minister.
Let us try together. Let us.
We'd be very happy, industry and everybody will come. And also on the larger vision for Ayurveda, you outlined as a healthcare destination in Asia beyond the COVID. COVID will come and go.
Yes.
But you have 4 international airports. How will you build Ayurveda and modern medicine as a magnet to healthcare destination?
Yes, here in some panchayat we have integrated medical systems, primary health center, Ayurveda dispensary and Homeo hospital, the 3 of them in the same compound. Most of the panchayat are doing that. We are also giving them interest to make that. And that way we are starting wellness centers. We can propagate that thing further. And I think people are interested to having everything in a compound and integrated thing. In Trivandrum, in Pujapura, we have Ayurveda hospital there, and there we are implementing this thing also. That the gynec sector, we have a very good gynecologist there, and the even cesarean is also going there. And after the post-delivery, the Ayurveda treatment is going on in the same compound. The Ayurveda college compound, not in modern medicine, but we appointed a modern medicine gynecologist there for taking delivery, etc. And that kind of integration in future, we have to improve that kind of integration, that wellness centers, definitely.
So, Shailaja teacher, thank you very much for your enlightened remarks. We are grateful for your time and for for your leadership in Kerala that you've done. On behalf of the people of Kerala and the people of India, thank you very much. Similarly to our guests from other states and Sri Pathak. There may be certain questions and answers we have not had the time to present it to the panelists. So thank you very much. Namaste. We'll be concluding now.
Thank you.
Thank you very much.
Thank you, Jay. Thank you very much.
Thank you. Yeah. So I would request the CII team to now take over. Thank you very much, Sri Pathak. Thank you very much, Sri Patel and Sri Gauri Prasad. Thank you. Thank you, Sri Pathak. Really appreciate it.
Thank you, Mr. Vasudevan, for moderating the session. I also thank Honorable Secretary and Additional Secretary for joining us today. May I also thank Honorable Minister Kerala for joining us today at this important session. We will now begin our next session in conversation with Sri Satish Kumar Jain. Minister will join us. May I request you to kindly all be on the mute. We will soon begin our next session. Thank you.
हेलो हाँ जी
Request panelists to kindly be on the mute mode. We will soon start the session. Thank you. Apologies, we are facing a slight technical glitch, and the minister will join anytime. May I only stay on the mute mode? We'll soon start the session. Again, apologies. Welcome once again. We now begin our next session in conversation with Satish Kumar Jain, Minister of Health, Industries, Power, Public Works Department, Home, Urban Development, Government of Delhi. The session will be moderated by Dr. Pratap Chauhan, Member CII Governance Council, Founder Director, Jiva Ayurveda. I request Dr. Pratap Chauhan to kindly welcome Minister and moderate the session. Thank you.
Okay, thank you, Rakhi. So first of all, a very warm welcome to Satyendra Jain Minister ji, Honorable Minister of Health and in Delhi. Of course, we are very sorry for the delay. I'm sure you have a very busy schedule, and we would like to just start straight away, and would like to first of all, my main question will be that during this pandemic crisis, of course, Delhi has been in limelight. First, there was a rise in the number of cases very rapidly. And of course, then there was a quite bit of nice control. We still have, the problem is still there. So, sir, I would like to ask you this simple question in the beginning that during this crisis, what are some of the lessons that you have learned from this pandemic? And also, what role has Ayurveda played in managing or playing some important role in this COVID pandemic? So this is my first question to you. I would like to share your views on this subject. I think the minister is there.
It seems there is a technical glitch. He's online. We can't see him.
Okay, so in the meantime, I would just like to mention that we had some wonderful sessions in the morning. Of course, great, inspirational some data that we got from different states. And since my job was to interact with the Minister of Delhi, Health Minister, what I can share a little bit, some of, I think the Minister is there now. Sir, are you there? Jain Saab, are you there? Yes, sir. Yes, sir. We can hear you very well. Thank you. Thank you for your time, sir. We are little sorry for the delay. Straight away, my first question, because we are going to interact about this COVID and pandemic and something about Ayurveda. So my first question to you, sir, is that you have been the leader of the whole operation of this COVID pandemic in Delhi. And initially, as we all saw, there was a lot of, kind of overwhelming situation. A lot of people were like, they didn't know what to do. But very rightly, you took over the command, and I think we saw some great improvement in the situation. So what are some of the lessons that you have learned from this pandemic, and what is the role Ayurveda has played in managing this COVID pandemic in Delhi?
देखिएगा, सबसे पहले तो मैं बताऊं कि आयुर्वेदा का या हमारे जो नेचुरल सिस्टम्स ऑफ मेडिसिन है, उसका सबसे बड़ा रोल है कि जो इससे पैनिक क्रिएट हो रहा है चारों तरफ से, उसको हैंडल करने के लिए बहुत कामयाब रहा। हमारे जो हॉस्पिटल्स हैं, उन हॉस्पिटल्स में भी इवन पेशेंट्स को काढ़ा पिलाया जा रहा है। मैं आपको शेयर करना चाहूँगा, एक हमारा आयुर्वेदिक हॉस्पिटल है, चौधरी ब्रह्म प्रकाश आयुर्वेदिक हॉस्पिटल। वहाँ पर आज से ही हमने इसको कोविड हॉस्पिटल में कन्वर्ट किया। लगभग शुरू में 100 से ऊपर पेशेंट रहते थे वहाँ पर, और अच्छी परफॉर्मेंस है वहाँ की कि वहाँ पर उनको दिन में 3 बार काढ़ा पिलाया जाता है, आयुर्वेदिक दवाई दी जाती है, फ्रूट्स खिलाए जाते हैं, योगा कराया जाता है। इसके अलावा उनको इवन लाफ्टर थेरेपी कराई जाती है। तो मैं आपको एक छोटा सा वाकया शेयर करूँगा। जब ये रोजे स्टार्ट हुए, तो उन्होंने कॉल की सभी पेशेंट्स को कि भाई कल से, जो मुस्लिम पेशेंट थे उनको कॉल किए कि भाई कल से आपके रोजे हो रहे हैं, तो आप रोजे पे तो नहीं है। तो एक ने कहा कि नहीं, मैं हर साल रोजे पे रहता हूँ, पर इस बार ही नहीं रखूंगा। तो कहते क्यों? कहते वो दिन में 3 बार काढ़ा पीना होता है ना, तो मैं आगे बाद में बढ़ा लूंगा। फेथ भी है पेशेंट को, और उसकी वजह से देखो वहाँ के इतनी अच्छी रिकवरी रेट है। पिछले 4 महीने में सिर्फ 2 डेथ हुई है, उन्होंने रेफर किया। तो बहुत ही, मतलब मैं कहूँगा कि बहुत अच्छा उसका है। और हमारे जो हॉस्पिटल जैसे LNJP है, राजीव गांधी है, वहाँ पर भी हम इवन पेशेंट्स को काढ़े दे रहे हैं, आयुर्वेदिक काढ़ा दे रहे हैं। राजीव गांधी में तो हम कहते हैं उनको योगा थेरेपी भी करा रहे हैं। तो इसका काफ़ी मुझे लगता है इफेक्ट है। और सबसे ज़्यादा क्या है कि देखो, कोविड में डेथ होने का एक बहुत बड़ा कारण है दहशत। काफ़ी सारे लोग जो दहशत में आ जाते हैं, जिनको लगने लगता है कि हम मर जाएंगे, तो उनके मरने के चांसेस काफ़ी बढ़ जाते हैं। और आयुर्वेद इसके अंदर काफ़ी हद तक उनको उस दहशत के दूर लाने में मदद कर रहा है, और इम्यूनिटी बढ़ाने के अंदर। क्योंकि बहुत सारी दवाइयाँ ऐसी हैं कि स्पेसिफिक मेडिसिन तो कोई है नहीं, इसकी कोरोना की कोई स्पेसिफिक मेडिसिन नहीं है। तो अगर आपकी इम्यूनिटी इंक्रीज करने के लिए कोई भी चीज़ कामयाब है, इम्यूनिटी को बूस्ट कर रही है, तो वो उसके अंदर कामयाब है। और लोगों को अभी की बार देखने से पता लगा है कि इनको फेथ काफ़ी बढ़ा है इसके अंदर।
ये तो बिल्कुल सही है सर। आपने भी इसका एक्सपीरियंस किया ना। मैंने आपकी, आई सॉ योर वीडियो इन विच यू वर प्रमोटिंग वेरी वेल द योगा, प्राणायाम एंड द काढ़ा। आई सॉ दैट वीडियो आल्सो, यू केम आउट ऑफ दिस। और इसमें ब्रह्म प्रकाश एंड आल्सो तिबिया कॉलेज, आई माई सेल्फ इज अ ग्रेजुएट ऑफ तिबिया कॉलेज ओनली, एंड आई वाज टू टॉक टू द डायरेक्टर। वहां पर मैंने बात की विदुला जी से, और अभी प्रिंसिपल तिबिया कॉलेज से। सो आई वाज वेरी हैप्पी दैट जो डेटा वो बता रहे थे कि more than thousands of people have been admitted there, और अभी भी रोज वहां पर पेशेंट आ रहे हैं, तो रिजल्ट्स तो बहुत अच्छा है। और इससे सर एक हमें संकेत ये मिलता है कि आयुर्वेद में बहुत ताकत है, और स्पेशली जो चिकित्सा वाला पोर्शन है। अभी तक क्या था कि आयुर्वेद को हम प्रमोट कर रहे थे इम्यूनिटी बूस्टिंग के लिए ज्यादातर, लेकिन जैसे ही ये आयुर्वेदिक हॉस्पिटल कोविड सेंटर बने, मैं शुरू से टच में हूँ चौधरी ब्रह्म प्रकाश में भी और तिबिया कॉलेज में भी, जो वहाँ के जो एक्सपर्ट्स हैं, और हमने देखा कि बहुत अच्छे रिजल्ट्स वहाँ मिले। जो सिम्टम्स भी थे, डिफरेंट टाइप के सिम्टम्स, कोमॉर्बिडिटी के भी पेशेंट वहाँ पर काफी आए। तो सर एक मेरा आपसे निवेदन है कि आपने जो मोहल्ला क्लिनिक्स का एक मॉडल बनाया है पूरी दिल्ली के अंदर, तो इसमें आयुर्वेद का कोई प्लान है आपका कि आयुर्वेद भी इसमें शुरू किया जाए? क्योंकि आज पूरे विश्व के लोग आयुर्वेद से जुड़ गए हैं और वो आयुर्वेद से चिकित्सा कराना चाहते हैं।
देखिए, इंडियन सिस्टम ऑफ मेडिसिन के लिए हमारा प्लान है कि अभी 1000 हम एक बार खोल लें, उसके बाद सेकंड शिफ्ट के अंदर 100 क्लिनिक हम स्टार्ट में करेंगे, कि ताकि लोगों को जिनको फेथ है, देखो मैं बता दूं फेथ का फर्क क्या आ रहा है। जो हमारी सोसाइटी एजुकेटेड एरियाज हैं या जो कि थोड़ा सा एफलेंट एरियाज है, वहां पर इसकी डिमांड काफी अच्छी है। पर जहाँ पर अगर हम लोअर कैटेगरी ऑफ सोसाइटी में जाते हैं तो उनको बिल्कुल फेथ नहीं है, उनको लगता है कि नहीं इंजेक्शन लगा दो, दवाई दे दो, तो उनको पहले उसको ग्रेजुएट होने में समय लग रहा है। बट हाँ, ये कि हम स्टार्टिंग में 100 मोहल्ला क्लिनिक में आयुर्वेदिक और इसका होम्योपैथिक का स्टार्ट करेंगे।
बहुत अच्छा सर, दिस इज वेरी गुड। एक चीज और सर यहाँ पर मैं चाहूंगा, आई वुड लाइक टू गेट योर ओपिनियन ऑल्सो, कि जो हमारी जो सीजनल जो डिजीज आती है, जैसे डेंगू, चिकनगुनिया, हर साल जो है ये बीमारियां आती हैं, और जब सीजन चेंज होता है अराउंड अक्टूबर, वी गेट ऑल दिस ब्रीदिंग प्रॉब्लम्स, अस्थमा, और जो एलर्जीज टाइप की प्रॉब्लम्स होती हैं। लास्ट ईयर दिल्ली गवर्नमेंट हैज स्टार्टेड अ वेरी नाइस कैंपेन, वो 10 मिनट वाला एक शुरू किया था, 10 मिनट एक हम
दोबारा स्टार्ट करेंगे।
बट उसमें सर, उसमें आयुर्वेद का मैं चाहता हूं कि आयुर्वेद को उसमें जोड़ा जाए, क्योंकि आयुर्वेद में चिकित्सा के एरिया में बहुत ज्यादा एक पोटेंशियल है। ऐसा हम लोग CII की तरफ से जितनी हमारी इंडस्ट्री है, जो हमारी इंडस्ट्री बॉडी है, वी विल बी वेरी हैप्पी टू कोलैबोरेट विद दिल्ली गवर्नमेंट, और उसमें किसी प्रकार का कोई, जैसे कोई भी एक्शन प्लान बनाना है, कोई स्टडीज कोई टुगेदर करनी है। लेकिन इसमें मैं ऐसा मानता हूँ सर, आयुर्वेद की अभी जरूरत पड़ेगी, क्योंकि अभी हमने जैसे कोविड में सबने देखा है कि बहुत अच्छे रिजल्ट्स इसमें मिले हैं और बहुत अच्छा लोगों को फर्क पड़ रहा है। तो आपने जैसे अभी प्लाज्मा बैंक भी शायद दिल्ली में सबसे पहली बार शुरू हुआ था इसमें कोविड में ही, तो मैं चाहता हूं कि दिल्ली गवर्नमेंट इसमें भी एक लीड लेकर के, और आयुर्वेद को थोड़ा और, दिल्ली एक हार्ट है पूरे इंडिया का। हम ये चाहते हैं कि आयुर्वेद का आपका कुछ ऐसा अगर विचार है कि इसमें काम किया जाए, कैंपेन शुरू किया जाए, जैसे कि अभी आयुष काढ़ा पी रहे हैं लोग, ऐसे हम डेंगू के लिए बहुत सारी चीजें हमारे पास ऐसे काढ़े हैं, जो डेंगू, चिकनगुनिया, मलेरिया, ज्वर, हर क्वाथ एक बड़ा पॉपुलर हमारा है, तो उसमें क्या क्या विचार है?
आप लोग बैठ के किसी दिन समझाइएगा, जरूर उसको भी प्रमोट करेंगे। देखो अभी जो हमारा कोरोना है, कोरोना के अंदर कोरोना एंड काढ़ा दोनों साइनोनिमस हो गया है, कि हर आदमी कहता है कोई भी कुछ भी इलाज करा रहा हो काढ़ा जरूर पियेंगे, तो हर आदमी को कोई रेजिस्टेंस नहीं है। सबसे ज्यादा क्या हुआ, डॉक्टर बीमार हुए ना, उन्होंने काढ़ा पीना स्टार्ट किया, उन्होंने काढ़ा पीना स्टार्ट किया तो सबको फेथ हो गया भाई डॉक्टर खुद पी रहे हैं तो हमें क्या दिक्कत है। और अगर आपका ये आप बता रहे डेंगू वगैरह के लिए भी कुछ है तो बताइएगा, उसको भी जरूर प्रमोट करेंगे। और डेंगू का जो हमारा कैंपेन है, वो कैंपेन तो 100% आयुर्वेदिक कैंपेन है, उसके अंदर कोई दवाई थोड़ा दे रहे हैं। हम तो कहते हैं 10 बजे 10 मिनट 10 हफ्ते सफाई करिएगा बस। तो सफाई का पद्धति आयुर्वेद का ही पार्ट है। आप ही समझाते हैं कि ये चिकित्सा का, दवाइयों का साधन नहीं है, बाकी पूरे आहार विहार विचार सबके ऊपर है। तो मुझे लगता है ये पूरा का पूरा कैंपेन आयुर्वेद का ही कैंपेन है।
इसमें भी सर जैसे काढ़ा बन उसका बहुत अच्छा बन सकता है। हमारे यहाँ ऑलरेडी आयुर्वेद में हम जब चिकित्सा करते हैं मरीजों की, बड़े अच्छे रिजल्ट्स। तो ये एक मैं चाहता हूँ कि अलग से एक प्रॉपर स्टडीज भी इसकी आप इनिशिएट करवाएं, कि जैसे कुछ पेशेंट हम लें मोहल्ला क्लिनिक्स में जिनको आयुष काढ़ा पिलाया जाए, कुछ को अगर दूसरी तरह से ट्रीट किया जाए, उसमें डिफरेंस दिखेगा। जैसे हमने अभी कोविड में बहुत सारी स्टडीज हमारे सेंट्रल गवर्नमेंट ने, आयुष मंत्रालय ने शुरू की हैं, और दिल्ली में विशेष तौर पर जो पुलिस फोर्स है उनको आयु रक्षा किट जो दी 80,000 लोगों को, उसमें भी बड़े अच्छे रिजल्ट आए हैं। तो सर आपका इसमें एक पर्सनल इन्वॉल्वमेंट मुझे चाहिए कि आप, हमारी पूरी इंडस्ट्री यहाँ आपके साथ है, हम चाहेंगे। इसके अलावा सर एक चीज और है, मैं तिविया कॉलेज में जब पढ़ता था तभी से मैं ऐसा सोचता था कि तिविया कॉलेज अपने आप में जैसे एक 34 एकड़ की प्रॉपर्टी है इन द हार्ट ऑफ द सिटी। करोल बाग जो आपको पता है बिजनेस सेंटर है इतना बड़ा, तो वहां पर मतलब एक इतना अच्छा कैंपस है, और आपका चौधरी ब्रह्म प्रकाश जो है, तो ये आज केरला ऑफ कोर्स जाना जाता है आयुर्वेद के लिए। तो मैं आपसे एक निवेदन और करना चाह रहा हूँ यहाँ पर कि आप इस पर थोड़ा थोड़ा सा अगर चिंतन करेंगे तो काम हो जाएगा कि एक वर्ल्ड क्लास यहाँ पर फैसिलिटी बने। वर्ल्ड क्लास को छोड़िए, एनसीआर में इतने लोग हैं जो कि अब हर आदमी केरला नहीं जा सकता है, उसके पास टाइम नहीं है। तो अगर हम यहाँ इसमें चाहे वो मेडिकल टूरिज्म की दृष्टि से या फिर जो है ट्रीटमेंट की दृष्टि से एक बहुत अच्छा एक सोर्स ऑफ इनकम भी बनेगा गवर्नमेंट के लिए। तो सर इस पर थोड़ा
इसके ऊपर बिल्कुल विचार किया जा रहा है। पिछली बार हमने सोचा था इसको बढ़ाने का, पर तब किसी वजह से हो नहीं पाया। जरूर करेंगे, दोनों इंस्टीट्यूट्स को ही बढ़ाएंगे।
बल्कि सर इसको हाँ जी,
बिल्कुल ठीक है, आपका आइडिया बिल्कुल सही है, इसको जरूर इसके ऊपर काम करेंगे।
हाँ, इसमें सर एक ये भी हो सकता है कि एक इंटरनेशनल एक आयुष यूनिवर्सिटी बने प्रॉपर, जिसमें कि आप पूरे विश्व से जो है लोग आजकल पढ़ना चाहते हैं आयुर्वेद को। अभी हमारी जो यूनिवर्सिटीज हैं, अभी जैसे जामनगर यूनिवर्सिटी है, बनारस हिंदू यूनिवर्सिटी है, वहाँ भी बहुत अच्छे पूरे इंटरनेशनल वर्ल्ड से लोग आते हैं पढ़ने के लिए। दिल्ली क्योंकि एक अच्छी लोकेशन है और अच्छा जो है, आपके दोनों कैंपस बहुत ही नेचुरल है, मैंने देखा है कि बिल्कुल नेचुरल है, अच्छी जगह है। फैसिलिटीज को थोड़ा हमें शायद और ज्यादा इनको इम्प्रूव करने की जरूरत है, रिसर्च फैसिलिटीज को।
ठीक, नहीं बिल्कुल ठीक है, इसको बढ़ाएंगे।
और सर एक मेरा हाँ, एक मेरा आपसे एक और निवेदन ये था कि जैसे हमारा आज ये कॉन्फ्रेंस चल रहा है, तो इसमें हमारा मेन गोल ये है कि हम आयुर्वेद को अगले लेवल पर, नेक्स्ट लेवल पर ले जाने के लिए आयुर्वेद को पॉलिसी में क्या क्या चीजें हमें और जोड़नी है। तो आज हमारे साथ यहाँ पर आयुष मंत्रालय से भी सेक्रेटरी जी वैद्य राजेश कोटेचा जी और एडिशनल सेक्रेटरी जी पाठक जी और काफी लोग जुड़े हुए हैं। तो आपसे क्या कुछ हम ऐसा कुछ रिकमेंडेशंस जानना चाहेंगे कि आयुष मंत्रालय क्या और कर सकता है जिससे आयुर्वेद और आयुष डिपार्टमेंट की पूरी जो है और पॉपुलैरिटी बढ़े, लोग उससे जुड़े और लोगों को हेल्थ केयर में बेनिफिट उससे।
ये क्वेश्चन आपने मुझसे पूछा है या सेक्रेटरी साहब
आपकी
से?
सर आवाज नहीं आ रही आपसे आपसे जैन साहब।
नहीं, मैं तो देखिएगा, मैं आपको थोड़ा सा शेयर कर लूँ। मैंने पिछले 20 साल के अंदर सिर्फ, अब मैं जो कोविड में हॉस्पिटल में आईसीयू में जाने के बाद दवाई खाई है, उसके अलावा मैंने 22 साल से कोई दवाई नहीं खाई, मुझे दवाई की जरूरत नहीं पड़ी है। मैं तो बहुत ही स्टॉन्च सपोर्टर हूँ हमारे जो पुराने जो सिस्टम है, मेडिसिन के सिस्टम जो हैं, उनका फॉलोअर हूँ। और मैं मान के चलता हूँ कि हमारी बॉडी को भगवान ने ऐसे बनाया है, ज्यादातर सेल्फ रिपेयरिंग मोड में है, सबको ठीक कर सकता है, बस अपना माइंड ठीक रखें। तो अगर हम अपने माइंडसेट को ठीक रखें, अगर देखो आयुर्वेदिक दवाई क्या है, आयुर्वेदिक दवाई तो आहार ही तो है आपका। ज्यादातर आहार को आयुर्वेद के लिए हम दवाई कह लें उसको या आहार कह लें, एक ही बात है। तो आयुर्वेद जो है आपकी जीवन पद्धति को सपोर्ट करने के लिए है, वो कोई अलग से कोई चीज नहीं है। तो मैं तो इसका बड़ा स्टॉन्च सपोर्टर हूँ। कई बार मैं कहता भी हूँ कि आयुर्वेद के लोग थोड़ा सा गड़बड़ क्या कर रहे हैं कि आजकल वो खुद ही एलोपैथी प्रैक्टिस करना चाहते हैं, बहुत बड़ा बैड नेम देते हैं वो लोग। आपके प्राइवेट प्रैक्टिस में जितने लोग हैं 80-90% लोग एलोपैथिक मेडिसिन यूज कर रहे हैं। मेरे से मिलने आते हैं तो वो कहते हैं हमें अलाउ करो मेडिसिन। अरे मैंने कहा भाई, जो चीज आप नहीं कर सकते हो रेफर कर दो। अगर कोई सर्जरी है तो रेफर कर दीजिएगा, जो आपसे इलाज नहीं होता उसको रेफर कर दीजिएगा। आपको 100 में से 100 लोगों का इलाज करने की जरूरत नहीं, 100 में से अगर 50 का इलाज करते हैं तो 50 लोग आपका इतना नाम बढ़ाएंगे, बहुत नाम बढ़ाएंगे। तो सबसे बड़ी दिक्कत क्या है आयुर्वेदिक प्रैक्टिस के अंदर, मेरा ये कहना है कि सब लोग सुन रहे होंगे, जब से आयुर्वेदिक डॉक्टर्स ने एलोपैथिक मेडिसिन के ऊपर अपनी डिपेंडेंस रखी है, जब से वो सोचने लगे हैं कि हम जल्द से जल्द रिजल्ट दे दें। अरे भाई, एलोपैथी में डायबिटीज का कोई इलाज नहीं है, एलोपैथी के अंदर हाइपरटेंशन का कोई इलाज नहीं है। अगर एक पेशेंट है 10 साल के बाद भी ठीक तो नहीं होता, अब आप उनको कॉपी क्यों करना चाहते हैं? आप कोई बात नहीं, 3 महीने में ठीक करो ना, 6 महीने में ठीक करो। अगर 6 महीने में ठीक होता है तो ठीक तो हुआ ना। तो मुझे लगता है हमारे को अपने आयुर्वेदिक प्रैक्टिशनर्स का कॉन्फिडेंस बढ़ाने की जरूरत है और उनको कहने की जरूरत है कि आप आयुर्वेदिक पद्धति को खुद माने। हमने उल्टा कर लिया, हम जनता को सिखाना चाहते हैं आयुर्वेद को मानो। अरे भाई आयुर्वेद को क्यों माने? वो जब देखते हैं कि भाई आयुर्वेद के प्रैक्टिशनर ही उस पर विश्वास नहीं कर रहे, तो सबसे पहले आयुर्वेदिक प्रैक्टिशनर्स को अपने आयुर्वेदिक पद्धति के ऊपर विश्वास होना चाहिए, और जिस चीज को आप ठीक नहीं कर सकते उसको तुरंत रेफर कर देना चाहिए। कई सारी चीजें ऐसी हैं जो कह सकते हैं मैं नहीं कर सकता जी, आप वहां चले जाइएगा, बाद में मेरे पास आ जाना, कोई बात नहीं, अभी ये इंटरवेंशन करा के आ जाइएगा। तो मुझे लगता है हमें सबसे ज्यादा जो भी लोग सीनियर लोग हैं अपनी कम्युनिटी के लोगों को बुला बुला के उनसे बात करनी चाहिए, उनको समझाना चाहिए। मैं तो कभी भी आते हैं तो उनको प्यार से समझाता हूँ, 100 200 लोग भी आते हैं, और कई लोगों ने मेरे कहने के बाद वो कहते हैं सर हम एलोपैथिक प्रैक्टिस बंद कर रहे हैं, हम आयुर्वेदिक प्योर आयुर्वेदिक में आ रहे हैं। एक तो मेरे पास सज्जन आए, कहते हैं जी मेरी प्रैक्टिस पहले तो लगा कि बंद ही हो जाएगी, पर थोड़े दिनों बाद लगा कि बहुत अच्छी हो गई है। तो लोग चाहते हैं, दिल्ली जैसे शहर में चाहते हैं, अगर आयुर्वेदिक प्रैक्टिशनर के पास वो जा रहे हैं तो दे वांट कि भाई वो चाहते हैं कि आयुर्वेद की ट्रीटमेंट उनको मिले, उसको एलोपैथी से मिक्स ना किया जाए।
Thank you, sir. It's a very good suggestion, and of course, definitely आयुष मंत्रालय भी इस पर काफी काम कर रहा है ऑलरेडी। और जो एजुकेशन, इसमें एजुकेशन पॉलिसी में काफी नई नई चीजें, अभी हमारे सेक्रेटरी साहब ने सुबह एक बड़ा अच्छा पूरा अपडेट दिया था कि क्या क्या नई नई चीजें जो है किस किस फील्ड में हो रही हैं। सो बस एक फाइनल शब्द आपसे मैं और सुनना चाहूंगा कि जो अभी करंट में जो कोविड का जो आपका एक्सपीरियंस है पूरा, उसमें क्या क्या चैलेंजेस आपको आयुर्वेद को इम्प्लीमेंट करने में आए, और इसके साथ साथ थोड़ा सा फ्यूचर में आप क्या सजेशंस हमें देना चाहेंगे, या जो गवर्नमेंट लेवल पर कोई और ऐसी कुछ आपकी जो दिमाग में कोई पॉलिसीज हैं जिनको हम आपके साथ मिलकर के इम्प्लीमेंट कर सकते हैं। एज ए इंडस्ट्री वी आर रिप्रेजेंटिंग द इंडस्ट्री, सो what are some of those final things that you would like to suggest?
देखिएगा, जब स्टार्ट किया ना कोविड के इलाज के लिए, तो शुरू में लगता था कि भाई आयुर्वेद वालों, आयुर्वेद के जैसे हमने चौधरी ब्रह्म प्रकाश, तिबिया कॉलेज और हमारा नेहरू होम्योपैथिक, तीनों को भी हमने करा के भी इसको कोरोना इलाज करेंगे। तो शुरू में लगा कि भाई काफी रेजिस्टेंस था कि भाई ये कर पाएंगे या नहीं कर पाएंगे। हमने कहा कोई बात नहीं, बैकअप के लिए हमारे जो एलोपैथिक हॉस्पिटल है, आईसीयू फैसिलिटी वो दे देंगे। बट जब हमने इसको स्टार्ट किया तो मुझे तक एक्सेप्टेंस बहुत बढ़ी, और कारण उसका यही रहा कि जो लोग वहां से इलाज करा के आए ना, उन्होंने बड़ी तारीफ करी, बहुत तारीफ करी। मतलब ऐसा भी आपको किस्सा रहा कि किसी एक अस्पताल में कोई पेशेंट था, उसको बाद में रेफर करके हमने आयुर्वेदिक अस्पताल में भेजा, तो वहां जाने के बाद खुश हो गए। हमारे एक एमएलए साहब थे, उन्होंने उनके कोई रिलेटिव को एडमिट कराना था, कहते सर उसको एडमिट कराना है। मैंने कहा भाई चौधरी ब्रह्म प्रकाश में करा दो आप। उन्होंने वहां पे एडमिट कराया, बाद में कहते हैं सर बहुत अच्छा किया आपने, बड़ा अच्छा इलाज था, बड़ा अच्छा ट्रीटमेंट था। तो मुझे लगता है कि बाद में जितने भी हमारे इंस्टीट्यूट हैं उन्होंने नाम कमाया, में भी जो पेशेंट गए वो दे वर थॉरोली सेटिस्फाइड, तो उन्होंने आगे जाके नाम कमाया। और जैसे मैंने बताया काढ़ा वाली बात है, तो काढ़े वाली चीज तो ऐसी एकदम से फेमस हो गई सब जगह, ये सभी जगह वो कहते हैं उसमें कोई रेजिस्टेंस बची नहीं। शुरू में लगता था कि मिला था, वो भी मेंटल ब्लॉक था हमारा ही था शायद, कि हमें लगता था लोग एक्सेप्ट करेंगे या नहीं करेंगे, जो पॉलिसी मेकर्स हैं उनकी शुरू में लगता था कि भाई इसको कोई एक्सेप्ट, अरे भाई जब एलोपैथी में भी कोई इलाज है नहीं, इलाज आपके पास भी नहीं है, तो मुझे लगता है कि आयुर्वेदिक भी अपनाने में बुराई तो कुछ नहीं है। कम से कम ये तो कह रहे हैं कि इसमें कोई साइड इफेक्ट तो नहीं है, अगर आप परफेक्ट है, बिल्कुल ठीक है, तब भी ले लो, कोई दिक्कत नहीं है। तो मुझे लगता है इसमें बहुत ज्यादा दिक्कत आई नहीं, शुरू में थोड़ा रेजिस्टेंस थी, पर बाद में बहुत अच्छा रहा है। और मुझे लगता है कि कोरोना की फाइट के अंदर काफी कामयाब रहा। और हमारे तो कई सारे जो प्रैक्टिशनर्स हैं जिनको मैं जानता हूँ, अब ये तो पता नहीं कि क्या है, उनको किसी को कोरोना हुआ नहीं है, वो सारे के सारे कहते हैं हम प्रैक्टिस कर रहे हैं, हम लोगों को दे रहे हैं। तो परंतु आज मैं 6 महीने के बाद कह सकता हूँ उनमें से एक को भी कोरोना नहीं हुआ। लगता है वो काढ़ा ज्यादा रोज पीते रहते होंगे, इसलिए नहीं हुआ होगा, उनकी इम्यूनिटी ज्यादा अच्छी रही होगी।
थैंक यू सर। एंड जस्ट वन लास्ट थिंग, मैं कल एक न्यूज पढ़ रहा था कि कोरोना से बाहर निकल चुके हैं लोग, जो कोरोना को हरा चुके हैं एक बार, और आईसीयू में भर्ती भी रहे और कुछ कॉम्प्लिकेशंस रहे, तो ऐसे पेशेंट्स को भी अब काफी प्रॉब्लम्स फेस कर रही है। और अभी जो न्यूज मैंने पढ़ी कि शायद राजीव गांधी में आप पोस्ट कोविड क्लिनिक को शुरू कर रहे हैं।
हाँ जी, स्टार्ट करने जा रहे हैं। देखिए मैं खुद उसमें से एक हूँ, जो आपने बताया ना कि आईसीयू में मैं रहा, मुझे अभी भी थोड़े दिन, अभी तक भी मतलब मेरी ऑक्सीजन लेवल स्टेबलाइज नहीं हुई है, कभी कभी डाउन चली जाती है। इतना केयर करने की जरूरत है, इसमें कोई बहुत ज्यादा इंटरवेंशन की जरूरत नहीं पड़ती है। अभी हमने प्लान किया है कि अगर किसी को ऑक्सीजन स्टेबलाइज नहीं हो रही है तो हम उसको ऑक्सीजन कंसंट्रेटर घर के लिए देंगे, सो दैट के घर पर भी उसको ऑक्सीजन का इंतजाम रहे। तो वो भी हमने फैसला कर लिया कि दिल्ली के अंदर रहने वाले लोगों को हम उनके घर पर ही जाके ऑक्सीजन कंसंट्रेटर दे देंगे, ताकि उनको ऑक्सीजन की दिक्कत ना हो। और ये पोस्ट कोविड हमने क्लिनिक कल या परसों में स्टार्ट कर देंगे।
तो इसमें भी सर मैं आपसे निवेदन करूंगा कि इसमें भी आयुर्वेद को जोड़ा जाए, क्योंकि आयुर्वेद में जो हमारा जो रसायन शास्त्र जो है, जो इम्यूनोमोडुलेटर्स या जो रिजुविनेशन की जो हर्ब्स हैं, स्पेशली अगर लंग्स में डैमेज हुआ है, किडनी में डैमेज हुआ, तो बहुत अच्छी औषधियां हैं। तो मेरा निवेदन है कि इसको भी आप
ठीक है, मैं इसको कर लेता हूँ
जी। थैंक यू सर, थैंक यू वेरी मच।
ओके, धन्यवाद, थैंक यू नमस्कार।
Namaskar. So for the audience, those who are attending from other countries, I would like to brief what the minister has just described. First of all, he himself has encountered the COVID disease and he came out of it. He is a very strong supporter of Ayurveda and AYUSH systems. Plus, he is like already taking some steps under his government. There are 2 main hospitals who have been dealing with the COVID-19 patients. And in each one of them, total, if we look at, I just got the data from one of the hospitals there. Up to yesterday, they had around 940 positive cases, and they have reported that nobody has died, no single death. And of course, various types of symptoms, various types of problems were faced by these people. Some of them got like some serious, they were shifted to hospitals. They were patients with comorbidity. So all this actually proves that Ayurveda has played a very important role and is playing still a very important role. As our AYUSH secretary also mentioned in the morning in the inaugural session, that more than 150 different studies are still going on. They're in the middle of some kind of analysis, but whatever the results are coming, we are seeing it not only in Delhi but from all the other states. We just had a wonderful session with other states, like Gujarat and Kerala and Odisha. So from everywhere the results are very positive. And this establishes one important fact, that Ayurveda is not just only a immunity boosting thing that as most people think. It's not only limited to some herbs, it's a complete medical system. And one of the things that I have just also inquired from these 2 hospitals is that a lot of people were given personalized. It's not that only these medicines were given. In addition to the Ayush Kwath and other things which are commonly given to all the patients, there were people who were attended to also individually, and customized treatments were given. The minister also agreed that Ayurveda is definitely a very nice medical science. And as I was requesting him to upgrade the 2 institutions that he heads, and I'm one of the institutions from where I graduated. They're good places, and it could become like one of the attraction of North India, I would say, or at least the national capital region. In addition, the minister also told us that he is planning to start the Ayurveda wing in the Mohalla clinics, which is a very interesting model in Delhi. They have created small clinics in different localities. And right now they are offering only allopathic medicines, but as the minister promised, he is also going to start Ayurvedic treatments very soon. They already made a plan. And he has also, just given us a word that he will also upgrade the 2 Ayurvedic institutions to make them into more international facility or international standards, so that more and more people, especially in the national capital region. We all know about Kerala. Kerala is the hub of Ayurveda for the whole world. But as I said, that Delhi, there's a lot of people travel to Delhi for different reasons, and Delhi could also be one reason to travel is medical tourism or medical value to travel, as we say, and especially for Ayurveda, because these 2 campus, I have been a graduate from one of the campus, and I would say it's a beautiful campus. Just in the middle of Delhi is very crowded, but as soon as you enter into Tibia College, the college where I studied, you feel like you have entered a village. It's just very natural. The buildings are very traditional. It was founded by Mahatma Gandhi and Hakim Azmal Khan together in 1920s. And the other campus I also got a chance to visit just a few months ago, I think before the lockdown started. I had a lecture there. It is 100 acres of campus, very nicely located, again in a very nice setup. So such a nice facility in Delhi. So he is also willing to upgrade these two institutions and also maybe speed up the job of creating an international class center there. With that, I think my job mainly was to talk to him and just get some ideas what is his plan for Delhi. Of course, overall, as we look at the world today, the whole world is looking towards Ayurveda. We had some wonderful speakers this morning, including Dr. Simon from Switzerland. It was very inspiring to know what's going on there. So I think Ayurveda is having a great future. We all need to really focus on this. We all need to work together. We all need to collaborate. I was very much impressed by Dr. Trehan's idea of Ayumed. This is a nice word he was giving. So we industry people and the people of Ayurveda, the doctors of Ayurveda, as Dr. Jain, Mr. Jain just rightly said that most of us, we have to start believing in Ayurveda. So with that, I would like to just end this session, and I think we have no questions because the minister has already left, but I just briefed what he was saying. It was nice to have him, and once again, I thank the minister for giving us his precious time and just sharing what was his experience in controlling or dealing with the COVID crisis in Delhi. Thank you very much. Namaste.
Thank you, Dr. Pratap Chauhan, for chairing the wonderful session. Thank you, Shri Satyendra Kumar Jain ji, for joining us today and taking time out from a very busy schedule. We will begin our next session, Ayurveda Products sector, at 1:15. We have a time of 10 minutes. We have requested our esteemed speakers to kindly log in. We will begin the session in next 5 to 6 minutes. May I request everybody to kindly be on a mute mode. We will begin the session in next 5 to 6 minutes. Thank you. Welcome back. We will now begin our next session, Ayurveda Product Sector, Challenges, Growth Opportunities and Way Forward. May I introduce our panelists, Mr. Ranjit Anand Purana, Dr. Ram Agarwal, Director, Natural Remedies Limited, Dr. Sham Patel, CII Governing Council Member of Ayurveda, Managing Director, Green Medic Solutions, Managing Medical Director and Head of Technical Services, Pentacare, Ayurveda Pharma, and Pentacare Ayurveda Specialty Clinics. We welcome you all to this important session. May I request Mr. Ranjit Anand Puranik to kindly moderate the session. Thank you.
Thank you, Rak. And it's a pleasure to this August gathering here. Since morning, we've been enriched with various dimensions of Ayurveda sector and how we have dealt with COVID-19. And, just a quick mic check. Am I audible? Just wanted to get that mic check before we move on.
Yeah, Mr. Good afternoon, Mr. Ranjit.
Yes, great. I would, thank you, Dr. Niranjana Murthy. I would start by introducing a good friend of mine, a senior, Dr. Niranjana Murthy, is Managing Director and Medical Director of Pentacare Ayur Pharma as well as Pentacare Ayurveda Specialty Clinics. He's not only into manufacturing but also into healthcare delivery. He has extensively worked with NABH on accreditation standards.
Yes.
The Ayurveda healthcare clinics and centers with NABH. That was a very marquee kind of contribution of Dr. Niranjana Murthy. And in his own words, he's got a passion for assessment of the rationality of formulations. So I think, I welcome you, Dr. Murthy, to the panel. And I'll move on to introduce another very senior on the panel, Dr. Ramnathan, who's the Managing Director of the Sitaram Group of organizations, which are not only into manufacturing, but they also have a health resort, a hospital, and they also run a college. Dr. Ramnathan has always been a senior in industry with us. And, he's been serving and like an activist, has been the General Secretary of AMOI. And most of what we see in Kerala is sheer agitation and perseverance of Dr. Ramnathan. Welcome to this panel, Dr. Ramnathan. My other good friend on the panel is Dr. Amit Agarwal. He's Director of Natural Remedies, a foremost company in veterinary products as well as herbal extracts. By education and qualification, he himself is a pharmacologist and has over 110 published papers to his credit with over 6 live patents that are there. I also refer to him as a good friend. Wherever there is any standardization as well as any issues with regulatory interpretations, he's I would say, a walking authority as far as these matters go. My other good friend from Gujarat, Dr. Ghanshyam Patel, by education, he's an MD Ayurveda Dravyagun from Gujarat Ayurveda University, and now runs his own company, which is a consulting company by the name Green Medic Solutions. He's the managing director there. And as per his own introduction, he has the place of pride to have launched over 250 products in the Ayurvedic sector, extensively trained in WHO GMP, and today is proudly consulting with around 20 of very major companies in the Ayurvedic sector. I welcome all my colleagues on the panel to this panel, and let's begin. May I first, Dr. Ramnathan, may I first, pose a small little question to you, because we had the good fortune of listening to Madam Shailaja teacher this morning. And, she spoke extremely well about bringing Ayurveda in public health. But can we ask you to give us some more details about what exactly is this public health program that Kerala did? And, from an industry dimension, an industry perspective, could you throw some light on that, please? Dr. Ramnathan. Dr. Ramanathan? Ask him.
I think so.
Okay, Ranjit, can you hear me? I just want to check.
Now, yeah. Now, Dr. Ramanathan, are you there? Can you hear me, sir? Okay. Okay. Then public health, I will wait for Dr. Ramanathan to get his connection back online. And from public health, let me move to, basically Ayurveda practice. Dr. Niranjan Murthy, I will pose this query to you, moving ahead. How have the Ayurveda physicians, how have they normalized? Are they back at work? Are the clinics actually functioning? And I'm talking of the private practitioners. What is the scene in let's say in normal life today? How normal is it?
See, as on today, if you consider a place like Bangalore, almost every day the number of cases, the confirmed positive cases is growing. The risk involved in the community spread is also growing. And what it was a month back compared to that, this month, I'm talking about the month of August, slowly there's a little bit of vary about participation. Can you hear me?
Yes, we can, sir.
Yeah. And a little, what to say, dizzy about the whole thing there. Now, those who have the risk appetite, they are going back to their clinics and they are running the show, and whatever the mandatory the recommendation or rather the updating is required regarding SARI and ELI cases registration every year. They are doing it. But overall, the situation is compared to what it was somewhere in the month of the mid part of April, March. To that situation to come back, probably it may take a few more months. And
Madam, I cannot possible to unmute. That is my problem.
And I think it is quite
Okay.
very premature to judge what could happen down the line next maybe 3 to 4 months. But as of today, slowly things are happening, and some of the people are really decided to open once in or twice a week. And some people have started practicing from home, the online content. And in that way, we should appreciate the the postal department, which is helping a lot to all the physicians to send the medicines in a very
ഞാൻ 15ാണ് അപ്പൊ എൻ്റെ ഒരു അരമണിക്കൂർ കഴിഞ്ഞ് ഞാൻ ഉടനെ വിളിക്കാം ടീച്ചർ നന്നായിട്ട്
Dr.
രാജമോഹന്റെ പേരൊക്കെ എടുത്ത് പറഞ്ഞു.
Yes. And then I'll just come back to you with the question. We can hear you loud enough now. Yes, sir. Dr. Murthy, continue, please.
Yes. This is where it is now. Slowly it is limping back, but not exactly. We can't say normalcy. And when it reaches normalcy, it's $1 million question as of today in a place like Bangalore.
And I'll move on. What is the, the Ayurveda physicians consult and take advice from each other. There's always this consultation that is there. How are they exploring the interventions? We have the published prophylactics. We have the AYUSH Quad, Sanchimanivati, Chavanprash, and all of these kind of things. We are now clearer, I would say, about COVID-19 and the various kind of groups that come about. Is there an emerging consensus? Is there some kind of SOP, some kind of belief system, this kind of, this discussion, sambhashan, if I may call it? Do you see that emerging?
No, definitely it has started. See, in the initial phase, the SARS-CoV-2 was really Greek and Latin for the community. And also the stringent policy of the exclusivity with which the government mechanism managed this within their own setup. The people were little unaware about the complexities involved in this case. But in due course, when the information started spreading and start percolating about the etiopathology, etc., slowly the practitioners who are trained in the respective who are practicing with, each of these people started correlating clinical conditions, what is being seen or explained about the SARS-CoV-2 or maybe the COVID-19, and later to many of the descriptions available in the classics. And each individual, based on their academic orientation and also the clinical orientation, they started segregating and correlating to different conditions. Some people said it was Sannipatha Jwara, some people it was an Agantuja, Sannipatha Jwara, etc. End of the day, as of today, as you rightly said, there are many committees formed at different health is the states, many states positively. They form many committees and subcommittees, And to a large extent,
Yeah.
ready protocol, but only the point is whether these protocols are applicable. For example, if I take the Karnataka scenario, though the protocol is ready and the protocol based on different line of management, both prophylactic and for the treatment. Again, in the treatment, asymptomatic to symptomatic to mild symptomatic to again a condition where the people are in severe symptoms. Now the protocol is ready, the line of management is ready, the list of drugs are ready, but only thing is it's left to the policymakers to give an opportunity, if not in a big way, at least in the selected conditions, selected areas, or selected COVID center to make use of this opportunity and the rich traditional health science. No, you are not audible, Mr. Ranjit.
What do you think is the emerging acceptance by some of our complementary physicians? I'm talking about allopathics and homeopaths to the Ayurveda emerging SOP, because unity is king. That's kind of an established maxim from Ayurveda. But what has been there at GP level, at actual societal level? What is your reading of that? Because all of this augurs for Ayurvedic commerce. Ultimately, this is an industry and product session. So, can you reflect with that dimension?
No, see, I will tell you as an industry person, apart from the practitioner point of view, COVID-19 is a blessing in disguise in bringing the science to the next trajectory. Overall, what the people, the skepticism with which I'm particularly speaking from a counterpart's point of view, what initially they had the skepticism that it is a cocktail of some jaddi booties, to that mentality, today they have reached a stage to stand, stop, and again ask what exactly your science is, what is this talking about? And it's all a very legitimate and a very genuine questions. And now I think it is an opportunity. It was not seen prior to March, I will tell you. Prior to March, situation was different. Now, post this COVID, after understanding the limitation of science and also understanding the strength of Ayurveda in managing a condition where it is not only all these years we used to talk about non-communicable lifestyle disorders. Now, even in communicable disorders, the role of Ayurveda people have started realizing. It need not be only herbal medicines. I will tell you, there are physicians trained in allopathy who are so skeptical about herbo mineral preparations. Now they come and say, yes, for the stipulated time, with the intervention of qualified physicians, we are ready to take the medicine. I will tell you, this is a big, change in the mindset of the counterparts. Now, what I always believe is, this is the time when we have to be very sincere in our approach. And this is a time where we have to get rid of a very amateurish and abysmal claims, and also, a far-fetched proposition regarding the possibility of Ayurveda, etc. Be realistic, understand the strengths, explain your positives in a language understandable by our counterparts, and I'll tell you the next trajectory, what the situation has given us. Probably from there, we can jump to the next platform. It's a great boon.
God bless you, sir. God bless you. And, I'm sorry to, please continue.
No,
and then...
it is, what I give, it may not be at the institution level, but at the ground level, when we talk to our counterparts who are maybe our family friends or maybe our friends or maybe family members who are in other parallel systems, this is what the overall feedback we are getting. And my only concern is we need to be very clear to ascertain the strength and in a projected appropriate manner.
Clearly stated is what you're saying. Clearly stated scientific viewpoint. Yes.
That's
Dr. Ghansham, you are in some of them are FMCG, OTC companies. Consumer has always had faith in Ayurveda. Do you notice any change, a kind of a transformation movement from faith to science with this pandemic performance for Ayurveda and Ayurveda products? Sir, unmute your mic, please.
Yeah, can you hear me now?
Yes, absolutely.
Okay. Yeah, see, basically, since I am located in Gujarat, I would first like to just explain the situation here in Gujarat is a bit different than the southern part of the India. In Gujarat, basically, allopathy, this modern science is more prevailing than the Ayurveda. So Ayurveda is still in a stage of struggling to get its own identity and recover acceptance. But still, the situation happened post-COVID. I would rather say that at the time of the COVID, the thing happened that when people found positive and they approached the allopathic doctors, modern science doctors, and they just raised their hand that they don't have any medicines. So people were clueless, they had to go now. So at that time, at the very same time, actually things happened like AYUSH ministry and local state government also started promoting Ayurvedic medicine as an preventive and prophylactic measures, and they started free distribution of medicines in public. And public thought that they are also getting cured, like they are being prevented, and they got the results. So then after this just spiked up this situation, and people started getting aware about the Ayurveda, and they started even searching. Everybody was at home; they were free to search, and they were ample time to think about this. So yeah.
Let me interrupt you here. What is that one trigger that you see? What is that one ignition that happened in the mind of the consumer that he should come back to his medical heritage? You understand what I'm saying? Because COVID is a Chinese disease. So the aspect like this, that what was that one ignition that really sparkled the entire thing? What credit? Where would you give the credit?
Sir, see, that one thing what I figured out is no doubt Dr. Murthy also said that this Ayurveda is our traditional system of medicine. But as I said, that in Gujarat region, actually people are not that much aware about this traditional medicine system. So the thing that ignite people to turn over to Ayurvedic medicine, the situation, the circumstances happen over here is like this modern science were not having any medicines, and at the same time, lots of sunshiny vati and this ukala and everything just from everywhere, like social media, from this, TV news, and number of other things just started bombarding about the Ayurvedic things, and people were just turned over this Ayurvedic, just carried away with that. So far, I'm still reluctant to say that. I don't think this trend will how long it will go on. But right at this moment, the people who have been benefited from this Ayurvedic medicine, and they are also now spreading the same things to others, and people are getting aware about this Ayurvedic system. And maybe not right now, but in near future, you can see that Ayurvedic hospitals will be filled up with more patients than people.
Tell me, will you give credit to the Prime Minister himself?
Yeah, absolutely, absolutely. Prime Minister.
I'm sorry to put the words in your mouth, but
yeah, actually, I was about to say that the thing what happened is Prime Minister said about this AYUSH, the preventive complete regime to follow. At the same time, what happened in India, Gujarat, our the health ministers and Dr. Jyoti Ravi also announced some data that somewhere 5,000 people cured or maybe prevented from this herbal and Ayurvedic medicine. Actually, that news also spread over entire Gujarat, and also that also impacted a lot in people's mind.
Something very important that you said some time ago just now was that you don't feel this sparkle and this spike will continue. And Dr. Murthy reacted with this by saying that, we need clear speak. We need clear speak science to come in. You're also a doctor. Dr. Murthy is also a doctor. How do we continue this sparkle?
My aspects of saying is a bit different. Until and unless we establish Ayurveda as a scientific, is a science, and it's very similar to the modern medicine, it's a bit difficult to establish this thing in consumers or people's mind. Now, my concern was Still people are looking for the vaccines. Modern people are also looking for the medicines, antiviral, and they are asking for the vaccine, when will it come?
Yes.
So that thing is, people still looking for the very immediate and short and kind of very quick fix kind of thing. Quick fix actually looking for.
Agreed. Yes.
So here the thing is, we have to show them that even Ayurveda is not only the prophylactic, but also can be a quick fix. And for that, only the way we can do it by the scientific evidence. We have to generate those scientific evidence, and then only then we can establish our Ayurvedic treatments.
I'll move a little ahead. I'll come back to, because ultimately you're talking of clear communication to society.
Yeah.
So I'll come to Dr. Ramanathan. Dr. Ramanathan, can you hear me? Are you audible? Is your connection sorted out? Okay. The question that I wanted to ask Dr. Ramanathan is that keeping in mind and I think Dr. Murthy or Dr. Gansha replied to the entire issue, what are the new kind of products? I mean, we know the immunity boosters, and we know ashwagandha, tulsi drops, we know haldi, all of that has happened. But do you see a plethora, a whole basket of new products being launched? Because in the ethical space, Dr. Murthy and Dr. Gansha, I have not seen any kind of flourish that has come. So what do you think is on the anvil? And ethical products means prescription, Ayurveda, and it's science will have to talk. So keep in mind even clinical trials. What do you see which is on the anvil? What do you think that will come? Any reactions on this? Anyone? I mean, Dr. Murthy or Ganshamji, you can just reply to that.
Yeah, Dr. Puranik, actually, thing was one of the actually questions. Your point was about the Ayurvedic OTC medicines. Now, how we can establish Ayurvedic OTC medicine even after COVID-19?
Yes.
What to do to keep this shines intact even
Absolutely.
in period?
Yes.
So here the thing is, there are two very distinct dosage form of Ayurveda. Like one is a classical pharmaceutical dosage form. Another is a OTC kind of over-the-counter kind of products which people can get it from any shops and can use it without any prescriptions. Now the thing what happened that during the COVID, Ayush Ministry already published the regime of to follow during this period. So all the medicines were classical. So there was here in Gujarat there was a very skyrocketing demands for Sakshamani Vati and Chyawanprash, and people were looking for the amla the pulp to make the Chyawanprash in summer. So and right now things is worsening in case of the availability of the raw materials of gill oil. And this, because I'm also in farming and cultivation of medicinal plants, I'm very specifically seeing the uncontrolled use of gill oil right now. And things is going on like people are doing anything in the name of gill oil. So, because just to meet the current requirement. Here the thing is we have to make sure that not an account of quality of materials should be promotion or Ayurveda. So, in case of OTC medicines, definitely we need some innovative dosage form which can attract the consumers. Classical are their place. It is a prescription medicine, should be prescribed by the doctors in a legitimate dosage form and as per the people's illness and everything. So my just take on in this is for OTC medicines, we have to venture into an innovative dosage form and a very consumer-friendly dosage form to keep Ayurveda in market, in OTC market alive. I think Dr. Murthy want to say something.
Yeah. See, I just add supplement. Dr. Ranjit was telling something?
Dr. Murthy, just add the ethical products dimension.
Exactly.
If you can reflect on that, please.
Yeah, definitely. See, I agree, as Dr. Ghanshyam said about what to say, huge demand for some of the herbs like Giloy, Ashwagandha, etc. I do agree with that. But per se, see, as I said, we are pushed into, or rather, the situation made us to get into a new trajectory. Now, not only the counterparts, even the public, their perception about the Ayurveda as a whole, especially in managing non-communicable and non-infective conditions, has gone up such a, rather, the expectation has gone so high. So right from the presentation of your product, the evaluation of the product, and also the what to say, the ethical boundaries with which has tremendously gone up now. So this is what I'm seeing. Even a couple of months back, those who were skeptics about a simple anti-arthritic medicines, now they have come forward. See, this is a big boon actually. It's a big boon. Now it's left to the industry how you going to document your products, how scientifically you present your product, and please understand it is a responsibility of the industry to really cope up to the situation, go beyond this a cocktail of jadi booties. This is the perception among the majority. Now this opportunity, this COVID has given an opportunity how scientifically we can present our product.
Interesting. 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 You've said is that that's not to apply. But Dr. Murthy, just reflect on something that Vaidya Kotecha said this morning. 91 clinical trials which have been launched in CRTI, but hardly any industry has kind of initiated these clinical trials. What is stopping us? I'm included in that. What is stopping us from getting the act right? Because post-mortem, you put your finger on the pulse and said science will talk. Faith spoke thus far, henceforth science will talk. What is stopping the industry from that clinical trial part?
See, how you put yourself into the shoes and assist yourself. See what type of trials, the kind of trials and the number of patients, the size of your samples, etc. What is being demanded today in a scenario like COVID. Let us, many of our companies comes under the MSME category may not get into that possibility. But at the same time, I cannot discount any company for that matter, irrespective of the size and stature, has to chip in, have to put in the money, use their whatever the resources available, and definitely we have moral responsibility to get into documentation in an acceptable way. There is no what to say discount about it. But only thing is, see, since you asked about what the industry is playing, from personal capacity, somewhere in the April itself, I wrote a serious, a long and well-researched mail to the PMO. And where my argument was, it is such a beautiful science. There are so much of institutions available in the country at the government level, and a good number of even the manufacturers. But unfortunately, even with the protocols, even with the standard classical preparation, we are not talking about any proprietary products. Even with the classical preparation, when we sought the large extent, because of its own inbuilt limitation of managing COVID-19, many of the companies are not given the opportunity. I'm talking purely from classical drug point of view, not any patent drugs point of view.
Okay. Dr. Amit Agarwal, your experience in international markets is extensive. Can you please switch on video and unmute yourself?
Yes.
Yeah, can you hear me, sir? Your experience in international market is immense. And now I'm talking about acceptance of botanicals, not really the botanical could be from Ayurveda, but in an unsynthesized form, has Ayurveda botanical really made its mark as a medicine? Any examples that you can share with us? Because, all said and done, some of our luster in Ayurveda and acceptance to Ayurveda also comes in as to how well we do in Western countries and markets. Can you reflect on this, please?
Okay, I would say a majority of the Indian botanicals are still getting exported as dietary supplements or nutraceuticals. and there is very little export as medicines, even though these products are licensed medicines in our country. And there are multiple reasons for that, and one of them being the regulatory requirements for medicines is far more stringent. But I just, if you permit, just like to comment on, in fact, the question that you had asked Dr. Murthy. Why is it that companies, Indian companies, don't come forward with clinical trials? And I think these two things are related.
Yes.
And my understanding of this is you either have a classical product or a product in public domain, like your AYUSH Quat, which has been put together by the ministry. And generally, private sector companies which wish to come forward in spending a significant amount of money on clinical studies only when they are able to see a path on the return of investment.
Okay.
So individual botanicals, like I manufacture a number of botanical extracts and export them. And it has been difficult for a company like us also to spend, even though we very much wish to, on a particular clinical trial unless we hold some form of patent or IPR. And as you know that holding IPR on medicinal plants is yet another controversial subject. And it has become very difficult with the recent guidelines issued by the Patent Office on, granting patents. Then we have TKPL also, where.
Amit, what I'm saying is that in these COVID, this entire COVID imbroglio, I will call it, what is the interest? Your expertise in herbal extracts, you're dealing with some major multinationals. What has been the interest? Have you seen some kind of spike in terms of herbal extracts or crude medicinal plants from India? Have you seen something like this?
Yes, very definitely. With any medicinal plant which has history of usage as a rasayana, plants which have any scientific studies as immune modulators, we are seeing a surge in demand, multiple inquiries coming. And what the multinational companies are asking is evidence, hard scientific evidence, basis which they should be able to make some claims. And that is what is lacking, and that is what is really holding us back from, achieving a full potential of the demand.
So, next question to you, Dr. Amit, and reflecting on what Dr. Murthy said, and also reflecting on what Dr. Patel said, in terms of continuing the sparkle in post-COVID, or let's say COVID more in control kind of era, science will talk. And you have fused that together to say that if Ayurveda has to become a global science, a primary kind of healthcare science, the science has to talk. And even to the Indian consumer, faith was the instigation or the ignition, but science has to follow. This is what you're saying, and you have flagged the entire issue of public funding for medicinal plant. Tell me, Dr. Amit, you must have explored this. No venture capital funds coming in for clinical trials, or is patent the only problem that, because trademark is a huge thing in Ayurveda. We've seen transactions of 1,000, 2,000 crores on trademark sales. So that be a hint.
Okay. See, even with venture capital, what we ideally need is some kind of schemes where government financial assistance is made available through bodies like ICMR, NMPP, DBT, wherein some amount of contribution should come from the private sector, and clinical studies on substances which are non-proprietary, like the AYUSH Quat or individual plant extracts like ashwagandha or palme, where IPRs are not possible. Any clinical study would cost 30 to 40 lakhs, maybe 50 to 60 lakhs also, depending upon the protocol that you have in place. And if these have to follow good clinical practice guidelines, then just having venture capital alone or having a trademark on the botanical preparation is not a surety enough for the return of investment. And it is for this reason that I recommend that there should be schemes from the government to support clinical studies.
Okay.
Ranjit, now I am hearing now. Okay. Hello.
I'm
Ranjit,
coming to
now
you
I
for
am in
public
the
health,
hearing.
Dr. Ramnathan. Yes.
Okay.
Just
Ask
give
me,
me 1
sir.
second. Last question to Dr. Agarwal. Sir, Natural Remedies is a veterinary products major. How is the sector fared in these COVID times?
So in the veterinary, the bigger segment is cattle, and since milk has been an essential commodity, we have not seen too much of impact on the cattle sector. However, in the beginning, just when the surge started in the country, there were some rumors where people were linking consumption of chicken to COVID or spread of COVID, and that was a very dark time for the poultry sector.
Oh my God.
And
Okay.
so there were times where the poultry farms have become bankrupt, the chickens were distributed free, or the poultry farmer himself killed his own chicken just to save on the ration. So the pet segment, however, is a smaller segment which has seen small amount of improvement because parents are able to spend more time caring for their pet. But overall, it has been a mixed bag of initial steep lows and now slowly it's stabilizing.
So that portion of the AYUSH sector is limping back to normalcy. With everyone's permission, I'd like to go back to Dr. Ramnathan. Dr. Ramnathan, my initial question to you was about, Kerala has publicized the government support for Ayurveda intervention in management of COVID, and it's kind of a torchbearer for rest of us in India. The teacher, your minister, also was very enthusiastic about the Ayurveda. Can you tell us the ground realities? How has it meant for business to Kerala manufacturing industry from Ayurveda? Has there been a spike of demand? Is only restricted to Aushadhi and private sector only was watching?
Sorry, I have some problem in the network. Now I got it. That is Kerala. That is now the first time in the history of the Kerala, the private doctors and government doctors and manufacturers and university people sit together and give a protocol and 78 page of the summary. That area is a 7 area we are covered: utilization, available human resource, urgent capacity building, an inevitable link, Ayurvedic strategy of the prevention of COVID-19 and mitigation COVID-19 and data management and fund resources. And we have 7 area. That is, one is SOSYM. SOSYM means below 60 years aged people, how to treat. And another one, Sugatsiyam, that is above 60 years. And Punarjanini, that is specific Ayurvedic management, patient QA, and Niramaya. And all the things are giving to the government. And finally, the Ayurveda Raksha Clinic. That is, the minister already said all the government hospital and the dispensaries is converted to Ayurveda Raksha. And the private sector also, that is Ayurveda Manufacturers Association, Hospital Management Association, Ayurveda Medical Association of India sit together, and we have, and the support of the CII of Kerala chapter, we have formed a 700 manufacturing unit and 3,000 retail outlet and 300 Ayurveda hospital clinic and Ayur Raksha clinic, Ayur Shield, in the name of Ayur Shield. The Ayush Raksha is government and Ayush Shield is a private. And jointly, now we have 2 lakh people we have given the medicine. The result is already fantastic. And we have saved
medicine, Dr. Ramnathan.
Yeah, medicine.
Just one question. This medicine that was given, was it sourced from private manufacturers?
That is the medicine. Actually, what happened? All things the government sector is giving only the government sector outside only.
So
they are
the
not able to
business,
purchase.
Dr. Ramnathan, all of this entire energy that you put in did not really result into commerce and public health commerce for the Ayurveda manufacturing sector. Is that correct for me to say that? Do you
But
think?
but without the support now, the government, that people is totally changed now. They are already changed the conversion to the, that is preventive sector. Now they are believe in more in Ayurveda. So that area, Indugandham, Chavanaprasham, Chadakam, and Amarajita Churnam, that area we have some support now.
But
But
Dr.
the government
Ramanathan,
is not
what I'm
giving a
saying,
support.
not to be argumentative, but after all the philosophy and all, as manufacturers, we require commerce. So that has not come. Are you hopeful that that will follow?
Sure, because now there is a demand is more. There has some limitation. Government is some limitation. But now we are planning to the positive cases. The government is not allowed to treat the positive cases. That is, ministry is already mentioned that area we can enter. There is a possibility, so the private sector is more. But we are facing the big problem in the hospital structure. The hospital structure, the government is not allowed to anybody to for the treatment. The protocol, the medicine structure is gradually Chavanaprash and Indugandham all are tremendous potential now, but we are facing the raw material. That is the issue that we are facing now.
Excellent. We are now down to the last 5 minutes of this entire program. And I would like a suggestion coming from each one of these of us panelists to something that Rajiv mentioned right in the early morning in his inaugural speech. He spoke about, we have to identify enablers to build, accelerate, and grow Ayurveda on a credible kind of foundation. So, may I start with you, Dr. Ramanathan? If you can give me one policy initiative that you would like Ministry of AYUSH to enact, by which we grow the Ayurvedic sector, we build on the foundations on a credible particular aspect. Can you please give me one particular, because this has to be the takeaway that we give as an output of this panel, please.
So we need the research and a documentation, proper documentation. For example, we have a 2 lakhs documentation, 2 lakhs people we are treated. This effectiveness, we can prove that and hand over to the ministry or WHO. Definitely, there is a good chance for the fundraising. We need a urgent funds. Actually, we are getting on 10,000 crores only. We need at least 50,000 crores. That is for research purpose and medicine plants, all the area, manufacturing also. That is my suggestion. 50,000 crores, not less than 50,000 crores.
50,000 crores, okay.
You add 1 0 also, no problem. I have no.
I'll add a 0, sir.
But not less than 50,000 crores.
Yes. Dr. Agarwal, Amit, can I request you to give your suggestion?
Sir, I would say, I assume this is not restricted just to COVID that you are talking about. It is in general upliftment of Ayurveda. I would say schemes which support RCTs, randomized double-blind placebo-controlled studies, would be the demand generators for future.
Excellent.
That would be my single recommendation.
Dr. Gancham?
Sir, basically, since I am also in medicinal plant cultivation, and what I believe is the entire world knows Ayurveda by the medicine, the herbs. So my suggestion is that Ayurvedic medicine, medicinal plant cultivation should be taken into a policy for, and very important is it should be given a status of agriculture produce. Actually, because I think in our country, medicinal plant cultivation is not considered agriculture. And that's why the farmers, people are not getting all the benefit what horticulture farmers are getting. So, if we have a good quality of material, consistent quality of material, we have to go to cultivation. And NNPP and I should plan a very clear-cut concrete policy on how to make this medicinal plants available for entire world.
Thank you, Dr. Gancham. And lastly, Dr. Niranjana Murthy, please.
I will come back to the COVID itself. See, this is an opportunity. And in this opportunity, even in a Kerala scenario, Mr. Ramanathan said about the limitation of allowing Ayurvedic intervention in a full-blown condition in the center. My argument right from the April, I'm doing it. Why can't we take any classical set of medicines a protocol driven, accepted by the technical people, get into a center and allow these medicines, which are already under the Drug and Cosmetic Act, it's all approved. And even in allopathy, the line of treatment, what is managed is, again, not based on any protocol as in today. So if it's the case, why can't you take for different categories, both the mild to moderate symptoms to full-fledged complicated cases, why can't our medicines, both of herbal and herbo mineral, given a fair chance to play a role? Because this all started because of COVID. Let us start and complete with the COVID itself.
Okay.
And then it will take us to a next trajectory, and which is not happening as on today.
So to summarize, you're clear that a classical protocol involving classical medicines as well as services and therapies, including diet control, lifestyle, should also be documented and taken forward. Good. Friends, on the panel, it's 1:55. As a panel, we have come to the end of our time. And I want to personally thank all of you for first accepting this invitation and coping with whatever other readjustments that you had to do and giving your best right here. So Dr. Ramnathan, Dr. Amit Agarwal, Dr. Ghanshyamji, Niranjana Murthy, and of course the entire team at CII. Thank you for this opportunity to share our entire thoughts in this. Thank you.
Thank you, Ranjit.
Thank
Pleasure.
you, Ranjit.
Pleasure.
Thank you, Ranjit. You have done
sir.
very well. Thank you.
Thank you.
Good afternoon, Mr. Rajiv.
Good afternoon, sir.
Rajiv, done well. Welcome, Hari Nambudiri.
നമസ്കാരം ഡോക്ടർ രാമനാഥൻ. നമസ്കാരം.
MD of Ayurveda Hospitals. Dr. Anand Samir Chopra, President, German Physician Association, Ayurveda Medicine. Member, Executive Committee of the German Umbrella Organization for Ayurveda. May I request
Hello.
Professor Gangadharan to kindly moderate the session. Thank you.
Namaskar to all of you. I am extremely happy. I hope I am audible and
Yes, sir.
my video and audios are clear.
It is.
Okay, thank you. I welcome all my panelists. Mr. Hari from Sridhariyam, Dr. Rajiv Vasudevan, Ayurveda, and Dr. Samir Chopra, Anand Chopra from Germany. Let me take 2-3 minutes to give some of my observations as a chairperson before I invite honorable speakers to dwell on the subject. I consider, based on my experience of so many years, that hospital services, which includes also wellness and well-being to a certain extent, is one area which has not got any focused attention by any group, including government and industry. For last 10-15 years, we have got a lot of interest generated in the products area. And especially if you see to the products area also, we can see the growth is more on OTC and cosmetics range of products, which actually can survive only if the basic Ayurveda survives and grows and flourishes. So that happens when Ayurveda as a Chikitsa Siddhanta or Chikitsa Shastra has repeatedly get into a state of very good solid growth and acceptance by the society, and that is the fulcrum through which all other industry can grow. If this aspect is not considered in the right perspective and given fuel to grow by government and other stakeholders, Ayurveda will not take the challenge of facing the 21st century and beyond. In this area, I think there are specific areas of attention. I'm sure the panelists will dwell upon that, but I'll just hint some of the things that what should do, we have to encourage entrepreneurs, young Ayurvedic community who has got some kind of clinical acumen to start their own centers in metros and small towns and townships with appropriate kind of support system by in way of grants or soft loans or some kind of responsibility given to them for their growth. That will be one of the good areas of attention by the government. We should also think in terms of developing good kind of infrastructure in terms of resource persons and also infrastructure. So in the area of resource person, also in the hospital now lack trained pharmacist, trained therapist, and trained nursing support system. There are no such organized places in India. In few places they have started in a very small way, but there is need to be a great attention to be given to this area of skill development of the all areas of clinical services of Ayurveda, starting from Ayurvedic graduates who come out of the college. They need a kind of a support course like a finishing school system where their clinical acumen is brought out and they should be capable of running a clinic or a hospital for the contemporary society's health issues. So this area has to be tagged by us. In the end of the panel discussion, we should get into it again. I also think that there is a very big need of starting centers of excellences in outside India in a big way, not in a small way, like many times Rajiv has been pointed out this issue. And we should encourage corporate entities to start centers like in Middle East or in Europe with a very good impact on the society with the government support system. And there are many other areas which I will not start now, being in the chairperson position. I would delve into it if these points are not coming out of the panelist discussion. Keeping the time in the mind, I would like to request with this very focused introduction to the subject, again showcasing the need of for a focused attention to the hospital area. I would like to invite Mr. Hari from Sridhariyam to speak. And Hari comes from a tradition of Nestra Chikitsa, and it is one of the, I should say in the country, one of the pioneering institute which has shown the way Ayurveda specialty can grow out of the, no one has imagined when they started this center that there's a scope, and they have started now satellite center, they have got branches, they have got franchises. I think that's one good center to showcase the strength of Ayurveda's one of the 8 branches. And the one of the 8 branches in the that also not complete. Actually, Ayurveda branches of aegis goes with ENT, but from ENT they have taken an ophthalmology alone and grown into a certain level of appreciation by government and public as such. So I will invite Mr. Hari to dwell on this subject. And the time is, we all should be aware of the timings. We have got 40 minutes. Of that, I have already eaten 3 to 4 minutes. So we may try to finish our presentation within 5 to 7 minutes, so that we'll get enough time for discussion and come to a very useful and practical recommendation to be given to different agencies who can help in this situation. Can I invite Mr. Hari to the session? If there are any separate introduction by CII to these participants, or this is enough? How is it organized?
Dr. Gigi, am I audible? Hello? I'm audible?
Yes.
Yeah. Namaskaram, Dr. Gigi, Dr. Rajeevji, pranam to all of you. First of all, I thank CII and each and every member of this organizing committee for giving me an opportunity to be part of this great initiative to propagate the science of Ayurveda. We all know our science, the science of Ayurveda is having a very vast tradition. It was the science of yesterday. It is all the more relevant today, and it is the science of tomorrow. Let me come to the point of opportunities of Ayurveda for the future. We all are aware that the situation caused by coronavirus has changed and everyone has started discussing about how to build up immunity. At the same time, we also know Ayurveda has always been focusing on immunity development.
Just 1 second, Hari. Dr. Gigi, could you mute your computer?
Oh, I don't.
Ayurveda is for caring and curing. It has a holistic approach to life and ailments. It has always focused on the good health of body, the mind, and the soul collectively. In the recent times, we have seen a flood of viruses from SARS, MERS, Nipah, Corona, and the list is endless. Human lifestyle and principles have changed. Therein lies the opportunity for Ayurveda. New viruses keep on coming, and the basic protection from most of them is thought immunity development. Where needs long-term solutions for preventing these type of attacks, and as all of you would agree, I'm proud to say that Ayurveda has the solution for all of it. During this pandemic, the Kerala chapter of CII took a very good initiative and brought together Ayurveda manufacturers, Ayurveda hospitals, Ayurveda clinics, and all Ayurveda associations onto a single platform for making a common action plan against COVID-19 and then executed that plan. As part of this initiative of CII Kerala, we started Ayurvedic immunity clinics with the active involvement of Ayurveda Manufacturers Association, Ayurveda medical shops, every nook and corner of the street. Our technical experts provided a common protocol for treatments, prescription, and documentation, etc. Presently, near 7,500 AYUSH immunity clinics are functioning across the state, and on an average, 10 to 12 patients are approaching doctors in each of these clinics every day. The reports from each of these clinics will be consolidated after 3 months. The activity has provided better confidence to practitioners of Ayurveda in Kerala because they realize that people are truly interested in Ayurveda. Ayurveda is not only resurgent, it is rejuvenated. To create more confidence, motivation, and better directions to the practitioners, it is highly essential to bring the science to the next level. This is only possible by creating joint initiatives. Government systems, private practitioners, and institutions should jointly embark on the journey and to ensure proper documentation, etc. I'm sure we will be able to do miracles in providing cure for the different diseases. Now, let me come to the specialty and super specialty area. In our Ayurvedic academic system, if we are referred to CCIM regulations published in the government gazette, we have 17 post-graduation programs. Out of this, 11 subjects are direct clinical subjects. Every year, hundreds of PG degree holders pass out of colleges, but are they practicing in their respected fields? Secondly, what is their involvement in and contribution in research? This is a big gap, and we need to analyze the reason. It is the high time to find solution. In my opinion, this gap is because of insecurity and fear of acceptance or fear of failure. We need to make them confident. We need to make them more focused. Only then the science of Ayurveda will get moving. Secondly, in my opinion, Ayurveda needs more integration with technology, and our practitioners need better training for using the equipments. In the case of my own institution, Siddha, we had a very humble beginning in 1999 as a 4-bedded hospital. Today, Siddha is a 400-bedded hospital and having 30+ branches. Throughout our journey, we integrated the best technology in our clinical practices. At the same time, we were very careful in sticking to the traditional knowledge. By the usage of technology, we were able to convince our patients to their satisfaction. Technology helped our doctors to bring in innovation in diagnosis, documentation, etc. And they developed confidence to do research. The result is obvious. When we started way back in 1999, there were very few specialists in the field of Ayurveda ophthalmology. Presently, Ayurveda ophthalmology has grown to become a major specialty of Ayurveda. There are more people in this profession. The confidence level has increased. Like this, we can develop specialty institutions in the other segments of Ayurveda. For the growth of our science, we need development of micro specialties, specialties for individual diseases. More and more people should come forward with this vision. In order to fulfill the dream of having more and more specialty hospitals, we should motivate PG holders in small hospitals to convert their hospital to specialty hospitals. They should be motivated to practice in their stream of knowledge or specialization. 5 to 10 such hospitals working in a particular specialty segment can come together and get group as a cluster for creating common protocols, updation programs, joint research, etc. The above process of development of micro specialties, along with the integration of technology, will ensure that Ayurveda will be at par with mainstream medicine in the next 10 years. To conclude, thank you, Rajiv ji, thank you, Dr. Gigi, for this great initiative. CII has always been undertaking great initiative for propagation of Ayurveda. And next month, from 19th September, CII Kerala is also conducting a 1-month-long Global Ayurveda Summit to discuss different aspects of global propagation of Ayurveda. I personally invite you, all of you, to participate in that summit. Thank you once again. Thank you very much.
Thank you, Mr. Hari. It was a very, very good exposition. Especially, I take 2 points home. I have noted down. One is that specialties for individual diseases. That's a good thing that we should think about. Individual diseases we can develop as centers, and also micro specialty areas like ENT. In that also we can take areas. Cluster is a good concept. Cluster we have tried in other areas, but cluster of specialty hospitals and developing new protocols for disease conditions and other things, another area. I think this we should discuss at the end of this panel. Thank you, Hari, for keeping within the time and helping me to manage it better. And I now invite Dr. Anand Chopra. I have seen you many years back with a lot of hair. Now I see that hairs are a little less, but I think your IQ would have gone up by that. Please come.
No. Thank you. Yeah, still no wisdom has come, although the hair has gone with that. Yeah, I'm. Can you hear me?
We can hear. I can hear you. I hope you heard me. My introduction.
Yes. Yeah. I got that. Yeah. Thank you very much for being part of this session. Thank you very much for inviting me. I probably have a slightly different perspective since I am sitting in Germany and it is 10 o'clock, 10:43 in the morning here. And in fact, I'm sitting in my hospital office. Just let me say a few introductory words on my specific work here. I'm by training, by original training, I'm an what you call in India an allopathic physician, a modern physician, and then I had the good fortune about 25 years ago to go for Ayurvedic training in India for a year. And after that, I have been part of this hospital department, and I'm sitting in an Ayurvedic department in a German rehabilitation hospital, which unfortunately still is the exception in Germany than the rule, but I'll just come to that. And my other job, I might say, I was In between, I had been on leave from the hospital, and I work as a researcher in the Department of the History of Medicine at the University of Heidelberg, where I teach University of Heidelberg in Germany, where I recently I've been focusing more on the modern history of Ayurveda. That is the academic part. We have in Germany, we have now so for 1 year, last year actually, we founded an umbrella organization. It's called ADAVED, German Umbrella Organization for Ayurveda, where we have succeeded, and it is a big, I'm very grateful that we could make this happen. It is a big success that we could get together doctors, companies importing Ayurvedic products, wellness centers, and all kind of stakeholders, university researchers working on Ayurveda. And we founded this umbrella organization about a year ago, where I'm part of the executive committee. And the other thing is we have a German physicians association, and we are all modern physicians having undergone training in Ayurveda. And we have our own association called the DEGAM, where I am right now holding the office of a president. But as you know, these are elected posts and they might change. So, but this just to give you a little bit of a perspective. In Germany, the first thing I would like to say, and I'm taking up this Global Ayurveda Summit, where I had some years ago, I had the opportunity to be part of one in Calicut, actually. And I think sometimes there are some misconceptions there, for example, about Ayurveda in Europe and Germany. And the first thing to say is that Ayurveda in Germany is still a very, very small phenomenon. For example, we have if we look at doctors, medical doctors practicing Ayurveda, we might have about 120, 150 in Germany, in the whole of Germany, practicing Ayurveda. Plus there are therapists and others. And just to give you a comparison, at present, there are more than 30,000 doctors practicing acupuncture in Germany. You just see the difference in numbers and in popularity and knowledge. And the next thing is that Ayurveda in Germany, or one of the problems we face as physicians, and I say that from the perspective, we physicians practicing Ayurveda in Germany in some form or the other, in private practice, in hospital departments, or in other contexts, we experience every day we experience how useful Ayurvedic medicine is for our patients, for patients of rheumatoid arthritis, for patients of hypertension, for so many diseases. It is such a boon, actually, for suffering patients in Germany, but still we have a big problem of recognition. Although our everyday experience is very good in that, there has recently, right now, there are people in Berlin. My friend Christian Kessler is working there in a research project. They have brought out in 2018 a publication I can only recommend on knee osteoarthritis, and they did a comparative study of Ayurvedic therapy in Germany against conservative orthopedic therapy in Germany. And if you look at this study, it is really, even for a modern physician, it is an exceptionally interesting study, because I have never seen a study where two therapy groups have such a difference in effect. The Ayurvedic therapy is so much more successful, and even 1 year after the end of the study, still the difference remains. So our everyday experience is actually, according to that it is a very useful form of therapy. We have a big problem in recognition by official things, and the AYUSH ministry has thankfully taken up initiative in recent years to mend that. And a very recent thing, actually, 4 weeks ago, there came out an official statement by our German authority on drug security, on drug safety, where they categorized Ayurvedic drugs a little, not completely dangerous, but dangerous. And this will this might create a big problem for us. And this is something where we actually need the cooperation, not only of the ministry and the official places, but also of the industry. That's why, since I'm in a CII panel, I think the Ayurvedic industry could really, in presenting data, in presenting their drug security studies, all these things they do, they could offer us a lot. Ayurvedic medicine in Germany is very often actually seen as a very positive, very good kind of medicine because it is a very personalized medicine. It's an individualized medicine. And this individualization, this personalization goes along with the fact that the physician has a very personal, very individual approach to the patient. And this is something I can only encourage. I would like to underline what you said, Professor Gangadharan, that in the Ayurvedic students, the Ayurvedic doctors, there must be much more confidence in their clinical skills. You know, if I want to go for technology, in Germany, we are in the paradise of technology. We have in Berlin, in the city of Berlin alone, we have more MRI scans than in the whole country of Italy, for example. And this applies to whole of Germany. So if you want to go for technology, it's a great place. But patients have gone, they bring files full of technological reports, but they don't have doctors they talk to. They have doctors who say, well, I'm looking at your knee, so your digestion doesn't interest me. And this is the other point where Ayurveda has a big advantage. And we are really trying to actually put this advantage in front and show how much this can offer as a medical specialty, apart from, and we would be very happy if Ayurveda is not only seen as a wellness practice, but anyway, my impression is that in recent years, this wellness trend in Ayurveda has been going down slightly in Germany and Europe at least. Whereas on the other hand, Ayurveda as part of what is called integrative medicine nowadays, or what was earlier called complementary and alternative medicine, is gaining much more importance. And it would be good if we had more dialogue with the stakeholders in India, not only with the official places. In my impression, the AYUSH ministry in recent years has become very active, fortunately, in Germany. But we also need a dialogue on a level below that, between Indian and European institutions, between doctors, between companies producing Ayurvedic medicines. So I think this is that much I would say now, and I'm looking forward to the discussion. And again, thank you very much for letting me be part of this conference.
Thank you, Dr. Anand Chopra, for very precise and very pointed. I think there are two things that you are told is important, more important. Other things also, this treatment strategy for RA and OA. These two areas are very big areas in Europe, all over Europe. One of the major morbidity area among the that is this diseases which are not of acute condition. These two are, if we can manage that itself, is Ayurveda can give so much of gain importance. Second area of concern is that we were under the impression that German government is more forward towards understanding Ayurveda, and they are putting this system under not very dangerous but dangerous drug category. Is a very big question. I think that is because of the lack of effort made by us to showcase the non toxic status of Ayurvedic drugs. This has happened not only in Germany, in other South Asian countries also we face the same problem. This is one area I think we should take into consideration. Looking at the number, 30,000 versus 150 is a very big gap. That means the scope of Ayurveda in Germany is, at least we compare acupuncture, which is a foreign system, to Germany. If it can grow, acupuncture can deal only very minute area of health spectrum problems, whereas Ayurveda can more. So our growth potential is very huge. I think we should take note of that. With this very brief note of your talk, I may like to invite Mr. Rajiv Vasudevan, who is the brain behind this having this group, and I am extremely happy that I am part of this group chairing this session. I invite Mr. Rajiv, and we have got enough time. We are only 2:23 now. We have got 10 minutes. Very happily we can take that more. Then we
sure.
Thank you very much, Dr. Jiji. It is a great pleasure to be here amongst my peers from the hospitals, Ayurveda hospitals group. I want to begin by telling that I see the hospital sector as the foundation of growth for all subsectors of Ayurveda. If hospitals are not there, you're not going to have products, you're not going to have wellness, anything else you're talking about eventually is not going to grow unless we have a solid hospital sector. And what has happened over the last so many decades, there has been a big confusion because India is such a diverse country. Hospitals are not there across the country. So people think that Ayurveda is medicine. And then the confusion of Rasaushadis and Kashtaushadis, etc. There are so many controversies that it's like that elephant, as we say, it means different things to different people. So beginning with defining what Ayurveda sector is, which is actually pure Ayurveda Chikitsa, which is Ahara, Vihara, Aushadha, Kriya, and a hospital being a place where, and even Vichara, you could even bring the mind in between. So in totality, a hospital being a place where I'm able to give one or more of these things depending on the Rogi Roga Avastha, right? The stage of the disease and the stage of the patient. So hospital is really the bedrock, is what I want to tell. Why is it a bedrock? Because it helps us to build evidence, right? To do it only with this medicine thing, we are going into a paradigm of allopathy style Ayurveda. With all due respect to allopathy, we are trying to convert Ayurveda sampradaya or a knowledge system artificially into something which is different. Therefore, if you want to look at building it properly, I need a Chikitsa Sampradaya. Hospital is what will give that. If you look at evidence, again, we have evidence for Roga Shamana or symptom alleviation and Roga Shanti, which is disease reversal. So if you take again these two things, and the third part is well-being, right? So even if you look at the wellness sector, today, I want to, the theme which we began in the morning and Ranjit Puranik also reminded us of that, is how do we build high value, credible, high growth Ayurveda sector? If we want to build this, three things, that is higher value, not to sell Ayurveda as a cheap alternative or something, but high value. I don't say expensive. So the return on my money spent. So to bring in that return high value, we need evidence. So whether even for well-being, if you compare Indian well-being sector, compare it with the Sri Lanka or Maldives, we'll be probably 25%, 30% of what they are charging. How do we move up the value chain on Ayurveda? The evidence. The other part, Ayurveda hospitals will be the cornerstone of employment generation in the country, right? So doctors, there are 20,000 doctors coming out, so many paricharaks who are there. It is a foundation of growth. So we need to recognize. The second part which I want to bring in is if hospitals are the cornerstone, hospitals can grow only if the payer framework is developed. When I say payer is the sense that like in modern hospitals, the insurance sector came in and ensured that they were funding the treatment of patients. Unless Ayurveda is accepted into the mainstream payer network, insurance is one. Now, in the context of insurance, there's a specific recommendation Dr. Jiji and co-panelists I wanted to make. In the top 10 cities of the country, we have said that we have worked out an agreement with IRDA and inclusion of all this. But the fact of the matter is the public sector insurance companies demand in the top 10 metros a PPN rate. You have to be part of a preferred provider network. Now, for that to happen, a preferred provider network rate has to be published by the GIC Council, that is General Insurance Council. So it is a chicken and egg thing. The GIC Council has not published the PPN rate. Therefore, there is no PPN coverage available for Ayurveda hospitals in the 10 metros. It's a very specific point. We all believe we are getting cashless. The fact of the matter is there is no proper cashless coverage, proper coverage for Ayurveda today in insurance because the PPN network framework, rate framework has not been published. So this is one specific thing to be done. CGHS, the rates were changed about 3 years back, but it will surprise those of you who are on, it won't surprise those of you who are on the CGHS network, that the room rates, through a very, very unfair practice for Ayurveda hospitals, is fixed to the 2008 level. Why I'm bringing this? We struggle in our own country. Dr. Chopra, you're talking about Germany. In our country, we have this type of second-hand treatments. So the CGHS room rate is kept at the 2008 rate, whereas the allopathy hospitals have had the rates revised twice since then. right? The third part, ECHS, which is again the defense, the retired community, how they get included into this. These are big, big markets. They all need Ayurveda, but artificially the path to Ayurveda is being blocked. Fourth, state government health services. You will again find most of the state governments have schemes which are getting now subsumed into Ayushman Bharat, but there are many states which are not covered there. And I'm talking about state government employees. I'm not talking about state, I'm not talking about the citizens of a state. State government employees should also be opened up. Unless we open up the demand, the hospitals will not come and this growth will not come, investment will not come. Finally, Ayushman Bharat, we need to ensure it is opened up. Quickly on some other points, we need to focus on specialty hospitals. My colleague Hari Nambudri spoke about it. The need to really focus on specialty. He's a glowing example. We need to have that type of example, so the chains of specialty hospitals being promoted. Part of that would be to focus on 2 to 5 diseases. I'm putting 2 to 5 because begin with 2 and then move to 5, where I think the hospital sector, the government should put apart as proper money, right? Could be 20 crores, 30 crores, right? For building evidence exclusively for 2 or 3 conditions. If Dr. Ananda Chopra talked about an excellent study there, imagine if that we do that here in India with 5,000 patients, 3,000 patients, and the government should do it. Then the whole world will come for osteoarthritis treatment of the knee, treatment of the OA knee to India. It's a huge market. So we have to work with government and put that money. Industry is not strong enough to put that $1 million, multi-million dollars to research. So we need to take 2 diseases, build the evidence in a global way, so the market will come here. Now I come to the last 2 points. One on funding. The hospital sector needs clear funding, both in terms of the initial capital outlay for the entrepreneurs. Hari Nambudri and others spoke about, I think Dr. Gigi also spoke about doctors coming out, being able to set up hospitals, for which they'll need funding. So I would suggest some type of framework where we say in a metro city, 8 lakhs per bed, in a non-metro, 5 to 6 lakhs per bed, is a lump sum soft loan which is made available, which can be repaid by the doctor entrepreneur over a period of 5 years. So I set up a 30-bed hospital in a metro city, I get 2.4 crores. How do I secure it? What do I do? Those are things to be looked at. But fundamentally, through a process of enablement, like the IT sector in 1990 was enabled, we need to look at the Ayurveda sector in a big way to do. So a flat sum per bed will be a good framework. And Dr. Gigi, you mentioned in your comments, something overseas. So if somebody wants to set up a proper 50-bed hospital, we should not think small. We need to think in terms of big capacity hospitals. If Dr. Ananda Chopra wants to set up a proper Ayurveda hospital in a state, in Germany, 100-bed hospital, 50-bed hospital, how can Indian industry go and set it up, right, in collaboration with the German partner or any other partner? So we need to have funding for that. Final point is quality of talent and quality of medicine. If we don't have good quality, doctors who are coming into the system are better quality now than before. But as the Delhi health minister spoke about the problems of trying to go in for, I still have 2 minutes, Dr. Gigi, on my time. I'm only 8 minutes. So have I crossed? Okay, you're muted. It's fine. So I'll quickly say, so the point is that we need to build the confidence of our Ayurveda doctors so that they can become entrepreneurs, for which we need to look at finishing schools in terms of the hospital management, in terms of chikitsa, in terms of medical technology use. So very focused finishing school approach for doctors who can become entrepreneurs. Similarly, for paramedical staff, we need to really think in terms of how do we bring back the dignity, because when Ayurveda sector grows, if people good quality talent don't come there, it cannot grow. We're only talking in there. So the best minds, instead of going to allopathy or something else, today after MBBS, people come to BAMS. We need to get a 50-50 split, or 60-40, where 40% of the people say, I want to come to Ayurveda. How do you read that? So we need to weed out the poor colleges, bring in the quality. Finally, the last point about quality of medicines. Chikitsa cannot happen without quality of medicines. These are issues which are there. So let me conclude now. Thank you very much, Doctor.
Thank you, Rajiv. You have been very precise. It was an excellent presentation, I should say. And especially this is an eye-opener for many of us on the CGHS, ECHS, and state government. Actually, that is a very big stumbling block Ayurveda sector to grow. This is a big market, and most of them are coming with their own money from their own pocket. That can no longer should continue when there is a genuine system available. And these 2 to 5 conditions, evidence creation, which Samir also told about, Hari also has been telling, I also has been, that's a very important area. We should have an institute of a caliber of IITs and IIMs of the kind. There's not even a single institution of that caliber which is dedicated fully for evidence creation on a clinical-based evidence creation. That is a good area. To just keep up the time, I will just note down whatever I note down and just read it for you. Please kindly feel free to add or remove some of the things that recommendation that we may like to give to government and through CII can be. One is that entrepreneurs in Ayurveda hospital sector should be encouraged by the government by providing soft loans and grants. The way Rajiv has mentioned, 8 lakhs for metro or 3 lakhs for non-metro areas, so that new entrepreneurs can come. And it can be on the non-recurring and non-recurring expenditure calculated based on this. And I think from one of the areas which we didn't mention is that Hari has been mentioning previously that visa for Ayurveda based people who are come to India. If you have got Ayurveda visa available, it will be easy for them to come. They have to come through, sometimes they come through tourist visa. They're not supposed to legally take treatment with that visa. So many issues are there. So if we can have an Ayurveda visa so that they can get easily to the India, and that will be opening a very good medical tourism favoring India. And I am sure to India, medical tourism will not be much on allopathy side, but will be more on Ayurveda side because of excellent areas of Ayurveda expertise. Other areas that skill development, which requires impetus, especially for doctors, for transforming them to good clinicians. As we told them how to harness the technology, harness to get clinical acumen, and training programs, very well organized training program for therapists, pharmacists, especially in medicine manufacturing at small cottage level and hospital level, how to look at pagas and other things, and nursing. Nursing care is a very big issue today. We don't have nurses trained for Ayurveda, for Ayurvedic sector. We are using modern nurses and we are training them, reorienting them towards Ayurveda. And implementation of insurance coverage is very important. Cashless, I don't think any institution, I don't know about Rajiv, my institution is NIBH accredited, but till today I am not able to get my, with the best of my abilities, we are not to get a cashless, we are getting only reimbursement. That also through, we have to get the prior permission, etc. So if this, that can be done through activating that PPN network kind of thing that has to be done. That is an important area. And there is a very good, which Rajiv forgot to inform, a corporate level hospital in places like Middle East. There is very good demand. Indian communities there. If government can encourage private agencies to start 100-bed hospitals on specialty area. If you Germany, if you have a very good Ayurveda center, which treat exclusively RA and OA, which is with all the state-of-the-art facilities, Ayurveda will become popular by 10 times. You don't have to invest money on marketing Ayurveda. That will be the best marketing is showing the efficacy of that. As we say, the thing of the pudding is in eating. And other area is that Hari has mentioned briefly, start centers of excellence in micro and macro branches of Ayurveda like ENT, eye, Marma Chikitsa. It's a very important area. Marma can do wonders in many of the musculoskeletal diseases. There are experts who practice exclusively Marma. You can have training centers and hospitals based on that. Kshara Sutra, Agni Karma. Agni Karma is almost forgotten by Ayurvedic. I mean, there are excellent centers in Ahmedabad and Maharashtra showing very good outcome. Many of the conditions, including OA and neuromuscular diseases. And another important area is Rajiv has very clearly mentioned at the end of his presentation that Ayurveda to grow, we have to substantially support Ayurveda Chikitsa. Ayurveda Chikitsa is through diseases as a curative system and wellness and well-being for wellness centers. And these two have to be very seriously looked upon by government and industry. And I want to reiterate that if you want to grow Ayurveda horizontally, not vertically through products, Ayurvedic hospitals are the basis. unless and otherwise that base is supported by enough resources and resource material and resource persons, Ayurveda hospital will not grow. And I am sure, like happened in 90s, in IT sector, if you look into Ayurveda more seriously as a very good agency, not only as a service sector, it is a very good economic booster for the country if you put the substantial support in a very logistic way to the sector, which has completely neglected. If you see the AYUSH sector support system, there is nothing preferably given to hospitals and service sector even today. I think this registered conference should contribute to that, and we should sustainably and continuously take this agenda of supporting hospitals through this vertical program which you have suggested should come up. I think we are just have got 1 minute more left for our session. I am extremely thankful for all the speakers. Rajiv wants to say something to add to that before we conclude.
Just that one comment you mentioned, and that was a very important point on medical value travel. And I think, Dr. Ananda is also here. The point is that people in the coming days, will be afraid to come for surgeries to India, and only people from poorer countries are coming. But for Ayurveda, people will come from the rich countries, the Eastern Europe, USA, Singapore, they'll come. So we are the best place for Ayurveda Chikitsa, right? So for medical value travel, high value medical value travel is a strategic requirement for the industry, hospitals. So we definitely want the government also to support Ministry of Commerce, Ministry of AYUSH, to support us in promoting India as a medical value travel destination for non-communicable diseases, rehabilitation, all of that.
Yes.
Right, and Dr. Ananda Chopra, those type of international collaborations are also possible in these regards, so that the best of rehab from there and good Ayurveda here can come back.
I think that makes it, I think Mr. Rajiv will take up these points. No, I'll send it to you also, whatever we have discussed, last points, and let us take it up, and whatever help I can do from my own side, I'll be happy to be part of it. I am extremely thankful to all the CII officials and others who have been interacting with me, especially to Mr. Rajiv, who has been initiative for this. And Anand Chopra, thanks, and nice meeting you again. And I pronounce to you and all your family members. I conclude the session with a lot of thanks to all of you. Thank you.
Thank you, Dr. Gigi. Thank you, co-panelists. Namaste.
Thank you, Professor, for moderating the session so nicely, and thank you. There are very interesting recommendations which have come out, which we will definitely take up with the AYUSH Ministry. In the interest of time, may we begin our next session, which is Ayurveda Wellness Sector, Challenges, Growth Opportunities and Way Forward. May I invite our esteemed panelists for this session, Mr. Devi Matthew, CII Governing Council Member, CII Member of Ayurveda Core Group, and the Chairman and Managing Director, Sumathiram Ayurvedic Group, Ms. Claudia Wagner, Managing Director, Fit Group Germany, Mr. Siddhant Dominic, Managing Director, CGH Earth Group, Vaidya Shavsin Holai, Board Member, the General Dutch Association for Ayurvedic Medicine, Netherlands, Hospital. Thank you so much for joining us today. May I request Mr. Matthew to kindly moderate the session. Thank you.
Good evening and Ayurveda greetings to everybody. Today, we are going to discuss a very interesting subject, Ayurveda wellness. This is a need of the time, especially because Ayurveda is a way of life. The science of Ayurveda says it has treatments for curative, preventive, and rejuvenative. Since we are talking about the Ayurveda wellness, from this science, the preventive and rejuvenative part, that part is very important. Because of that science, that part of that science, Ayurveda wellness is different from any other wellness programs available in the world. That is the difference of Ayurveda wellness. It's a science. Now, dear friends, let me introduce today's panelists. We have very eminent team. Let me introduce first Mr. Siddharth Dominic. He is the managing director of CGH Group. They are one of the leading tourism entrepreneurs. They have wellness, they have Ayurveda hospital, they have resorts and hotels. He is very experienced person to speak today.
Thank you.
Then let me introduce Ms. Claudia Wagner. She is the managing director of FIT Ryzen, Germany. She is the leading operator in Europe, promoting Ayurveda wellness and Ayurveda treatments all over the world. Being a person from India or Kerala, I have to specially tell about her because she is giving a lot of business to Kerala and to other parts of India. Of course, she is specialized on Ayurveda wellness and Ayurveda treatment promotions. She's giving business to other countries, okay, but she loves Kerala and she loves Ayurveda, she loves India. Thank you, Claudia, to join for this meeting from Germany. We have Shaswin Boylen. He is from Netherlands. He is the board member of ANVAG. ANVAG is the General Dutch Association for Medicines. So, you know, Netherlands is importing Ayurvedic medicines and exporting Ayurvedic medicines. This is again a hub for other countries to buy and sell Ayurveda medicines. Then we have one more speaker today. He is Mr. Vivek Venugopal. He is at present director of Sajivanam Ayurveda Hospital, a unit of Medimix Group or AV Anup Group. He has very good experience studying and working in America, in Singapore, and this Ayurveda wellness area. So we have very good, very eminent speakers, 4 speakers today. I have request to the speakers, please take 6 to 8 minutes, and our concentration is, please concentrate on the subject, very specific. We have only limited time. One is what challenges that we are facing in this area. Second is, what are the growth opportunities? Then, what are the way forward, especially because of this pandemic situation? We don't have to speak much about pandemic situation. Everybody know that. So I request concentrate on this subject of Ayurveda wellness being a scientific subject. I mentioned before, Ayurveda wellness is different. It is not like other wellnesses of the world. So I request Mr. Siddharth Dominic to start with.
Yeah, thank you, Baby Matthew. I hope I'm audible.
Yes.
Am I audible? Yeah, thank
yes,
you.
Siddharth.
Yeah, a very good afternoon to all my fellow panelists. Thank you for this opportunity to join in this panel discussion on a subject that we all hold very dear to each of our hearts. And especially in these challenging times, we are really pushed to our limits when we look at our enterprises that we have created, sitting in a stage of complete seizure when we are shut because of the pandemic. Coming to what Baby Matthew said is to come to be focused on the subject we have at hand is what is the challenges that I as a practitioner am facing. I'd like to share these experiences. See, first and foremost challenge as a practitioner is we have created enterprises here focused on Ayurveda. Now that since March the beginning of early first week of March, 5 months to date, and looking at the uncertainty into the future, we have to sustain assets and teams. How do we do that is going to be the biggest challenge when we are operating on zero revenues. So I think the primary challenge which me as an entrepreneur would face is how do I sustain the teams that are involved and who deliver the product, and how do I maintain the asset in its prime so that when normalcy returns, I can be there in the forefront and delivering the same experience that we have always had. The next big challenge that we are facing is how do we open and how do we ensure safety of the team, because the very nature of the pandemic is we are advised on physical distancing, hygiene, and all of that, and the nature of Ayurveda treatment. Many of the protocols envisage close contact treatments, which leaves a certain kind of doubt in the mind on how we can deliver the safety of the team. A third challenge which has now cropped up, which is rather strange, which we feel is the fear factor that has come up across communities, that wherever there is Ayurveda centers, there are going to be visitors from across borders, across international borders, visiting to come and take treatment. Now, when a visitor comes to a facility, the fear in the neighborhood is that person bringing in the virus? It is a very, it sounds trivial, but there are people who are calling up the police station and saying, we've got visitors visiting here. It causes alarm, and our safety is at stake. So this is going to be a new challenge which needs to be mitigated. The safety of the team and the safety of the community is something which we have to really keep in mind. The nature of the pandemic has really shaken our wits, and the advocation is stay home. So how are we going to advise people and shake that fear out to take advise people to come and take treatments of Ayurveda? I think I'll come to that in the way forward. So these are some of the big challenges that I see at this present moment in time. Bevmati, should I go on to opportunities or should we hold with challenges?
You can talk a little more challenges if you have anything more, because a person speaking from here.
So some of these were the key challenges that I have kind of broadly covered. So the next I wanted to go is into the opportunities which I see in this situation. So should I go into the opportunities or should we?
Yes, opportunities.
So looking at it from the present moment in time, I see a huge opportunity. I think I was listening to a lot of the speakers in the earlier discussion. We see that the pandemic has thrown open a whole subject of man's mind is now preoccupied with wellness. So the key word that has come to forefront is immunity, and I think the helplessness of the mainstream medicine is become very evident. It is exposed that people have to really take into lifestyle changes that, as Baby Matthew rightfully mentioned in the beginning when in his introduction, it is a lifestyle change, and the very basis of Ayurveda is about a whole entire lifestyle where it is preventive, it is curative, and it is rejuvenative. So in that context, when the mind is so focused on wellness, I think the opportunity is ripe when Ayurveda can really fill that gap and address this requirement, which leads me to the next point, which is allopathy has really not offered a solution. There is so much of talk of vaccine, and there has never been talk of how, and they all keep talking of immunity building. How that immunity building is going to be, and pill popping is not the solution. All these places again lead us back to the into traditional medicine and especially Ayurveda, where the solution is you can stay healthy and prevent viruses from entering our body by staying healthy by good lifestyle. and preventive and all of that which Ayurveda has been advocating. The other growth opportunity I see is the government has, the Ministry of Ayush has really kind of in recent times given a lot of thrust and push to Ayurveda, and this in combination with the times, I think it shows that it's a prime time when we can plug in, and there is a lot of awareness where Ayurveda can move from alternative system of medicine to mainstream. I think that will be the biggest opportunity that Ayurveda can, and in wellness sector, we have, in my experience, a lot of our clientele patients have been coming from the West more than India. I think this is going to see a whole, a big shift where domestic consumers are going to come seeking Ayurveda because they have seen the solution it can offer. I see this as a huge opportunity which we need to grab. And the last point in opportunity I see is sitting here. We have seen that our clientele from overseas, international clientele, have constantly been inquiring when will the borders open. They have realized the goodness of Ayurveda and have been seeking and waiting opportunity when they can come back and avail of Ayurveda treatments. So I think that is only that when they cannot go and pent up, it leads to frustration. There will be almost kind of a revenge travel and people taking up Ayurvedic solutions in a much bigger way. So these are some of the opportunities that I have listed out. Coming to the way forward, what I see is, I think the government of India, Ministry of Ayush, using all these opportunities as a tool can really plug in a sense. They can. I think it calls for a huge PR campaign where Ayurveda moves from alternate medicine to mainstream. This is something that. As a government, I think we, in through this forum, through CII, if we can convince government to really give a much more impetus to driving, public awareness on the solution and the preventive, the curative, and rejuvenative potential of Ayurveda be tapped. I think that is one of the options, the way forward. I suggest. Another point that I would like to highlight is it was raised in the earlier discussion is the subject of insurance. I think the government needs to more actively play a role in seeing how, in mainstreaming Ayurveda, how insurance can become a normal, like in allopathic treatments, where people can avail of insurance for Ayurvedic treatment. This could really be a game changer for Ayurveda. The other subject, which I would say way forward, I would think the government can play a role is in the visa management. Today, we find that people who want to avail of Ayurvedic travel to India have to take tourist visas many a time, and to avail of a medical visa is a challenge, which is really not the proper way. Should be people should be able to easily access medical visa to travel to India. There is the subject of when will borders open. I think the government needs to bring in the protocols required so that the international clientele who've been regularly availing of Ayurvedic treatments can continue availing the treatment with protocols so that they can come back for the routine treatments they need to have. There are other subjects of opening of therapist centers, which are of world-class standards by government. And I think the whole view of government that Ayurveda and wellness is a very serious subject, I think needs to be, it should not be trivialized. I think that would be the essence of what I would like to communicate. If CII can say that, and it is a big wage, income generator for this country, be it foreign exchange, be it, boosting the economy of regions. And India should really take ownership of Ayurveda in the world, where I think we should retain our own lead position. There are countries like Sri Lanka, there is Thailand, Bali, and other countries which are vying for this position. India has always been the home of Ayurveda, and we should continue to keep the leadership position in this space. So these would be some of the points that I wanted to talk about.
Okay, Siddharth, very valid points, especially how to open. But one happy news is, in Ayurveda sector, Ayurveda sector is ready with the SOP to start the treatments in India. That's one of the good news. Even the government allowed visa for medical tourism. Anyway, other points, we'll discuss later towards the end. So whatever points you discuss, the insurance subject and the visa regulations, we will come back to that again. Thank you very much, Mr. Thank you. Now, I request Claudia Wagner, please add. See, Siddhartha was talking from India. The challenges he foresee, he sees from India. But you are in one of the main European country, Germany, and your challenges are different, I hope. Please put your inputs towards the subject wellness, Ayurveda wellness, tourism, and your challenges and opportunities. Thank you very much. Claudia, please.
Thank you very much, Mr. Matthew. Do you hear me?
Yes,
Do you hear me?
We can hear you.
Okay. Thank you very much, Mr. Matthew. And it is thank you very much for the CII for that I can take care, that I can join the conference. It's very interesting. And it's also very interesting, thank you, Mr. Dominic, because I agree with you, because this pandemic has drastically affected global travel globally, and business are hungry for new approach and for a new norm. And we see now in Europe, that's a good sign that the travelers are coming back. So in Germany, we have now 30% of the business what's coming back from the last year. And we are waiting. We have so many requests for guests would like to go for Ayurveda for India, because Ayurveda is something so interesting for the Western world, or especially for the German people. Ayurvedic is a holistic health system. The German people believe in Ayurveda. It's not only for wellness, for well-being, it's also for people who have diseases. They would like to go because they have very, very positive results. And they understand Ayurveda is it's a union of body and soul and spirit. And it's not only herbal medicine, it's also the food, the very interesting Ayurveda foods, the Ayurveda diet. It's a yoga, it's a movement, and it's for purification, it's for detox, it's for prevention. This is also very important. And now the people are looking for Ayurveda in a special way, because now the people realize that a good immune system is very important. A good state of health is so much important for the people. And for this, people are looking for these special packages. At the moment in Europe, we see that Germany, people are traveling in Germany and they are going abroad, but mostly they use the car for to go. So they go to Poland, all to the neighbor countries where they can go by car. We hope, but now, maybe you have heard that Spain, they closed, we have a travel ban for Spain since some days, but people are not happy about it. But we hope that it will open again in the next weeks. And we see that our business is recovering, and now this current strong awareness of everybody for well-being and the health-related travel. So the Ayurveda holidays will be great for this. But we have to wait for all the political decisions. How we get a visa? Because I think in Germany, the travel ban for India will delete end of August. But then we have to wait for the flights. We have to wait when we get the visa, when we can provide India as or especially Kerala as a travel destination again. And the feeling of being able to move around in place where you don't know everyone becomes safer, for my opinion. When I talk to the guest, I said to go to an Ayurveda place, in my opinion, it's much more safer than to make a round trip because you are on a special place. You only came in contact with special guests. So maybe Ayurveda must be, in my opinion, the Ayurveda places must be the first place to open or reopen for the tourism. And we have now produced the special Ayurveda catalog for the season now 20 and 21. And we have a lot of packages for India. We will send it end of August to the travel agency. And so we hope that it will regain some of the normal, that we get in a normal situation. And we hope that the long distance route India as a most important destination for travel for traditional Ayurveda course will come back soon. This is what I can talk about the situation at the moment. You were talking about, or before in the hospital session panel, they will talk about wellness and diseases. In our opinion, we have the guests who are willing and pay their own money for a healthy holiday. So they make a combination between a holiday and doing something for their health. These are the guests, or the fit guests. And for this, we don't make this break between wellness and people who have diseases. For us, it's more wellness. Of course, all has to be something like a well-being, feeling of well-being. But most of the guests, of course, they have not so much strong diseases, but we also have a lot of guests who have stronger diseases, and when they come back, they reported us very, very good results. So I see that the Ayurveda have a great future, because more and more people now get aware that health is so much important. And it's not only the medicine from the pharma industry, it's a natural health medicine, what people are looking for improving the immune system. So we have many requests for Ayurveda cure in Kerala, because this improving health is so important. And now we have to wait for the restart after COVID-19 for the travel restriction, what's going on for the visa. And you talked something about the visa that's also very interesting. Why not make a difference between tourist visa and the Ayurveda visa, for example? Because Ayurveda visa can we see more in a way of a medical visa, because it could be maybe easier. I don't know. I'm not from the political section. And then we have to know about the quarantine procedure. In Germany, it's very easy. We have for every hotel have a special procedure. They check it, and the people, it's not a problem. The guests accepted what's going on. And restart, we must know when the resorts will restart. At what time? Maybe October, maybe end of September, maybe in November, because then we have to do now our work. We have to make a lot of marketing activities. But for this, we need a little bit more information. What's going on? I know that at the moment, maybe you don't know it, but in this moment, when we know when we can restart, then we'll start with the marketing activities. We will do webinars with our travel agencies. We are working together. We will send a newsletter to our clientele to inform that now it's ready. Kerala Ayurveda resorts or Indian Ayurveda resorts will reopen, and then we can start the business again. This will be our biggest challenge.
Thank you, Claudia. See, you can get a good news very soon from a political decision soon from India.
Okay.
Yes. See,
because
CII.
For us, Ayurveda is very, very big segment for us, Ayurveda.
Yeah, I know.
We have Europe with the classical spa and wellness country and health country. Half is Ayurveda. The business is very important for us too.
Yeah, see, CII is the biggest trade body in India. See, they are also trying to convince the government to reopen everything, even the Ayurveda resorts, Ayurveda hospitals, even the visa policies, even quarantine policies. Quarantine policy also, it is not that difficult, that complicated now. things are going to very easy. I'm not announcing anything because I'm not supposed to announce, but you can get good news very soon, so that you can send your guests to India, to Kerala or any part of India, and we are also waiting to see your patients and your guests for Ayurveda wellness. Thank you very much. Then now we have Mr. Shaswin Bosley from Netherlands. Please.
Thank you, Mr. Matthews, for just a check. Can you hear me all?
Yes, we can hear you.
Yes. Thank you. Lots of greetings from the sunny weather from Netherlands. And Om Shri Dhanvantare Namaha, Om Shri Gurubhyo Namaha. Respected dignitaries and all the respected people who have joined for this August gathering today, I would like to thank you to give us an opportunity today to share our views and the knowledge that since the morning beautiful debates has been happening. I would like to thank the Indian Embassy for giving us also of the Netherlands to give us an opportunity to also participate in this program. Myself, I would like also to thank the AYUSH government for being a part of this whole happening of Ayurveda, because I'm a product of AYUSH Scholar Scheme, which has been supported from the Suriname and graduated from India. And right now, I am also fortunate to become a member of the Ayurveda board of the Netherlands. So the ANVAG. So on behalf of the ANVAG, I'm speaking about the wellness and what we are doing for our Ayurveda doctors and fraternity in the Netherlands. So I would like to brief a little bit about what is ANVAG doing in the Netherlands. It is actually a Dutch association for Ayurvedic medicine, and it was founded in September 2007, so around 30 years ago, and it is standing for all the Ayurveda practitioners and doctors, and it is the only Ayurveda practitioners board in the Netherlands, for the reason that's why it's quite small, but still serving its purpose. So it's an organization where certified allopathic doctors and Ayurvedic doctors and practitioners and therapists can be given a certificate and a membership with whom they can practice legally in the Netherlands. So the ANVAG is aiming to represent the general interests of the members and strives to preserve the quality of the original legitimacy of Ayurveda as laid down according to the scriptures of Ayurveda. We have around 13 doctors, BMS, with an Ayurveda training from India, also from the Netherlands. We have 34 practitioners trained as bachelor level Indian doctors at from three accredited Ayurveda schools, 11 therapists trained at MBU level, and 6 members and 6 honorary members. We have also close contact with the Indian Embassy, where we yearly and quarterly also present our views and how we want to collaborate and how to bring Ayurveda to its highest levels. So one thing what is very nice when I came to the Netherlands, what I saw is that since 13 years, it was already achieved that Ayurveda treatments and Ayurveda treatments could be reimbursed by the insurance companies in the Netherlands. It was a really good achievement what we have in the Netherlands. And if you are a certified practitioner, you are also having a certified membership. Your clients can get reimbursement from their packages of their insurance companies. So this is something very nice. Coming to Ayurveda wellness, as it's the topic of discussion now, if we see that we can practice Ayurveda here very legally, and we can also prescribe herbal medicines. I'm also practicing here. I am an entrepreneur here, and I'm trying to spread the knowledge of Ayurveda. But going further on, I feel lots of I faced lots of challenges in the sense of to practice Ayurveda wellness, to coming specifically to Panchakarma. Because as we know that Shodhana, Shamana and Chikitsa are totally as a combined feature, and we want to promote as holistically as possible. There is looking at the opportunities, people of the Netherlands, they are very open towards the treatments and they want to do these treatments. But the problem is that we cannot practice legally Panchakarma because there are lots of restrictions. And also from the board side, we are trying to legalize these kinds of measures because the law of the Ministry of Health and Family Welfare in the Netherlands is very strict in how to practice and how to execute all the things what we are doing from the Ayurveda side. So what they ask us is that they want to see lots of research. I also myself could study with a bachelor degree from Ayurveda on a European based level university at Leiden University. And most of the time when I was speaking to the university professors and doctors, I used to get lots of resistance, and I still face that. And I wanted to use lots of research protocols and research methodologies, which has been already done in India. What I know during my studies in India, I was not able to use those because it was not according to the European standards, which I was not agreeing with that. But where we could not use that in papers if we want to write something about Ayurveda and use that. So I was very happy to hear that our colleague from Germany, who has published that paper on osteoarthritis, because that was a very good achievement. And most of the time, whenever papers are being published in India, the European fraternity is not accepting that for us, and that's why we face in research protocols. So from this point of view, I asked the AYUSH ministry to tighten up, although we are opening up the research protocols and opportunities, please make sure that the quality is also according to the standards of what Europe wants, so that we can also use that. Because if we want to do lots of research from this side, also we want to collaborate with that, and then I hope that will be something which can be taken up further. Because last time also when we were there in the Indian embassy, we also told about this, and we hope that the Ayush Ministry is going to take this up. Secondly,
Shasin,
yes?
excuse me, can you cut short?
Yes. And furthermore, some more challenges what we face right now is that the rules and regulations also that our Ayurveda doctors, what we are looking as projects right now from the ANFAC, is that Ayurveda doctors become certified and accepted as Ayurveda full-fledged doctors in the big registration, because that is something which is as the huge project which we have started right now, and it is quite it's a tough task, but we hope that we can reach that. And we look also for collaboration for Ayurveda wellness, looking at Germany, because in German rules and regulations are quite easy and not so difficult, so that we can also promote Ayurveda tourism in our neighbor countries. But also main important thing is that we can also do the wellness opportunities for India also. We stand for that, and we also open that to the board of ANVAC, so that we can promote more Ayurveda from the Netherlands. I thank you everyone for giving us the opportunity to give our views from the Netherlands, and hope that we can collaborate in future. Thank you so much.
Thank you very much, Shasin. You are right. Still Ayurveda is facing such kind of challenges. It is not being approved in many countries, but the process are going on. Here also CII is involving. CII got an Ayurveda panel. The panel is approaching the government, central government, to get approval in other countries. Certain countries like Switzerland, few countries like Italy also, to a certain extent, approved Ayurveda. And thank you very much for your input. Definitely, the purpose of such a drive is to overcome the challenges.
Yes.
We appreciate your point towards that. Now we have one more speaker, Mr. Vivek with Immobile. Very good. As I told you, he has got very good experience working in other countries. Vivek, you know that in Ayurveda wellness, we have products and services. Both are there. Ayurveda wellness product is there. Ayurveda wellness service is there. Okay, Vivek, please start.
Thank you, Baby Matthew, sir. Good afternoon, all fellow panelists. I just want to start by congratulating the Ministry of Ayush and CII for taking up this Global Ayurveda Conference 2020. I think it's a fantastic initiative, and I think it's the need of the hour. As the pandemic has, it's really actually thrown an opportunity for the Ayurveda wellness industry. I think, one, to build awareness, and also it's an opportunity to take a more central leadership role in the fight against the pandemic. As I sat through many of the sessions today, it was very heartening to see the various initiatives that the various stakeholders, the state governments, the central government, the various private entities, they're all taking to the various initiatives that they're taking, and their initiative to work together to take Ayurveda to the next level. Of course, I share Siddharth's concerns. I think it's very challenging times. How do we look into the day-to-day operations? There's no clarity on how long this will last. But I also take comfort from Claudia's observations that the industry is slowly bouncing back and travelers are again, inquiries are coming. So I think that's a very positive sign. But in terms of focusing what to talk on in terms of wellness, I just think I'll focus on when the industry is back, how can we be more ready? Let's look at this as an opportunity to introspect and see where can we strengthen our areas in the wellness space so that Ayurveda can become a stronger force in the wellness industry. Like Baby Matthew sir mentioned, there is the wellness and the services and the product industry. I think CII in 2017, along with the industry stakeholders, had estimated the Ayurveda industry to be about a $9 billion industry in 2022, if I'm correct. And out of that, 25% of that is estimated to be, or is currently, services. So we are hoping by 2022, we become a 2.25 maybe $1 billion industry. Recently saw an article that talked about the global wellness tourism industry to be 600 odd billion, out of which the primary wellness tourist is about 15% of that. So maybe about 90 billion. So we're talking about how do we get a $2.25 billion chunk out of this $90 billion industry. If we take a look at the consumer, the wellness seeker, I think he has a lot of options, right? I think starting from hot springs in New Zealand to ayahuasca in South America to weight loss and detox retreats in California, I think there's plenty of opportunities for a wellness seeker. How do we get his attention? How do we get it for the Ayurveda industry? We all know, we are all here because we strongly believe that Ayurveda has a strong statement to make in the wellness space. Ayurveda can contribute better than most of these our competing practices. So taking a quick look at some of the characteristics of the wellness seeker, I think he sees this wellness as an ongoing journey. He has been to various experiences and he is going to do, he's in a continuous search for more experiences. And it's a proactive process for him. He's not thinking about a particular condition of his. He's just thinking about, I think he's mostly motivated by his desire to, his or her desire to preempt or mostly slow down the effects of aging or to work at a more optimal level, get more optimal performance out of him or her. And it's an individual initiative. They are usually more well-researched, well-educated. They know what they're looking for. They're more discerning in what they're exactly looking for. So keeping all this in mind, I think when the industry is back, when we bounce back, what are a few things that we can do better to make sure that we have a very satisfied wellness seeker? And I think it starts with and like they say, a rising tide raises all boats. So if as an industry we do it better, I think it will help all the different entities involved. And I know some of these industries, some of the entities do these things much better than others. I know on this topic, CGH and Somuthiram and all are very ahead. They have excellent practices. As Sanjeevanam, we are a new entrant. We are about 2 years old. And I think some of the things that we've observed and which we think we can improve in the industry is things like, I think having a better, more apt mindset in terms of understanding that the wellness guest is not a patient and he doesn't like to be treated like a patient. I think many a time we hear complaints where the guest felt that he was being restricted or treated too much like a patient, which I think we can focus on. I think there's also this mindset of setting the expectation right. I think we need to get better at it as an industry. Many a time the guest who has well researched, he's come and then he finds that the photos or the experience is not exactly what he was looking for. So can be, I think, doing a better job of setting expectations upfront. And on that front, I think it's always better to under-promise and over-deliver so that we have more satisfied and happy guests overall. And I think the wellness guest is not looking for a very specific thing. I think he's looking for a more broader experience. So it has to be something around Ayurveda at the core, but enhancing the experience with naturopathy and yoga and maybe functional fitness and maybe physiotherapies, natural skin and hair programs. So I think there's a whole bouquet of services that we can bring together and give a more holistic program for that guest. And I think, sorry, yeah.
Vivek, okay.
Is it time?
You are right, actually, Vivek. See, in Ayurveda, wellness is yoga and naturopathy is also a part of.
It's part of it, yeah.
Ayurveda wellness.
But I think we can.
You mentioned.
Yeah.
And see, we have last 5 minutes. We have. I think to conclusion and other. I have one question, Vivek. Thank you very much for your contribution to this subject, and we expect in the future also. CII is a body doing a lot of things for Ayurveda promotion, wellness, Ayurveda products, Ayurveda industry, working very well. Thank you very much, Mr. Vivek. Claudia, I have one question to you. What do you think? You mentioned about quarantine. So many things are working out in India now. Different discussions are going on in CII and other bodies. Suppose your guest or your patients are coming to India. Are they willing to spend 1 day without starting the treatment? I asked the same question to you on occasion, 2 days. Now I am asking if it is 1 day. Suppose your guests are coming to India, reaching India. They are spending 1 day for an antigen test. Then maybe after that a PCR test. Antigen test takes only 30 minutes to 2 hours. PCR test, 6 hours to 24 hours maximum. Suppose they have to quarantine for 1 day. What do you think they will be willing for that?
And when at the moment when we are abroad and we come home, we get tested. And then we get informed that until we don't know the results, we have to stay like in quarantine. So I think this will not be the problem. The problem will be maybe what's happening when the guests are tested. I think the best is the guests have to be tested here before they go. Before they enter the plane, they have to have a negative test. And then they can go to India. And then maybe we have only few guests, maybe they are positive. And then we don't know, maybe they have to stay at the airport for 1 or 2 nights, or they can go to the Ayurveda hotel. We hope when people can go straight to the Ayurveda hotel and stay in an Ayurveda hotel in a special quarantine room, like in Poland, they are doing this, then I think it will not be a big problem, because then they are on the final destination. If they have to stay for some days at the airport, I don't know. We don't have any experience. But I think to be on the safe side is, even if they have to enter a plane, for example, India, they announce that they can only boarding when they have a negative test result, what is not older than 72 hours or 96 hours. I don't know exactly. So that means before they start to go, they have to show a negative result. And then when they enter India, maybe there is a positive result, but I think it will be very, very low guests attached. So I think it will not be a big problem. We have to know how long they have to wait, and maybe if they have to stay at the airport in a hotel, or if they can go with a transfer to the final destination.
Thank you very much for your opinion.
And
friends, we are running short of time. We have only 1 minute.
Okay.
You want to say something fast? Do you want to say something?
No, I just would like to mention what Mr. Vivek told about the difference between a patient and a guest. We also talk about we have guests, we don't have patients, because you treat the guest in another way than you treat the patients. It's also in Europe, in Germany, like this. So we have the people who pay their own money, and they would like to get treated like a guest, not like a patient, not with a lot of restrictions.
Thank you. Thank you very much, Claudia. Very good discussions from everybody towards a different aspect of Ayurveda wellness. As we all know, our government, the government of India, is for Ayurveda and yoga. See, our Prime Minister before declared Yoga Day, got the approval from United Nations. Now the government is trying for International Ayurveda Day acceptance from United Nations.
That's great.
Yeah, number one. Number two is, we have trade body like CII, Confederation of Indian Industry, to promote, to save, to overcome all these challenges. That body is also working. These are the advantage that we have got in India. So, and the people we are ready to receive everybody. At the same time, there are many products. Ayurveda wellness products are there, cosmetics, food supplements, many products are there, not only the services. And our doctors, our Ayurveda doctors, our Ayurveda therapists, many Ayurveda resorts, Ayurveda hospitals. This is the advantage, and everybody is supporting. And AYUSH ministry, a few years before, government started a special ministry for this. That's called AYUSH ministry. So that ministry is also there. Today, many of the AYUSH ministry speakers were there. The secretary was there, director was there, So everybody is working together in India to make Ayurveda the hub of the world. Already Ayurveda originated in India. We will continue this place as the hub of Ayurveda wellness and Ayurveda treatments all over the world. Thank you very much, dear panelists. Thank you very much, Claudia Wagner and Dominic and Vivek, Venugopal and Shastin Boyle participating this in this subject of Ayurveda wellness. This discussion, very good contributions. Any more points, if you are, please send to Confederation of India Industry office. Thank you.
Okay.
Thank you very much.
Thank you, Mr. Baby Matthew. Thank you very much. Thank you all. It was very interesting.
Thank you very much.
Thank you.
Thank you.
Thank you, Mr. Baby Matthew.
Thank you, panel. This was indeed an interesting session. In the interest of time, we will start our next session immediately, which is on startup and enabling environment. I invite Mr. Madhusudan Chauhan, Director of Siddha Ayurveda.
Ja, ich auch. Haben Sie ja hier schon die. Die Inder haben jetzt What's Friends in Germany, dass jetzt die Leute alle in die What's Friends in Germany gehen, versichern können, dass die Europäer jetzt auch
Speakers kindly keep themselves on mute mode. Ms. Claudia Wagner, please put yourself on mute mode. Thank you.
Hi, good afternoon, everyone. Thanks for joining this panel on startups and enabling environment. A very interesting topic, a very powerful, dynamic topic, especially more relevant in today's times. Can I just request everybody who is not on the panel and speaking to kindly mute themselves, because it will be disturbing the viewers in properly listening to the panel. Miss Claudia's audio is left on, or if the host could please mute them. Can I request the host to please mute her?
We are just doing it, sir. We are just doing
Sure.
it. A second, it will be done.
All right. Thank you very much. Thanks. And welcome everyone once again, everybody who's joining us on the conference platform, and also people who are joining on YouTube. So today I have a very interesting panel with me, bringing in a vast amount of experience on the topic. I would like to welcome, first of all, Mr. Ramesh Vangalji, who was a marketing professional, brought a lot of MNCs into India, and heading an investor group, firm of investor groups, eventually found interest in Ayurveda, and today owns and operates Kerala Ayurveda, which operates both in India and outside India. So welcome, Rameshji. I'm happy to have you on the panel. Second, I have with me Mr. Ameev Sharma. He is the co-founder of Kapiva, which is a new age Ayurveda in the functional food category. It has done pretty well in the last 3 to 4 years in appealing to the younger masses and getting them attracted towards Ayurveda. So Ameev, I welcome you to the panel. And finally, Mr. Arjun Vaidya. He comes from a legacy of 6 generations of Vaidyas, who eventually in 2016 started Dr. Vaidyas and gave an entirely new shape to the legacy practice of Ayurveda. So I welcome all 3 esteemed speakers to the panel today. So Ayurveda typically has been viewed with this lens of legacy and heritage of thousands of years always. It has this image attached, which has certain reminiscences and remains of the yesteryears. Startups bring that fresh, innovative thinking that can really modernize and contextualize Ayurveda for the masses today that are globally exposed, and especially to the younger crowd, the millennials, as we talk about them. There are great, interesting examples out there where there are integrations and advancements with AI, ML, genetics, systems view of medicine, combining with this age-old science of Ayurveda, creating an entirely new frontier for Ayurveda. Taking this knowledge, which is age-old, and packaging it in a form and in a manner that the consumer understands and appreciates today. The startup ecosystem for Ayurveda is pretty nascent. I'm sure there are only a handful of organizations that you can think of when the startups and the startup ecosystem is thought of. However, it is becoming an increasingly visible segment within the Ayurveda industry, especially so over the last 2 to 3 years. There is a huge upswing in the number of startups that Ayurveda has seen, and not just traditional form of practicing Ayurveda, but they have gone out and experimented with all sorts of different formats, different interdisciplinary models with functional foods, nutrition, health, veterinary, diet, nutrition, so on and so forth. Investors are taking a keen note. We see that today. Especially in today's context, during and post-COVID, and also after this call by the Honorable Prime Minister for an Atmanirbhar Bharat, I feel that Ayurveda sector has gained a very special spotlight, both in India and internationally. So we set up this panel today, and I'm very excited to hear the speakers and their views. I'll start with Ameeb. Ameeb, we are going through this pandemic, the COVID pandemic. Ayurveda has seen a very special interest, both from an awareness as well as an adoption point of view. How do you see this trend impacting Ayurveda startups in the longer run? And also, what levers do you see for growth that the sector now needs to critically address in order to unlock the growth for Ayurveda startup ecosystem?
Ask me about Ayurveda today. I think, surprisingly, there's a lot of parallels today between Ayurveda and actually e-commerce, right? And online sales. And they say why? Because they're both going the same way, right? With COVID, what has happened is that a lot of new people or new customers who would have otherwise not tried Ayurveda, right, are for the first time now trying Ayurvedic products, right? For the first time, people are thinking about curative, not only curative, but also trying to take things to stay healthy, but not only cure them once they get sick, right? So the curative angle of Ayurveda is growing very aggressively. And a lot of customers are trying Ayurveda for the first time, right? I think for the future, to make this something that lasts for a long time for the Ayurvedic industry, what is very important, first of all, from a company point of view, is that the experience that a customer has with an Ayurvedic brand becomes the make or break sort of position here, right? So you look at the reason I was comparing with e-commerce, right? During COVID, a lot of people did online shopping for the first time, right? If they found that they are happy with the experience and they found that it's very convenient, they will continue to do so after COVID, right? In the same way, a lot of people during COVID have tried Ayurveda for the first time, right? The reason they've tried Ayurveda for the first time is because they feel that they need to kind of protect themselves against the virus, right? But if the product that is offered to them gives the proper result, where people feel the benefit of the product, feel healthy after a month, they will continue to use that product, right? It's not like even once we finish COVID and the fear goes away, you've taken that customer in. Just like a customer will continue to shop online even when COVID finishes, right? So I think the opportunity now is that there's a lot of people searching and actively looking for Ayurveda, right? As a company, we've seen almost 300% growth in the last 4-5 months, right? And it's been a fantastic journey. And I think, a lot of people now, but the question now is that how to make this last and how to make this long run. And the long run way, if you ask me to do this, is to make sure that the customer gets the best possible experience, both in terms of the consumption journey, as well as the product itself, as well as the right guidance to move forward in the Ayurvedic journey. So, that's how I look at the opportunity. And in the long run, the big sort of differentiator is going to be the company, the consumer journey, and the product itself.
Interesting. So, you very interestingly mentioned about the customer experience, and a lot of times that's also the startup ecosystem bringing in that fresh perspective into how the consumer is dealt with. Vangalji, you came into Ayurveda from an investor's point of view, right? Obviously, you had a personal journey for why you came into Ayurveda, but that lens of an investor looking at this space, a person putting money in the sector. Also, you operate both in India and outside. So how are you reading the global context today, and what would be your suggestions to the industry as takeaways, so that we're able to build on top of this foundation that has been already provided, more so in the startup ecosystem? You'll need to unmute yourself.
All right. Can you hear me now?
Yes, we can hear you now. Yes.
In very simple terms, here is an opportunity for India not to think small, but to think big. In every industry that we have got into, let's say the most successful has been technology. We are really the techno coolies of the world. We do not have an IP. 38% of code is written by an Indian hand, but there is no intellectual property. There is no brand name, which is owned by India or, for that matter, Indians. So really, I'm not really an investor anymore. I was at one point because I was deeply struck because Ayurveda helped me. So above all, I think the first message when you look at a market is to determine how big is the applicability. And from my personal experience, Ayurveda is the mainstream medicine. It is not a shampoo. It is not a cream. It is fundamental rebalancing or maintaining balance in life, which balance is removed and then you have disease. Ayurveda helps restore balance. That's the basis. That market is global. And India has a lot of success without its knowing in terms of building a franchise on yoga. So the real question is, what can you do to be able to roll out the magnitude, the enormity of yoga? There are 300 million people practicing yoga in the world. In the US, that market's around 70 million, of which 35 million are regular yoga practitioners with an average per capita income of 2x of the US average. So if you think about it, the question really is, if yoga can be such a big name, why not me? Unfortunately, in the case of yoga, India does not feature. Yoga is seen more as an international property. And for example, you may have different concepts like power yoga or hot yoga, but they're not Indian anymore. There are more Indian yoga teachers abroad, more practitioners abroad in America than in India. So the real question is, in terms of going after yoga, in terms of trying to get an Indian brand name attached to it, which I think is great. June 21 is annual yoga day. But the one yoga with Ayurveda is that almost anybody who basically is interested in yoga, and everybody who's interested gets more and more serious, then that deeper part of yoga will be where Ayurveda strikes, because it's at the same level of it. So you don't have to go into a brand new market and create a brand name for Ayurveda. You attach yourself to yoga. That's one. The second thing, what I would recommend you do, you build an enabling environment. What do I mean by an enabling environment? Today, our target audience is pretty much the world. There is no bigger industry than wellness. Wellness is probably a $4 trillion industry, $4,000 billion, global terms. And it basically encompasses anything and everything from the food, the exercise, the lifestyle, the sleep, and the meditation, plus obviously your dietary supplements, your therapeutic, and we are an integrated science of products, education, and services. We need to encompass all. So my simple request is that I want India to partner the finest and the best of Indian technology capability, so that you start going out in terms of penetrating the mainstream, the stream of consciousness there on a global level. And there's lots of ways by which you do it. So crucially, what this requires is the industry to say two things. We're looking for all the startups possible, not necessarily in Ayurveda, but in terms of technology, which can partner Ayurvedic knowledge in India and capability and talent to be able to find a global market for this, which becomes all the more relevant. I may have a great product for immunity, but until I can reach 100 million people or 1 billion people, it's frankly going to be small business. So the point is, with Ayurveda, we lost an opportunity. With yoga, we have an opportunity to recapture the concept. And that's really the vision. And there's a whole bunch of things that can be done. And why am I here? Frankly, I started Pepsi long ago at this Yehi Hai Right Choice baby. I'm frankly at a time when I probably should have retired long ago. I'm 66 years old. And what drives me is because I'm passionate about yoga. And I believe in the next 5-6 years, I'm interested to find a way of institutionalize inspired by inspired by Ayurveda, powered by science, because we are not credible scientifically. If you look at it, our Ayurveda does not have international scientific credentials. It is, I have been working on this and I can assure you we can do it. But this needs an organized approach. And the third thing, you need to propel it through knowledge dissemination. That's in terms of, I think, the overview approach, which is what I thought was one of the ideas that CII was looking for, is give us a concept which can drive this. We know that Ayurveda works. How do I convince people about it? I give them knowledge. How do I get them to try it? I basically give them a product, I give them a service. And thirdly, I consolidate by awareness, trial, and reinforcement. And who's my first market? It's yoga. What's the brand name? I am the sibling of yoga. I am basically a part of the yogic opportunity.
Very interesting. I think some key points you touched upon and very important. One is ensuring that Ayurveda does not get lost without India getting the due recognition for the knowledge system and the ownership over the knowledge system, the origination of the knowledge system. And also an interesting point that building upon the adjacencies. So we look at yoga and we look at the trees, organic living, organic food, and we build on top of that. So I'll come back. I have a couple of questions for you. I'll come back to that. But before I ask you another question, Arjun, I'd like to bring you in. And you started Dr. Vaidya's about 4 years ago. And although Dr. Vaidya's in practice already existed for over 100 years, but the new age Ayurveda, as you call it, and in a startup ecosystem, looking at technology being the driver for the organization. How have you faced the last 4 years from the lens of a startup? And what would you recommend? What would you say were the challenges that you faced that can become pointers for what we should be doing in order to facilitate a larger number of startups coming into this ecosystem?
And thanks for having me on this session. I think Amev and Ramesh ji have said some really interesting points and some of the stuff which I was going to say. But I think that, look, we were here about 2 years ago, right? We had a similar session in Delhi, and Dr. Vaidya's was less than 2 years old. And I think from where we were to where we are, I think we've come a long way, right? So we were sort of scratching the surface. Now we've scratched a little bit of the surface with the opportunity with startups in Ayurveda. I think we have a long way to go, but we're not as nascent as we were 2 years ago, right? So I'll talk about sort of the macro and then talk to you about a personal story, personal journey, and sort of tie all of those things in together to talk about the opportunities. So I think from the macro perspective, right, I always say that the last 5 years, that's 2014 to 2019, have been the renaissance of Ayurveda, right? Ministry of AYUSH was created. A lot of consumers came back and said, I want to know more about Ayurveda. I want to learn more. And so 2014 to 2019 was sort of a period where Ayurveda experienced growth like I believe it's never experienced in independent India. Now in 2020, while most industries or a lot of industries have seen the year as a washout, I think for us, it's an opportunity. Right? And I think I'm very happy to see that across the industry, everyone has sort of worked together, worked even harder to help spread the message even further of Ayurveda. Right? From a personal experience standpoint, if I talk about sort of the importance of technology or the importance of sort of Ayurveda from my perspective, right? So I grew up with juvenile bronchitis, although I didn't grow up in a family with an Ayurveda brand. I grew up with a family with an Ayurvedic doctor, and my dada's treatment helped me with bronchitis, and that made me a believer, right? So as to what Amev was saying, I think that the first experience or a customer experience is very important, and that makes believers. Ramesh ji was talking about yoga and its adjacencies, and I had the good fortune of going to the US in 2009 for my undergrad, and I saw a move towards natural organic products. I saw the yoga revolution happen in the US, and yoga gyms, yoga mats, yoga pants, yoga apparel, all of these multi-billion-dollar industry in the US. So I started thinking to myself, like, if they've done it with yoga, why can't we do the Ayurveda, right? And that's the thought I came back with in 2013 when I came back to India. And that's a thought that sort of started my journey into this brand. And I think for us, e-commerce has been at the center of what we do. So from the day we started, we've been a digital first or digitally focused brand. And that has allowed us, with limited experience and limited distribution to reach 16,000 plus pin codes in this country, and really reach sort of a deep section of the Indian population. This pandemic has given us a huge opportunity as an industry, right? Digitally, you're able to reach consumers who did not use digital, right? So if I talk about my parents and their example, my dad did his first order of his life on Amazon during this pandemic, and my mother used Google Pay to pay for fruits and bread for the first time, right? And so, or it's Ayurveda, right? I have so many friends who've called me who said, I've never tried ashwagandha. Can you tell me more about this herb? Or I've never tried Giloy. What is Giloy, right? These are people who would have known me for 15 years and 20 years and would have never given Ayurveda a shot. But this time, as Amev was saying, they're giving Ayurveda a shot. And so you have this opportunity to get this huge section of consumers in who may not have interacted with our science in the past. And for us now, it's important to deliver the best experience. You'll have a lot of consumers coming in saying, I want an immunity product. But once they're convinced with your immunity product, can you keep them as Ayurvedic customers for life? Can you tell them the next time they have a cough or a cold, or their mother is suffering from diabetes, or their grandmother is suffering from arthritis, hey, I have something for you for that ailment as well. I think that's the real opportunity we have to capitalize on. Look, immunity was something that pre-March was always viewed as unimportant or not very important in the Indian construct. But now it's come to the fore, and with this,
it was limited to a Chyawanprash in the winters, and that
exactly right. And now it's come to the fore. So I think looking forward, if we can capitalize on this opportunity and sort of push forward to give the customer the experience, but also for me, I think as an industry coming together and educating consumers is very important, right? I think that still in the modern consumers, there is a lot of work to be done when you educate consumers. So I always give this story saying that, my grandmom's generation, a lot of people would know that amla and bringraj are components of hair oil, but the modern generation still needs this knowledge in a palatable format. And I think that's where we need to focus to get these millions of consumers who want to know more, to genuinely know more and be part of our industry or be part of consumption of our products. I think that's very important.
All of us have made a points, and which is to do somehow with understanding the consumer and serving it in a fashion format that the consumer will find convenient and accessible. And also, how do we leverage the technology as an enabling platform to deliver not just the product, but the entire experience. In that context, that there were parallels made to Ayurveda being where the IT industry was, say, in the early 90s. And obviously that revolution for adoption of technology was driven by the large tech giants from the West. What is it that we need to do as an industry, or what is it that we would want the government to listen to, saying enabling this larger adoption and enabling this larger awareness around Ayurveda? And to a large extent that's happened in the pandemic, because we've been talking about building immunity, doing preventive care, and the government has really backed Ayurveda and allied the AYUSH sciences behind it. So what do you feel that we need to now capitalize on? What are the specific steps that as an industry we could be taking to further upon this momentum? So it's open. Any one of you could take this question.
Sure. So one thing which I've been talking about for a long time, and I think one thing, which I think the government needs to kind of take a lead in, because industry by itself will struggle to do so, is, have a very strong validation of Ayurveda as a science. And this is from a global point of view, right? Today, when we talk about clinical trials, when we talk about, validation of products in terms of use cases, a lot of these are not accepted globally, right? They say India mein hua ye correct hai ki nahi, that's a question mark. A lot of these are, kind of not accepted globally by either journals or by industry, right? Or by regulatory bodies. What the government needs to do is that they need to, first of all, create a framework, right? Where, if today as a company, right, I am willing to invest $2 billion, $2 million to do research on a product. I don't even know what it's going to get me, right? So if there's a clear framework from the government saying that, okay, boss, if you invest X amount of money, but tomorrow these are the guidelines which are globally accepted, where if you get this outcome, if you do a double-blind placebo test, and this is the outcome that you get, this product can be sold in the US, can be sold in Europe. Those agreements on a government level need to be created in order to truly tap that $4 trillion wellness market that Mr. Ramesh was talking about, right? And from an industry point of view, this becomes very, very difficult to do. So it's very important for government to come in. I think, honestly, my suggestion, and then, there's a lot of, I have to give it to AYUSH though. They've been really going out of the way and taking a lot of active suggestions from industry. My family business being a 100-year-old kind of business, they reached out to us and took a lot of different suggestions. And one of the kind of points we had a long discussion, on was actually, can you create a generic sort of item, which is where the sort of research R&D is done for every person. So the government does the R&D, let's say, for a diabetes product across all government hospitals. They validate it from India, and any Indian manufacturer can manufacture and export it, right? But it's owned, the IP is owned by the government of India. So a lot of very interesting models are being created here. But I think end of the day, the future and the real market, like we can say we believe it and we know it works because we've grown up with it. But I think the burden of proof is very important, right? And a burden of proof created in a global way, which can be created in, which can be published in journals. I think that is the sort of next step to make Ayurveda global and really kind of bring in, and technology needs to be leveraged to be able to do that in an effective way.
Right. Interesting. And also, giving an analogy, saying you create a central pool of validated knowledge, the fundamental principle gains more credibility, and anything that builds on top of that will automatically have a higher acceptance rate. Ramesh, I think you wanted to come in on this point.
Yeah, I think the points made are valid. But let's talk about research. You cannot institutionalize research. If you try to organize research, it won't work because it's all about innovation. However, what you can do is, I think what the gentleman said was set some guidelines. But what's the most important guideline is standardization. Gentlemen, we don't have standardization. If you don't have standardization, nobody knows what is the pharmacopic code or what is the standard that you have to meet. So there is no acceptance. I know, for example, I've been working on it in terms of the US, including delivering a Prop 65. Prop 65 is California only. It is way more difficult than US FDA and probably more than any other standard in the world. So, and I think we need help on that, because if you are going to standardize Ayurvedic herb or an Ayurvedic formulation, it takes an enormous amount of cost. There you need government support. But let me come back to the other big idea which was talked about of technology. Look, there is nowhere else in the world that India has such strength in as in technology. You need to create clusters of small businesses in technology. It could be like what could have been, you've seen how WhatsApp can grow. You've seen there is no such thing as technical giant, which created India. I was in Silicon Valley during the 97-2000 period. And I can tell you, Google and Apple were all struggling. So really, there's a whole lot of Indian digital knowledge, talent, capability, innovation. We need to inspire them and saying, guys, this is the big vision of Ayurveda. If I have this extraordinary vision, I need you to reach at the first stage while you're fixing the products and everything else. I want to be able to reach you to be able to establish Ayurveda as the comprehensive, if you like, wellness platform with an appropriate app, which initially disseminates information and knowledge, because we all want to be well. And we all want to have immunity. We want to fight virus. So I think if there is one major thing that AYUSH or government of India can do, is follow the example of what the Japanese did after the war. in the 1950s, 60s, and what the Chinese are doing now, whether it's with electrical vehicles or whether it is solar cells or whatever. They are forming, but in their case, they're all government or government inspired, but I think we have enough innovation. And Ayurveda is a soft science which can penetrate a lot faster than hardware and manufacturing. So it's a simple vision. If you capture that vision and prove or give some support to research, but even more important to standardization, and to be able to establish these things, and you got to change the mindset. I can tell you all, you go and build a business in Ayurveda, and then the Journal of American Medicine will say it is 20% heavy metal and your business is under. You've got to establish the credentials. And let's face it, Indian Ayurveda has very little standardization. That's why the products which are there are generally viewed globally as unsafe and unreliable. So you need to set the standards to prove that you are. The safety, toxicity, and efficacy. Once you have done that, then you basically look for an enabling environment to be able to say, I want to encourage 10 people who will help me reach different segments through technology, because that's the way to reach them. So these would be the two large policy suggestions I would make.
We've spoken quite in detail on the product side of Ayurveda, right? Where you're creating a product, selling that out. Do you feel that with the new startups coming in, how are we looking at some of the more niche elements? What are some of the more niche areas outside of just the product retailing, product distribution, that you feel can be interesting and potential growth drivers, where further exploration or somebody creating a startup in that segment would help? And what you mentioned, with an intent of creating the Ayurveda unicorns, or the Ayurveda WhatsApps, which are more tech driven. So maybe Arjun or Rami could come in, and what are some of those areas outside of just products?
I'm happy to take that one, actually, and I think it's a very good point, right? And I think nurturing entrepreneurship in our industry is extremely important. It's something we have started the path on, but it's something we need to work much harder on, right? And this starts from sort of Ayurvedic colleges. It starts from the education of the youth in India, right? Because there are a few folks who are doing some interesting things in technology, and they do come to companies like us and say, hey, will you give this a shot? And I've seen a lot of these people who've been rejected or sort of pushed back, saying that funding is an issue, or trials is an issue, or nobody's taking them seriously. So I think from a government perspective, yes, but also from an industry perspective, I think all of us need to come together and say, hey, we have the products, we have the knowledge, but we need to nurture these startups and nurture these products or these sort of innovations in technology to help us. And I just wanted to actually touch upon the previous point, right? Because we talked a lot about exports and we talked a lot about the scope there. And I think in that space, I think as an industry, with the government, everyone put together, our thinking is too small right now. So if you see where TCM has gone, if you see where yoga has gone, and if you see where we are with Ayurveda right now, I think we have a long way to go. And accepting the numbers today is the biggest disservice that we can do as an industry, right? Because we've been presented an opportunity, we've been presented an even bigger inflection point with the COVID-19 pandemic. But where we are today, and we've seen what's happened with yoga, right? Where it's been repackaged, rebranded, and given back to us in an appealing and accessible format. We know the model, we've seen the playbook, but now we need to be able to replicate or work through that playbook to say, hey, we want to be Indian companies taking Ayurveda to the world. We don't want to see American companies or European companies taking what we have, repackaging and making unicorns out of it, whether it's products or technology. We need to stand up as an industry and say we can't think small, we need to think big. And whether it's research, whether it's government level agreements, whether it's standardization of herbs, extracts, products, or whether it's just easing the process of our Indian companies to go abroad, I think there's a lot of introspection and deep thinking we need to do for this, because the numbers today have a long way to go.
So like we mentioned, the product space, we see a number of things happening out there. Are there other avenues or sectors within the Ayurveda industry which you foresee can become interesting growth engines for the industry? You know, where say, on the services side or on the education side, teaching side?
No, so I have a point of view, actually quite a strong point of view here. I actually think for Ayurveda to grow, Ayurveda is not like allopathy, right? It's not that for any problem, there's one pill, you pop it and you're done, right?
Yeah.
One of the core of effective Ayurveda is customization, right? You need to take the right medicine based on your body type. For some people, ashwagandha works really well. For some people, it doesn't, right? And that's a fact, which is one of the biggest challenges of standardizing Ayurveda today, right? So the biggest thing I think that can be a companion piece to growth of Ayurveda is actually automated AI-based Ayurveda services, right? The beauty today is that in this phone of ours, right, in this beautiful little device, the amount of sensors that we have is fantastic, right? Everything from your pulse to your heart rate to your can be measured, right? And there are people doing some interesting things around giving more custom, and obviously not as good as a top quality Ayurvedic Ved. But the fact of the matter is, and Arjun touched about this, that the number of Ayurvedic doctors in India hasn't really grown for the last 2 decades, right? The population is doubling, tripling, and the Ayurvedic doctors are not growing. So there has to be some way for us to leverage technology, you know, to bring better quality Ayurvedic treatment, you know, to a larger number of people, right? And that can be done, I think, through technology. And then I think there's a huge opportunity there. There are a couple of people kind of working on it as we speak, but nobody really got into the point where, you know, it's even comparable to a good quality Ayurvedic doctor. But I think there is an opportunity there, and the more we work on it, the more data we have, the bigger sort of data set we have, the better AI works on data, right? So the more data we have, the better it'll work and the more effective it'll become, and that can really revolutionize Ayurveda in a big way.
So I'd like to make a couple of points. First of all, Ayurveda is an integrated body of knowledge and practice. It is not a product, as the gentleman rightly said, but what it is, it's a combination of, let us say, Panchakarma being the high end, but it's also in terms of the consultation, figuring out what is your prakriti, your vikriti, and how are you going to recover balance. And then it's a complete and a continuous spectrum of service, of products, knowledge in terms of lifestyle, and in terms of lifestyle too, and also in terms of the Panchakarma and the cleansing and the detox. So as a consequence, there is opportunity for an enormous number of startups in every environment. For example, you take beauty. Beauty is huge, but frankly, you don't need the L'Oreal kind of beauty. There are such wonderful secrets in Ayurveda. And let's basically, if you believe in the concept, I don't think it's just about somebody coming up with a new product and launching it. Very often they may come into it in a, say, new brand of Ayurveda, say for beauty. That's fine. But on the other hand, if you want to make a big impact on a sectoral basis, to impact the globe in the biggest single industry there is, you need a certain degree of a larger vision and a cluster of innovation and smaller entrepreneurs joining together. I'll give you an example. We are holding about 4 US patents with double-blind, placebo-controlled, randomized studies, phase 2. But I can only do that for 3. And that was because I'm not looking at it from a financial perspective in terms of its investment. I was looking at it from the long term because of conviction, because it healed me. Nothing else healed me. I was borderline diabetes, cholesterol, and hypertension 10 years ago. And when this heals me, I'm saying, frankly, I did Pepsi, Yehi Hai Right Choice, baby. But for me, this is my Yehi Hai Right Choice, baby. So what I'm saying is we can get dissipated like we do in technology. We're all over the place. We have hundreds of different companies, and all of them will sell out once they get a particular technology or get a particular price. One of my friends sold out to Amazon, the search engine of Amazon called jungly.com, but that was done way, way back. Today it's worth 1.3 trillion. So instead of, what we need to do is to put the combination of our talent and like all these young gentlemen there and direct it in a vector towards an end game. That end game you must visualize. Once we visualize it, then we can do it. That's all.
How do we combine together or bring together all these different smaller startups and their efforts almost to the sort of, either creating a national network of startups and new entrepreneurs who are interested to either start or already working in the space of Ayurveda, and thereby either connecting them with an incubation center or a fund or the relevant technical know-how, so that we're able to then also fuel further these ideas and innovations. And like rightly said, Ayurvedic Vedyas themselves, and I've seen that they sometimes have brilliant ideas, but with an inability to know how of what to do next, it sort of just remains within the confines of their own clinic. So we're almost 5 minutes left in our session. I'll just go quickly skip from one to the other, all three of you. And if I'd like you to summarize 2 points. One, what is that one final takeaway or recommendation that you want to make to the industry of startups in Ayurveda that they must do so as to unlock this growth? And the second point is a recommendation for the government, be it a policy recommendation or otherwise, that can create an enabling environment for fostering this innovation and entrepreneurship in Ayurveda. Rameshji, final word.
I'll say very simple. First, you create an opportunity by which a cluster of technology can basically support the growth of Ayurveda on a customized basis by reaching, let us say in the short run, 1 billion customers in 10 years. In order to do that, you have to provide an enabling environment as government support. For example, Singapore does that in terms of providing technology or facilities for research, facilities for building. But I think the enabling environments is technology, and we have the knowledge. And I think government needs to say, this is the vision, let's go and do it, like yoga. And frankly, somebody was saying yoga has done it. No, yoga has failed. We don't have any revenue in yoga for India. Yoga is a US property for all practical commercial basics. The largest is Yoga Alliance, that's one. On the other side, in terms of, say, the ministry, the science, we need to get standardization of Ayurveda so people can take a turmeric medicine and say, this is safe. And it's pure because it is not easily tested. These are requiring high expensive machinery in order to be able to demonstrate this. And our current infrastructure for Ayurveda is way dissipated. Every state does its own thing. It needs a broader, it's calling for a unification behind a big vision. This is the opportunity. We have a government which can create the vision, and then everybody flows inside. There's just so much scope for teachers, for product developers, for service, and for researchers. That's all I have.
Thank you. Thank you.
Yeah, Madhu. So I think your two questions I'll blend into one because both of them sort of have the same recommendation. For me, I've seen some limited work being done in the startup ecosystem, as Amev said, and I've seen these startups have not got enough support, guidance, or enough consumers to test their products on, and that's a big challenge, right? So CII Kerala, for example, did Ayurveda hackathon. Agni does some sort of Ayurveda-focused tech events, but I think from that perspective, we are still very far away from enabling the ecosystem. whether it's government, whether it's industry, we need to put our hands together and say that these are people who need access to consumers, need access to guidance, need access to mentorship, and we're the ones who are going to do it. And only if we come together can we do something like this. And I think Ramesh ji is right. From a education or a trust or a standardization perspective, we have a long way to go till we have consumers across the world who come and say, hey, this is safe. Hey, I trust it. Hey, I'm going to use it. And so from an education perspective, we need to do a lot to tell people that, yes, this is a different paradigm from allopathy, but this is a paradigm. And this is a paradigm that is safe to consume, is good to consume, and we want to consume it. And I think that to me is the key takeaway to the government as well, right? We've done some work, and the Ministry of AYUSH has come in huge support of Ayurveda and of AYUSH in this pandemic. But I think we need to keep this going, and we need to keep the dialogue going, because their platform is a platform that none of us as brands have. That platform is a much larger one, and that platform can leverage that all of us as sort of industry can come together.
Thanks, Arjun.
So yeah, so on the first question on startups, I would say that, right now in terms of how startups are looking, I think that we've seen a lot of product startups, and I think both Arjun and I are kind of, in that space. I think the reason we've seen a lot of product startups is that with the advent of modern trade, online, suddenly, startups can suddenly reach a lot of consumers in a very cheap way, right? With D2C, etc. So I think that's why we've seen a lot of startups come up in the product side. The reason we haven't seen a lot of startups come up in the service side is because I think till today that it sounds simple. Oh, let's download an app or whatever it is. But I think what the government can also here step in and incentivize people to kind of say, for example, I think there's a huge opportunity for a cult fit. To take on Ayurveda as a sort of therapy, from a therapy point of view, and do a lot with it. I think government should work with businesses that already have large consumer bases to kind of invest and, grow out that Ayurvedic angle and get more data, which is more shareable, and then make that data somewhat freely available. It should not be a monopoly. So government can work with industry, and then I include myself in part of this. So Vednath has about 3,500 Ayurvedic clinics that function as franchises around India. Set up technology across those, use that data, let's share that data, let's work together, as an industry. And I think only the government can do that, right? I think from a government point of view, I understand the whole process and point about standardization. But, personally, for example, we had a WHO approved manufacturing unit about 10 years ago, have been exporting to the US and California for about, and 35 other countries for about 10 years, right? The challenge, we still get about 0.5 to 0.6% rejection. So 1 out of 200 orders, we do find some issues, right? And they get stopped to the customs in the US and things like that. But the biggest problem we faced has not been about manufacturing issues. But the biggest problem we faced is credibility. People don't want to buy stuff made in India, right? And that is something to change perception is a very difficult thing to do, right? So what does that leave us with? And that comes back to my original point, that leaves us with intellectual property, right? So intellectual property, as we discussed, we've lost it to the US, right? How do we control our intellectual property in Ayurveda, right? And in yoga, we've lost it to the US. How do we keep it in Ayurveda? And when I was talking about innovation, my point was that as government, we can come together. Some basic formulations, which we all know that work for things like diabetes, joint pain, at least as a country own them, make them available to Indian entrepreneurs, right? We're not innovating, we're not taking something we don't know how to do, but we're at least keeping the intellectual property in our country, right? Even today with yoga, we could have done that, right? We could have some basic asanas itself could have been intellectual property, owned by India actually, and that would have made us in a much better position. So it's a bit out there, the suggestion, but I think it's something should be looked at.
I think very, very important and valid suggestions from all three of you. Sorry, we've run out of time, about a minute over budgeted from the time allotted. I'll quickly summarize and some very important points. In fact, the three key things that kept on resounding again and again throughout the session was one was creating a common pool of network nationally where we're able to unite and get the entrepreneurial energies and innovative ideas onto a single platform and incubate them. provide them the things that they need to succeed, be it technical know-how, R&D facilities, technology, even Ayurveda know-how, and connecting them to the right people, eventually even finance. So getting them funding. Second was around standardization. So how do we get the science of Ayurveda standardized, accepted, and understood the world over, so that there is that fundamental validation of the science through which any science draws its credibility is accepted, and thereby anything that's built on top of it does not need to reinvent the wheel. Each company does not need to go out and reinvent the wheel by its own. And the third point I felt was around the IP of Ayurveda, that how do we ensure that the attribution remains with India? We do not lose out this opportunity from an economic perspective like yoga. With that, thank you very much. I really would want to thank CII for putting out startups and enabling environment, because this will not only become the growth engine for our industry, but also a source of fresh thinking and innovative ideas that can really turn Ayurveda around and take it globally. Thank you, Rameshji, Amev, and Arjun for joining us and sharing your thoughts. Thank you very much. Namaskar.
Thank you so much, panelists, for the interesting session. Time we begin our next time. May I request to kindly on mute session. Good evening, everybody. We'll now begin the next session, promoting industry and academia linkages, honing skill sets, and leveraging Ayurveda doctors and paramedical staff for future. I am happy to inform Professor Kishore Patwardhan, Department of PhD Faculty of Ayurveda, Banaras Hindu University, is joining us today. Our panelist is Vaidya Jain Deopujari, Chairperson, Central Council of Indian Medicine. Dr. Preeti Chabra, Patron, National Ayurveda Student and Youth Association, and Senior Consultant Ayurveda, Sri Gangaram Hospital. May I request Professor Patwardhan to kindly moderate the session. Thank you.
Sir, namaskar to everyone. I don't see Dr. Preeti Chabra. Has she joined the session? Hello?
She has joined.
Okay, fine. Okay.
Yeah.
So, yeah. Good afternoon, everyone. The quality of Ayurveda education has been a long haunting question that is yet to find a concrete solution. And lack of good patient turnout, mushrooming of low quality colleges with poor infrastructure, corruption in the system are the major reasons for dilution in the quality of training. On one hand, teachers experience exploitation by management, and on the other, many teachers indulge in academic misconduct, such as working as ghost teachers, indulging in data manipulation pertaining to patients, etc. And all this ultimately leads to diffident graduates being produced who are unemployable and not even confident of practicing Ayurveda once they graduate. And on top of these problems, COVID-19 has posed many more challenges. And to discuss these issues and many more, we have with us Vaidya Jayant Dev Pujari, the Chairperson, Board of Governors, Central Council of Indian Medicine, and Dr. Preeti Chhabra from NASYA, National Ayurvedic Students and Youth Association. I welcome both the panelists to this session. Briefly, I would like to introduce the panelists. Vaidya Jayantadev Pujari is a practicing Ayurvedic physician from Nagpur with 35 years of standing. He is currently the chairman of Board of Governors of Central Council of Indian Medicine, New Delhi. He has authored around 30 research papers in different national and international research journals and happens to be one of the widely cited authors as well. He has authored 8 books on various topics such as Charaka Samhita, mathematics in Ayurveda, and also on Ayurveda education. Sir, I extend you a very warm welcome to this session. Coming to the introduction of Dr. Preeti Chhabra. Dr. Preeti Chhabra is an Ayurvedic consultant practicing in New Delhi for the last 28 years. She specializes in Panchakarma therapies, Ayurveda gynecology, Agni Karma, Jalau Kavacharana, and Swarna Prashana. Presently, she is offering her services at Sri Gangaram Hospital, New Delhi, as senior consultant Ayurveda. She is a patron at NASYA, that is National Ayurvedic Students and Youth Association, Vijnana Bharati Initiative, and distinguished member of All India Ayurvedic Congress. And also she occupies many more responsible positions in various organizations. I extend you a very warm welcome, Dr. Preeti Chhabra. Now, let us have some opening remarks by Vaidya Jayantadev Pujari ji. Sir, I request you to give your opening remarks, and afterwards we shall go on having a question and answer session. So how do you think that Ayurvedic education needs should be changed in the current scenario, and also how is new educational policy should influence the Ayurvedic education scenario, and so on? We will be coming to the specific points later, but let me have brief opening remarks from you, sir. Jayantadev Pujari, sir.
Namaste to all. What I understood from the mail I received from CII is today's topic is academia-industry interaction. And that is what, is it correct, Kishorji? I'm not getting your voice.
Yeah, that is the major theme, sir, of course.
Yes.
Making our graduates more efficient and employable. That is the core theme, of course. But we will also be dealing with some other aspects of Ayurvedic education. Since you are here, we want to utilize your presence as such.
See, one thing I want to clear about our main theme, that is academia-industry interaction. This concept mainly comes from the sector, because and technology sector, because there that interaction worked very well, and that was essential part of their education as well as the industrial activities. But in ISM, that is Indian System of Medicine, the main issue is we are training our graduate as a physician. We expect them to become a good physician, at least, or a helping person for a industry. Number one. Second thing is, because of this, the modern advances in industry, they are not aware about it, particularly the pharma industry. And as I know, whatever changes or whatever technologies pharma industry had adopted in last 50 years, there is no contribution from the academia side, because they don't know anything about these developments, like using different types of instruments and different types of vessels and their materials and how to heat them and how to prepare how to use that automatic curl, etc. So that is basically a problem in our field. Is our training is, and same is with allopathy also. A MBBS graduate, he don't have any contribution to contribute in the pharma industry. But there, that course, pharmacy course is there, B.Pharm, M.Pharm, and they are trained accordingly for the pharma industry there in allopathy. That provision is not there or available. That is, M-Pharma Ayurveda is only available in Gujarat, and that is not enough. That is what I understand. So that's why this academia and interaction is not there. Another issue is we have many stalwarts practicing all over India, and they have their own experience, they have their own formulations, and even our researchers, they are doing very well. But the problem in our field is it is not transformed into a product, and because the requirement is something different, and what the research is doing or the experience is gaining is totally different. Hello.
Yeah, sir.
Should
Sir,
I,
please
should I
continue.
continue?
Yes, sir. Yes.
So because of this, there is no interaction between academia and industry. That is the basic thing, and it is everywhere in medical. Homeopathy, same thing is there. In allopathy, same thing is there, and same is with Ayurveda, Unani, and Siddha, and even in Tibetan medicine. So that is what first I want to clear, that this is the reason, number one. Now you please continue with your questions regarding education.
Yeah, thank you, sir. Actually, the major problem that we have is that we often think that industry means pharma industry, but in this session, we won't restrict to pharma industry only. Industry means anyone that employs hello, yeah, anyone who employs our graduates. It may be pharma industry, it may be hospitality industry, it may be health tourism, it may be hospitals, it may be insurance, it may be instrumentation, everything. Every industry should be thought of.
It is.
Yeah.
I gave only example of the
Of
pharma
course, sir. Of
industry,
course. Of
but,
course,
but
yeah.
this is applicable to everywhere,
All this,
because
yeah.
whenever he applies to a insurance sector, he don't know anything regarding. He has to get special training for that, and it is not incorporated in our education. So this is applicable.
Education, it is not there.
They are
Yes.
useful for the hospitals only, as on today, because they are trained as a physician. That is
right. So do we need to incorporate some of such skills in our graduate curriculum? This is the next question.
The I have.
Or can it be added in postgraduate curriculum or something like that?
No, see, we have to first decide that what our, because we have a particular time to train our or to teach our subject to our graduate or postgraduate. For graduation, it is 4.5 years, and for postgraduate, it is 3 years. So in this time, in this time period, what all things we can incorporate subject, means the subject of Ayurveda. Okay, if you add anything else, then what will happen? It will reduce the time in the main course. That is the problem. So you are reducing teaching time for your subject when you are adding some other subject. So to avoid this problem in CCIM, we are proposing, now we are working on that, we have circulated that we are proposing is main course, and the other are electives. Electives are many. We have, as on today, we have a list of 61 electives. And main course will be main course. And electives will not be taught in the college or in the institute. He has to appear for the online teaching program of that elective, and he has to complete the course. Then he has to appear for the, and then online certificate will be generated. And the arrangement what we are planning is for each professional, we are making compulsory of 3 electives, any 3 of his choice. And the if he generates certificate, then we are connecting those subjects to the few of the main subjects. So in the practical of that main subject, he will get 10 marks. That is in Viva. So if Viva is of, say, for example, then he will get 10 marks. So actually his Viva will be of 40 marks, and 10 marks he will get out of the selective. That like that some arrangement we are thinking and we are planning. This is one thing. So otherwise we are not in favor of reducing our teaching time of our subject from our main course because we have a time limit for that.
Thank you, sir. Thank you for being very, very clear in that aspect. Now, I come back to you once we get in touch with the Dr. Preeti Chhabra. Let us have her opening remarks, and then we shall have further questions and answer sessions. So, may I ask Dr. Preeti Chhabra to share her experiences of dealing with the students, because she is a office bearer of NASYA, and NASYA is a student organization, and she has a lot of interactions with the students, so she knows the problems very well. So I request her to share her experiences and the lacunae that she perceives in the current education system that prevents our graduates from doing good clinical practice or being confident enough in practicing Ayurveda. Dr. Preeti Chhabra.
Thank you, sir, and thank you, CII, for giving this platform to project my views. First of all, I would like to submit here that the only constant is change. People love to change, students like to grow, because once the students enter this Ayurveda college, they don't lose their interaction with their counterparts whom they left in 10+2, who are either into a management school or into a tech institute. So once they interact with them, they feel that where they are down the line missing that tech savviness. So it's very important to induct the latest technologies into the field of Ayurveda, and diversification, I would say, is the need of the hour. And we need to induct the corporate culture and groom our young graduates to project Ayurveda in a newer high-tech frame. That is need of the hour, because we have organized many events under the banner of NASYA, and we have, observe that children or the young students, they are wanting to be technologically advanced along with studying Ayurveda, and for this not all are going to be the clinicians. They can choose between becoming an academic scholar or an academic teacher, or a clinician, or even a research associate or a researcher. So for this, the grooming or the induction of these mindsets has to come when they are in the college itself. So as Sir Dr. Jayandev Pujari rightly said, we need to have optional subjects as we have in 10+2, 4 mains and 1 other optional SUPW or whatever. So we should be having, parallelly subjects for which they can attend classes. We can take the help of the industry or the research organizations to conduct periodic sessions, workshops, or lectures in the colleges itself. And whosoever is interested in pursuing the career in their own way should be given the choices, so that they don't have the imposition to become a clinician only. Many students want to go for research. For this, I would also like to make a point that in the syllabus only, when we are teaching the students, it should be projected in such a way that all the researches till date should be incorporated in the teaching curriculum, or their links should be given to the students so as to make them easily accessible to whatever researches have been done in that particular subject, that particular field, so as to inculcate the interest right from their growing up days into the field of Ayurveda. Once they are graduated, they stand on the same crossroads where to go. So they should be able to define their career, and the opportunities should be given to them, provided to them well in advance at the school, or sorry, at the college or the institute level itself. And they should be, there should be a wide exposure to all the students about all the know-how, whatever is going on in Ayurveda. And schools and colleges and institutes can definitely come forward to collaborate with the industry, with the organizations, many reputed Vaidyas who are running their own institutes, and they can invite them to bridge the gap between the college curriculum and what is practically applicable later in life. So I think that is the need of the hour, and we should be addressing this issue very seriously, because students are very fast, they are very tech savvy, they want to explore newer horizons, they don't want to stick to the grassroots level of teaching, and they want to they actually think beyond what even we dream of.
Yeah.
So that's my submission.
Yeah, thank you. So we have got a bit two of the divergent views, I think. So we have to strike a balance between the subject that we want to teach, the core subjects, core competencies that we want our graduates to develop, and also the collateral thinking and collateral exposure to the other developing fields. So we have to strike a balance. This is what I get from two of you. So, sir, once again, I come back to Jain Dev Pujari, sir. Uh, let me have a discussion on COVID, the effect of COVID-19 on Ayurvedic education. So suddenly, overnight, the Ayurveda has become online. So the Ayurvedic teachers were never exposed to this kind of online education. And as we see, number of webinars are coming up with, of course, questionable outcomes. Every day there are number of webinars which we see. Online education does not give exposure to patients. So this is the major problem that we have. And dedicated teaching learning platforms. This is something that is a very positive development that is happening. There are a few very good dedicated teaching learning platforms, online platforms containing excellent teaching resources are being hosted by BHU. That is Ayurveda Network is being hosted from BHU. Then Jamnagar is hosting AYUSH Guru. Then Sarvepalli Radhakrishnan Rajasthan Ayurveda University is conducting online classes for everyone. So there are so many things, good things also are happening. So has CCIM assessed the performance of these online courses and these platforms? One. Second, has CCIM considered supporting or recognizing such platforms or starting its own platform? Sir.
We'll start with the first point. Your first question, you please repeat. First part of your question.
Yeah, the CCIM has it assessed or has it recognized these platforms?
Correct. We are observing, and personally myself, we are very keenly observing all these activities in this field of teaching and learning. For the two reasons. This has erupted in a very short time and abruptly, you can say. Nobody prepared for this. Nobody prepared for this platform. The team there in that university, in BHU or even in Rajasthan University, team of their team, they thought that this is the right way to run that platform. And it has come up, and the time which they spend, their experience is only 3 months or 2 months or 2.5 months. So this is very short time to assess anything or to give comment. But what I am observing is to share with you. I was thinking other way, that what is the difference or what we have lost while opting. This technology is all right, and it is good that we are the teaching is not discontinued. These are all positive points. What we have lost, what is the difference between classroom teaching and online teaching? The first difference, what I observed is the eye contact, student-teacher eye contact has been
lost.
Second, there is no student-teacher eye contact in this our online teaching. Second thing which we have lost is the teacher teaches with his own body language. So now I am seeing Kishore Patwardhan half. And when he is on the dais, he looks different. When he raises his hands or when he says something, language of Kishore Patwardhan as a teacher and a web presenter of Kishore Patwardhan, it is different. Number two. Third thing which I observed is in classroom, there are few front benchers and there are few back benchers. In this online teaching, there are no back benchers and there are no front benchers. See, what happens, this is the psychology of the student. When a student is backbencher and when becomes a successful practitioner after 20 years, he always used to say that I was a backbencher. Or in other way, that student always used to say that I used to sit in the front, this on the front bench. This we are losing. And what is the effect of this? That nobody has studied. Because the time period is very short. So we are, ये तो हमारी मजबूरी है कि हम लोगों को ये शुरू with the study or a methodical system. Now we have to observe for a few more days, and then we can find out that how to avoid the another thing I will tell that in classroom teaching, the teacher is angel on the dais. He stands on the dais. He teaches to the students and वो student का teacher को सुनो और उसको समझो. So he is angel on the dais. But in this type of online teaching, that teacher should be guide on the side. So for this, teacher has to change his mentality. See, 3 months back, he was angel on the dais, and now you are telling him, or that is the requirement of the time and the system, that he should be a guide on the side of that student. So now the change is in teaching or in teachers. So whether all teachers, they have noted this change, or whether the students, they are understanding the subject, or whether they are getting that much concentration, that atmosphere they are losing. All these things we have to study, and it will take some time. That is what my personal opinion.
Okay, thank you, sir. So my next question is to Dr. Preeti Chabra. So what measures can be taken to motivate young generation to practice, promote and propagate Ayurveda? Your thoughts, please, because you have been interacting with students.
Hello, am I audible? Yes. Am I audible?
Yeah, you are audible.
Yeah. First of all, I would like to submit here that all the students, they should be, given free hand to develop their own selves, to develop their EQs, to develop, learn and develop soft skills so that they can be master of themselves. Because most of the times what happens is when they enter to any field, be it academic, be it research, or be it, industry, they are perplexed where to go and how to go about it. So basic knowledge of the basic text and the basic Ayurvedic perspective is very important. They should be thoroughly trained for that. And beyond that, it is again very important that they should hone their skills by exposing themselves to periodic trainings and periodic learning opportunities. So to take this forward, they should be given a wide exposure again in the colleges or beyond that. Like we have in management schools, the students are really grilled to learn the abilities of management and to hone the skills of interpersonal relationships. So once they are well versed with all these techniques, which are basic human techniques, I think they can take Ayurveda to greater heights, and they can give their best possible. And this is the right way of harnessing or their potential energies, the bubbling energies which the youth has, and this can go a long way in projecting, promoting, and practicing Ayurveda. And of course, we need to incorporate all the technological advancements into the practice, which is again a very important thing, because unless and until we do that, the flavor or the taste of the Ayurveda cannot reach to rightly to the masses. So technological advancement also has to be incorporated, and because otherwise the students will feel that they are, downtrodden, or they are not coming at par with the times. So, as a renaissance age of Ayurveda, we need to incorporate everything which is technologically advanced. And if we gel and blend with these, I think Ayurveda can be projected and it can be taken heights in the present scenario.
Yeah, thanks a lot. We have with us Dr. Simone Hunziker from Swiss Ayurveda Medical Association. She is specially present for our session, so I extend her a very warm welcome. And I request her to quickly share her experiences with Ayurvedic doctors and what she feels that Ayurvedic education needs to do to improvise the standards of physicians that we produce. Dr. Simone.
Yes, thank you very much. Can you hear me?
Yeah, you're audible. Yeah.
It was very exciting to listen to you. Actually, I do really regret that I have patients before and after all through. It's just a small break. I mean, I'm very much, of course, actually we are the, SAMA is the Swiss Ayurvedic Medical Academy, not associations, academy. So all the questions about academy training didactics are at the core of our activities, and it's really interesting to listen to the previous speakers. I fully understand the debate. We are into the same reflections. Now, I'm actually as much interested in what is happening in India for the Indian students than worldwide, because somehow we are supposed to be one strong movement globally. We should, I think, not totally dissociate that. And first of all, India is the cradle of Ayurveda. This is where people have to be top trained if they want to bring Ayurveda to the world. And it's not easy when you have such a huge country, so many people, and taking into account the history. Now, how can we bring up Ayurveda, which is such a ancient system, into a world which is in such an acceleration, growing fast, and India jumping from a more or less developing country to a world leader? I mean, how can this all together happen and be integrated into core realities, daily core realities when you design syllabi or train students? I find what has been said so far really, really meaningful. So I think, yes, technology absolutely needs to be integrated in India. This is a gap. And we are now starting to train people in Switzerland and internationally, globally, with top level modern technology in most traditional, genuine Ayurveda. So, of course, India should, India should be always in front if possible. So, of course, if this can happen in India too, and the young generations, for them, this is a must. For us, it's difficult because we are from a generation for whom this is not given. So how can we bring them on the right track for something where they are more advanced than we are? But I think this is something important. And obviously, the student should have, from the beginning, a choice and an overview that you cannot only become a clinician, because we need teachers, experts, researchers. We need people in so many fields who will go into pharma, who will go into project developments in so many ways. And there are so many talents around. I think if from the beginning they understand that this is not a closed path that leads only to one possible option, which is to be in a small clinic that hardly, is surviving, but that suddenly you get connected to, I had the privilege 2 years back to interact with Tata Trusts, and we were working on a project, and I told them, look, the great thing, what we have to offer to Ayurveda now is that all the transdisciplinarity of all technologies should come to Ayurveda. And I am perhaps the most fanatic representative of most traditional, authentic, genuine Ayurveda. Our students, they learn Devanagari, they would work only with the classical texts. But at the same time, we have to, if we want this authentic knowledge to live, and to give access to this knowledge to the people, we have to integrate the other disciplines. And I think the private sector here is very important. We can see anywhere, wherever a science has succeeded and succeeded in bringing the results in the daily life of the people, make it streamlined. It was always because the various sectors were coming into an interdisciplinary game, and the private sector and the public sector have worked together. So that I think it's really, really essential. Then one other point is that obviously there's never enough time to teach students. I fully agree also that there have to be, parallel sessions. They're perhaps not compulsory. In Switzerland, what they do in universities, they create from year 3 on optional courses where they say, okay, there are 3 options and you have to choose one of the 3 or so. I don't know, probably in India it must be the same. Or then just let students who have the competence, the capacity of getting through the whole of it, access to it, but not make it compulsory for everybody. And then if you have that variety, then those students who are more interested in certain fields will go there and others somewhere else. So I think this is true, there too. So one question I have I have not been there from the beginning. One question I have to the people I heard speaking now. I have heard about a Canadian study by anthropologists, and also have observed it some way in the 10 years where I spent a lot of time, more than half of time in India, that Ayurveda students at a certain point are confused about what is actually allopathy and what is Ayurveda. They get trained in a mixity of it, which may make sense. You can say, okay, they need to learn both, obviously. But is it clear in the mind of a student who starts a curriculum, who has no clue about medicine, and who will learn physiology and anatomy on one side, and then there's also Ayurvedic physiology and anatomy, even if it's called differently. But I mean, is what belongs to what, and what is at the end the full Ayurveda system as a whole? What is its potential? What comes from Ayurveda, and where lies the power of that system? Is this clear enough in the minds of the people throughout the training programs in India, or have there been recent revisions on the programs for that?
Sure. Yeah. Thanks a lot for those comments. And maybe may I request Dev Pujari sir to respond to her anxieties.
Are correct. But before asking such questions, we must understand the local needs. Here in Ayurveda, in the field of Ayurveda, local needs are different and global needs are different. Or even the needs in public health sector are different and in private health sector are different. Point she has raised is valid, that because of mixing of allopathy and Ayurveda, there is a confusion in the mind of the students. But at the same time, you must look at the Constitution of India. As per Constitution of India, the health comes under the state government. So whatever decisions are taken by regarding public health, they are applicable to us also. But as you know, CCIM is a central body, and it is a regulatory body, and whatever we decide is applicable to all states. So in this condition, many times what happens, that what is decided by CCIM is not fully applicable to the local need of a particular state because they have different type of regulation. type of need. So because of this, it is very difficult even for the CCIM to balance the things. Like for example, say in Kerala, there is no need of teaching any allopathy or any advances in modern medicine to it is not required for a person who is practicing in Kerala, because in Kerala they have a different system. In public health there is for Ayurveda, and there is a parallel system for allopathy. Same is the case with Rajasthan. That employability of the government sector for Ayurveda practitioner, Ayurveda graduate is so high that everybody, as soon as he gets graduate, he gets a job. There is no much problem. And that's why you will observe that there are no very good private practitioners in Rajasthan. They are very few. Exactly opposite is the case in Maharashtra. The employability for Ayurveda is very less. There are very few, 25% of the total this public health posts are for Ayurveda, which are not even filled 25%. And they are asked to work like an allopathy doctor because that is the requirement of the state government there. So there you will find a number of Shuddha Ayurveda practitioners all over Maharashtra. This is the reflection of these systems. That is what exactly I want to convey to you. So,
Yeah, thank you, sir. Thank you.
so
Actually,
before
this
commenting in, we have to understand the local need also.
Absolutely.
That is.
So National Commission on in ISM also has laid a lot of emphasis on state autonomy. This is what I understand. So that is how I think in future we are going to have the differences in the kind of education that we give in different states. Possibly that is how I visualize. I think this is what Jayant sir is also
It will
emphasizing.
because the council is central council. It cannot prepare different regulations for different states. Regulation will be one.
But states will have their own autonomy to a certain extent to modulate
No.
and as per their needs.
No. As per their need in public health.
In public health, right? Okay.
In public health, not in education.
Not in education. Okay, right. So I was going through the national new education policy, National Education Policy 2020 document, where it has been clearly said that students will be assessed at regular intervals on well-defined parameters, primarily required for working in primary healthcare and secondary hospitals. So now the aim of producing Ayurvedic graduates has become very clarified, I think, in this document. And it further goes on to say that given that people exercise pluralistic choices in healthcare, our healthcare education system must be integrative, meaning thereby that all students of allopathic medical education must have a basic understanding of AYUSH and vice versa. So this is the paragraph that I'm reading from this new education policy. So how does CCIM envision to implement this? So will we see Ayurvedic teachers teaching MBBS students and medical college professors teaching Ayurvedic students in near future, sir?
First, try to understand that what you have written. Please read the preamble of the National Education Policy. It is very clearly mentioned that this policy is not applicable to law and medicine. That you must have heard. It is not at all applicable to law and medicine. So, in a way, means legally, CCIM and MCI, they have nothing to do with this education policy. But yes, whatever is written, we are trying to the extent which is possible. For example, like this integration, they have written so many things, but the definition of integration is not written. See, for few people means not for majority of the graduates in Ayurveda graduates or ISM graduates in India, they have integration means becoming BAMS and practicing allopathy. That is their definition.
Absolutely.
So means they would have clarified this integration, that what is integration, whether it is a knowledge integration or practice integration. That differentiation they have not mentioned. For me, these lines are related to knowledge, not for practice.
For practice, right.
Okay, but it is not mentioned. Right. It is not where it is mentioned. This is my understanding. Some other person, he may have some different understanding. So that is the problem with this national education policy.
Right. I think we are nearing to our time limit. I think we are, yeah, 5:10 is the last, the deadline for us. So we need to conclude this session. Maybe, yeah.
Dr. Kishore, I had one question.
Yes,
Since you have a couple of minutes,
yeah.
Thank you very much for a very stimulating session to all the esteemed speakers on the panel. Professor Dev Pujari, I had one question for you. In terms of attracting the right talent to the sector, because as you know, in many parts, people come to Ayurveda because they want to practice allopathy. So to bring in the dignity and the professional future to build a picture, do you think that the CCIM can actually showcase very successful Shuddha Ayurveda Chikitsaks and successful careers? Because I think we need to ensure between MBBS and Ayurveda, people should come to Ayurveda as first choice. The percentage of people coming is first choice, at least 70-30. If we can, what would you say, sir?
Sir, for your kind information, what your presumption, that is statement number 1, I don't agree with that, because we have conducted a survey of students last year, and nearly 2,000 students, they have participated in that survey, and they didn't came to Ayurveda. That is what they are writing. Majority of them, they are writing that they are coming to Ayurveda. It is written by them, number 1. The question, because there are 51 questions, it is that data is under analysis, because it is basically a sociological survey, and we asked many questions to them. I will give you an example with the permission of Kishore, because he is moderator, he has to see the time.
Please.
20% of the students, they took education loan to come over here. Typical meaning, 40% of the parents, they are from business class. See, try to understand. There are very few from the medical field. Third thing is, we asked a question to them whether, if hypothetically, if they get admission this year to MBBS, whether they will go or not. Majority of them, they said that no, we don't want to go to MBBS. That is the from the student. Whenever it will come, you will be surprised. And all our notions that they don't get admission in allopathy, that's why they are coming. All these things are wrong. All these our previous notions of our generation, the answers are so different that it is very difficult.
So, Dr. Dev Pujari, I hope we'll also get to know what has made the change in their minds. If we can, the study would be very interesting, certainly. Is it because it's a shortcut to go and practice allopathy?
No, it is not. They are not ready to go for a practice in allopathy. Okay. That is their answer.
Because earlier today, Dr. Dev Pujari, we had the Delhi Health Minister speaking, and one of the key feedbacks he gave, incidentally, was the fact that most of the people that he comes across in Ayurveda, they are trying to practice allopathy. They don't want to practice Ayurveda. So
he has not interacted with the students. He is interacting with the practitioner. That is the difference. Try to understand.
So I think your study will be very important. Your study will be very useful.
Yes,
so
yes.
Some positive changes are happening. We are glad to.
Yes. People are thinking differently. What we are thinking, they don't agree with that.
Sir, I would like to add on here. There is a sea change in the mindset of students these days. As Dr. Dev Pujari rightly said, the mindset is all changed. Students are taking admission to BMS course by choice and not by chance. And they're very, very confident to practice Ayurveda. If we see the scenario today in the COVID times, each one of us is having Ayush Kada, whether even the modern practitioners might be having those, whether they agree to this or not. Ayurveda is enjoying a good fanfare these days, and all the children taking admission, I think 80% of them are coming by choice. They are opting for Ayurveda, and because they want to study Ayurveda, They want to know the depth and they want to know the crux of the system. So times have changed and they are still changing. As I quoted earlier also, change is the only thing that is constant, and we have to live life with changes. That is the right way of doing it, because there is survival of the fittest, and the fittest is Ayurveda.
Wonderful to know, Dr. Preeti. We have a couple of minutes, I think, till Dr. Rajesh Kutecha, Vaidya Kutecha joins us back. So, Kishorji, Dr. Kishore, if I can, since there are no other questions, can I ask it? I think there is some chat question has come. Okay. Could I ask one more question of the panelists here? That if you look at the continuing education of doctors, right, specialized courses like a DNB in Ayurveda or certificate courses in specialized skills, etc., so that you get specialty doctors, right, who can go and run a purely, Marma Chikitsa. Apart from PG, I'm telling, some BMS doctor with 10 years experience going and doing a DNB. Are such things on the roadmap of CCI?
The discussions are going on, but there are few hurdles because we are following the MCI structure, which is already there. That after MBBS, you have to go to MD, and if you don't get admission, then that fellow is going to DNB. Okay, so here in that RAV is there, Rashtriya Ayurveda Vidyapit. They are staying with the gurus, and they are getting scholarship from government of India.
But the scheme is not there
they are
right
getting
now,
special
right?
training.
But it is not
It
currently.
is there. No, it is currently. I am guru. I have 2 students. I am RAV guru. The things are, everything is going. Another thing which is happening in our Ayurveda sector is we have very big network of informal education. See, each and every Ayurveda practitioner, he is having 2, 3, 4, 5, 6 students. Another thing is these Ayurveda organizations, they are like Ayurveda Vyaspeeth, for example, in Maharashtra. They are conducting every week, they are having that Samhita Adhyayan program at many places, means even in Taluka places. I am not talking about the big cities like Pune and Mumbai and Aurangabad and Nagpur, no. Even in Taluka places, they are. So this network, we are actually ignoring this network because they are like Vyaspeeth or like this many webinars, and even now they are visible, and they are coming with a very, very small number, a very small number. 200, 250 people, they are coming together and they are running a program. Like in Pune, our Vaidya Dilip Gadge, he is running so many things. Gigi Gangadharan in Bengaluru, he is teaching to few of his students regarding this Samhita Adhyayan and all. Like this is going on everywhere and at a grassroots level. So we must note and we must find out the effect of that. That is what my personal opinion.
I think a lot more awareness creation is required, I think, because this is a very important sector. Without the right people, sector cannot grow. So Dev Pujari ji, it's a very, Dr. Dev Pujari, it's a very encouraging feedback from your end. Just one more point on paramedical staff. What is your vision? Are you looking at that, or that doesn't come under your purview?
That first under my purview, but the thing is, see, I will give you another example. This is all very structured education. When it was Gurukul system, then also these paramedical things were there. Even in Charaka, Vishak Dravya Upasthata, Yogi Padika Pushpan, Paricharak was there at that time also. So, what was the training module for Paricharak? So, like this ayas, some 50 years ago, there were ayas to conduct the deliveries. So, these systems were governed by the society, not by the government. And now we are trying to control it with the government regulations, like we did with the doctors or physicians. So now this paramedical staff is in between. Because a person who is trained in my Panchakarma clinic, for me, he is a very good massagist. Or he can do all that. He assists me because he is well trained. My clinic, they are well trained for me, but they are not formally educated. So when it comes to a formal education, we have to create a structure which is not there.
Yeah, Dr. Devpujari, I think unless we bring in a very formal skills, national occupation standards for different categories of Ayurveda therapists. In fact, the use of the word massage makes me feel very sad and bad, because this is a medical system. We need to really present as a very serious medical, either as a nurse or a therapist, but to bring in national occupational standards, because even there we're running short of quality manpower. So we need to ensure that, because if the sector has to scale up, from an industry angle, I'm just mentioning, we need to ensure that very structured training programs for paramedical staff, also for different parts, whether Ayurveda, pharma industry, everywhere we need to come. I agree it's not part of your purview, but I just wanted to say that very, very critical that we bring in very structured programs for paramedical staff also.
Just to add on, sir.
Yes, Dr. Preeti.
Yes, it's not only the Panchkaram therapists, assistants, or the technicians. We do need, nursing people and pharmacists, and above all, the counselors. Like now, each of the biggest hospitals in the government sector, they are having the AYUSH unit.
Okay.
So it's very, very important. Like if a patient wants to undergo a Panchakarma treatment,
yes,
the assistant of the doctor or the doctor himself or herself has to, tell each and everything about the Panchakarma procedure to the patient. So
Yes.
we need to groom and we need to develop counselors also who can explain the very basic of the Ayurveda therapy and treatment to the patient. As a clinician, I think this is a big void in our system, and all these four, paramedics, be it technicians, the pharmacists, the nursing staff, and the counselor, these are an important part. If you rightly said, if we want to scale up the system, we need to have all these pillars by our side.
Okay, thank you, Dr. Preeti. Dr. Kishore, I think Dr. Kotecha has just joined us. It will be great if you, on behalf of the PAN, can submit your core recommendations, what are required for education. You could give the thanks, and then you could go to the next session. Go ahead, Dr. Kishore. Yeah.
Yeah, I thank the panelists for giving their time and having deliberated on so many core issues. We had a wonderful debate, and I thank Dr. Rajiv Vasudevanji for giving me this opportunity to have this. And the major things that were discussed was whether the core competencies are sufficient, or has there to be something else that has to be added in formal Ayurvedic education. So if yes, what is that, and how that has to be done. So we need to strike a balance between core competencies in Ayurveda, clinical skills, and also the lateral skills like maybe IT education, or maybe management, or maybe some other, maybe there are several fields that could be made a part of formal Ayurveda education. This is one point that was discussed, and transdisciplinarity was something that was emphasized by even Dr. Simone Hunziker and also Dr. Preeti. And Dr. Jandev Pujariji highlighted the need for he emphasized on the training in core competencies, especially in practice and Ayurvedic education in its original form. And so this is how we discussed, and we will get back to you, sir, and also with Dr. Preeti and other panelists, and we will finalize the recommendations, and we will get back to you. Thanks a lot.
Thank you very much.
Namaste.
Namaste. Thank you, Dr. Devpujari, Dr. Preeti. Dr. Kishore, thank you very much.
Thank you.
So with this, we go to the concluding session of today's very packed day. I have the pleasure, I would like to welcome Padma Shri Vaidya Rajesh Kotecha ji to the program. I presume he's already here. And and Dr. Simon, thank you for coming back in the evening once again. Yes, namaste, Dr. Kotecha ji. Yeah. So what I'll do is, we have had a packed day. A lot of recommendations are there, but I'm going to present one thing first, if we can. Okay, it's just coming up. So, Vaidya Kotecha, before beginning on the recommendations quickly, I just wanted to tell that as part of our, every year we've been submitting a very systematic report, and the Ministry of Ayush has also been involved in the, hello. Dr. Kishore, can you mute your phone, please? Dr. Kishore, can you mute your phone, please? Yeah. So, can everybody see the presentation? I just want to be sure that you can see the PowerPoint.
No, it is not visible.
It is not visible. Okay. Share my, okay. Just give me a second then. Okay. Is this better?
Yes.
Okay.
Now it is visible.
Okay. So, yeah. So, Vaidya Kotecha, what we have tried to do is that this time, we thought that in the context of the COVID pandemic, to look at what has been the impact of COVID on different subsegments of the Ayurveda sector, and to quantify both the government efforts, the private sector efforts, the impact, etc. So with this, we were looking at in the next 2.5 months to develop a proper report and submit to the government from industry as a joint report, but we would have ICRIER, who had done the previous 2 reports. We had done one report, which was the Vision 2022 document, and which was a path-breaking report. And then last year, we did submit the Ayurveda industry sizing report. What is the size of the Ayurveda industry? Again, a first time that a very formal study was done. This is the 3rd such report that we are envisaging. What we're trying to look at is what has been the developments pre-COVID, April 2019 to March 2020, then from March till August, to see what is the impact on sector growth, employment, investment, exports, etc. To look at hard data. Look at the impact of COVID across Ayurveda products, wellness, hospitals. In products, to look at pharma, OTC, foods, and whatever data we can collect, how to look at, there are some subsegments which have grown, some have shrunk. Try to figure out what really has happened by collecting the data from different stakeholders. What is the impact on human resources? Maybe there is no big impact, but there is some impact in terms of employment generation. What are the future growth projections? Are there any impact of the global travel, medical value tourism, drug trials? Is there any impact? And is there any change from companies to reorient their products and services in the light of the pandemic? As we could see even the previous multiple sessions, everybody was very optimistic that Ayurveda has really become part of public discourse. People are more aware and willing to take it, including allopathy doctors. Look at how China used traditional medicine. Is there any impact in terms of economics, in terms of public awareness, in terms of integration? And to look at a list of all the initiatives and policies that have been taken by central and state governments and union territories, pre and post, in the last 1 year, to as a calendar. Today morning, we had a very good calendar of events, which was described by your senior colleague. But to look at it across the country, all the states and the central government, and to develop an action plan in the context of the feedback based on industry feedback and other stakeholder feedback on an action plan. With this TOR, we are going to collect the principal researcher, Dr. Arpita Mukherjee, who is a professor at ICRIER, has suggested that both on secondary data and primary data collection, we would look at doing a fairly systematic data collection from across industry associations and companies. So, Dr. Kotecha, any comments at this point on this thing? Of course, we would send the detailed, note to the ministry for your feedback and suggestions. But we just wanted to share with you before we get into the recommendations of today that CII would like to carry out a 3rd report of this nature.
Actually, this is a good proposition.
Yes,
we need to examine in a collective manner. I should not find this as an individual, but in ministry we definitely would like to examine and then get back. But primarily, this is a very good idea.
Yes,
Rajiv ji.
Okay. So what I will do is I will thank you. Now we'll go to the main part of what we had to do today. And as we begin, Vaidya Kotecha ji, I didn't go into the formality, but I truly appreciate on behalf of industry, on everybody's behalf here, it shows the seriousness, the sincerity of the intent of the ministry led by you, sir, because you've spent time to listen to us and very thankful for that. With that, let me get into sharing this document, which summarizes from the morning what we have been doing. Okay, I think I have to do some. I'm also learning this platform for the first time. Pardon me for a second. I am going to my screen. Yeah. Are you able to see the screen now? Yeah. So what it's a fairly long document. We'll be sharing this document in full. So what we wanted to tell here basically is that the observations that came from this was the first speaker of the day, Dr. Simon Hunziker from Swiss Ayurveda Medical Association. The fact that a well-planned regulated framework is mandatory for Ayurveda to go to a foreign country. If you allow it to go loose without regulation, it would grow, and it has been positioned as a curative medicine. And Switzerland offers us a very good template for how to take Ayurveda to developed countries. And Switzerland could be gateway to rest of Europe. This was the basic primary observation she made. And in this context, what she requested in terms of support was specifically an intergovernment dialogue beyond what they can do in Switzerland, the Ministry of AYUSH and Ministry of Commerce, Government of India, Ministry of External Affairs, how we can push the intergovernment dialogue with Swiss government with participation of industry associations and to mainstream Ayurveda, to look at the issues and remove the bottlenecks so that Ayurveda can be mainstream. To nominate an appropriately competent senior advisor who's there on a permanent basis, because if we take Switzerland as a breakthrough into Western Europe, this investment would be well worth it. So it is a very strategic suggestion which has come because we have multiple things happening. She also talked about the fact 400 medicines have been approved or nearing approval in the Swiss Parliament, or the Swiss regulatory authority. So that really gives a very good positive note. So these are the two specific requirements. Dr. Naresh Trehan, chairman of the CII Healthcare Council in CMD Medanta, had a very simple point leading to what he said is we need to go beyond separate silos, combine the power of two systems and go from a Ayurveda as complementary system to a convergence, coming together and completely fusing into an Ayurveda, he termed it that way. But potentially talking about how the public at large can benefit, where depending on the Rogi Roga Avastha, some conditions are managed in Ayurveda, some are managed in allopathy, but bringing in the best of both worlds. And he has assured his total support to the cause. The support he required was, he requested Ministry of AYUSH to take the lead with total focus on appropriate integration on highest priority. And Vaidya Kotecha, you also did tell that there are specific initiatives in this regard which are underway, right? So this is there. Then there were sessions from the Ministry of, from Department of AYUSH from Gujarat and Orissa. They were, of course, recounting what exactly they did in the state. There was no request for support. We also had Additional Secretary Shri Pathak talking about the timeline, the activities, etc. I've not summarized it here. And your address, which was very comprehensive. Now, Srimati Shailaja, teacher from Kerala, she made various observations. You'll be, it is very positive to note that with respect to Ayurveda, she came completely prepared to tell how the government of Kerala has done a very steady job in doing what is required. But she had two specific points of support that she asked. She said that to build research and documentation, the government of Kerala wants to do things, but they need very directed support from central government to ensure that for major NCDs and other diseases, including COVID, etc., how we can build thorough evidence. The floods last year, when it happened, there was an attempt to document, but that has not translated into robust evidence. So she would like to request your support in this regard. If government of India approves Ayurveda for COVID care, for COVID positive patients, then she will have no objection to including it in Kerala. So I think this was a comment that we did ask her specifically. It's there for prevention, mitigation, rehabilitation, how to take it also for treatment of COVID patients. So this was the specific point she told. They've opened up an Ayurveda Research Institute in North Kerala. And I think government of India has funded it to a great extent. but the overall support for research and development is something that we're looking at. The session with Dr. Satyendra Jain, which was moderated by Dr. Pratap Chauhan, was again a very, very interesting eye-opener. And first of all, the Delhi Health Minister was very forthright in making several announcements in response to Dr. Chauhan's specific request. So he responded by telling 100 Mohalla clinics under the Delhi state government would start offering Ayurveda and homeopathy in the near future. He said basic work is already underway. He did comment that the COVID activity and what the Ministry of AYUSH has done and what the Ministry of the Government of Delhi has done has led to a large number of Delhi people, citizens being very positive about Ayurveda. There's a very positive impression. People are all taking Kada, and it was a brainwave to simplify it, come with one uniform intervention which has gone across the public. Similar to COVID-19, he has agreed that for ensuing dengue, chikungunya, asthma, bronchial allergies, all such annual recurrent diseases for prevention and treatment, they would be happy to collaborate with the Ministry of AYUSH to look at similar initiatives so that the good progress that has been made with COVID-19 does not stop there. They will continue beyond. Tibia Ayurveda Campus and the Brahma Prakash College, both these centers he committed would be upgraded as world-class centers of excellence for Ayurveda education and treatment. The proposal is very much on their mind, and they are seriously looking at the heart of Delhi with Tibia to build a center of excellence. They would also update the existing Ayurveda hospitals, infrastructure, and upgrade research facilities. This was a commitment. He's also agreed to work with industry in public health for disease prevention, etc. The one specific support that came up, and Dr. Jain Dev Pujari is also here to listen to us. He said that the poor people of Delhi, when you go to the Mohalla clinics, they're typically looking for a fast-acting injection. So there is a lot of awareness to be built at the very poor people level, bottom of the pyramid, on what Ayurveda can actually do in prevention and cure and rehabilitation. So Ministry of AYUSH should come forward proactively to build correct awareness about Ayurveda in Delhi NCR. That was a requirement. The Ayurveda doctors prescribing allopathy in the Delhi NCR region is a bad providing this thing. So there should be an encouragement to doctors to not do the mixopathy, etc. This was the two support points he told. Pharma product session where we had Dr. Kuteja, should we pause in between, or shall I complete everything and then I'll quickly go through all the points?
Please complete.
Yes.
Please.
Okay. So the pharma products is a session which again had people from all over India who are represented here, the east and west and west and south and north. If you look at the support required here, basically there is a very systematic study to be done between demand and supply of different medicinal plants, particularly for rare, endangered, and threatened classification medicines. I know it is not an old point. It's not a new point. It's there for a long time, but it should be considered as commodities. Commercial easement in the regulatory framework should be done. There is a recommendation that it should be brought similar to the agriculture sector, not keep it as some cash crop. It should be brought in as a basic requirement of the country. So that point is not included in my document here, but I'll just add here that accord status similar to agriculture for medicinal plants is one of the points which came, right? So this is a very key requirement. The other part which came is a startup champion fund for Ayurveda research. It cannot be a small fund. This was emphatic to look at 5 to 8 diseases, 500 crores. I think this has been on the mind of the AYUSH ministry as well. So it is just it's just reiterating the fact that industry also feels that we need to create a very focused research fund which will build world-class evidence, because only then the world will stop talking, where is your evidence, where is your evidence? We can really build solid world-class evidence, keeping in line with our Ayurveda principles. At Ayurveda clinics, now this is a new fact that at clinic level, standardized protocols for Shamana Chikitsa could be done so that it's not complicated, so that all the doctors would typically be following certain standardized protocols. This is required from the government, and awareness building, proper awareness building amongst the public on efficacy, safety of Ayurveda medicines. Very focused for recommendations. Hospitals, there is a long list of recommendations, but the observations is that unless you build a Chikitsa foundation of authentic Chikitsa, the rest of the subsectors cannot grow. So the Chikitsa platform underlying is the one on which products, wellness, human resources, everything will come based on that sound foundation. So if you're looking at the core vision of an accelerated building of a high growth, credible, and high value Ayurveda sector, right? It is not very low value, high value thing. Chikitsa should be a mantra. And so we need more hospitals, we need small, big hospitals to come up. And one key comment which came from Germany, Dr. Anand, who was here from Germany, he made a very pointed reference to a study that they carried out on osteoarthritis of the knees, which was high quality Ayurveda research, clinical research done in Germany. And it is a model for, and another speaker in the wellness session also said, when you do research in India, the European countries, many of them don't fully accept it. So if you're able to fund some specific research studies in overseas universities in a very focused way, clinical research, that will help to build credibility. So from a support angle, what the hospital sector has asked Vaidyakuti ji is enable payer support. Now, medical insurance, we'll send a note on this separately, detailed note. There is a preferred provider network in medical insurance. Although some rates have been finalized, the fact of the matter is cashless is not available to most hospitals. So in the top 10 cities, we need to bring in a preferred provider network rates, which has to be discussed with the GIC, General Insurance Council, which is based in Delhi, and get them to finalize the rates. With that, 70% of the insurance market will also give cashless treatment to Ayurveda hospitals. That's a very important enabler. CGHS, we need to make room rates in Ayurveda and allopathy comparable for same city, same room category. The reason is, even today, it is a very bad injustice to Ayurveda. 2008 room rates are being given to Ayurveda hospital in the same city, where allopathy has had 2 revisions in the same time period. State government, like CGHS employees can come to Ayurveda treatment. State government employees are not able to come for Ayurveda treatment today, uniformly. So we need to work with all the favorable state governments and try to push for state government employees, because what I would urge is, if demand is created, the sector will automatically grow. That is the whole mantra, that good talent will come, medicines will come, quality will come, hospitals will come, wellness will come. The last point, last 2 points, ECHS, the defense ECHS, I think you made the first move. If CGHS is allowed, I think we should tell that the civilians, the armed forces and their families in non-war times should be entitled to go for Ayurveda care for all the same conditions which CGHS is covering today. So we need to get ECHS to follow CGHS empanelment. And we are hopeful that with your push in Ayushman Bharat PMJ, Ayurveda will be soon included, sooner than later. If all of this happens, the demand will grow. If the demand comes, how will the supply come? We need soft loans for 5 years to every entrepreneur so that doctors can go and set up hospitals. They pass out with MD, BMS, they're confident, they want to be clinicians and set up hospitals. Then through banks or through a separate seed fund under championship sector or otherwise, to set up by Ministry of AYUSH, where I'm giving a kind of suggestion, we thought about it, the group, that 8 lakhs per bed in a tier 1 city, 5 lakhs per bed in a tier 2 city, through a project evaluation process with some type of soft loan and relaxed securitization. So as the government of India has done during COVID times to give the guarantee to banks, it could be some form in which credit is eased to industry. Funding for industry to set up hospitals overseas. See, if we have to think time to now, 2020, to think big and to say, we want to set up a 50-bed hospital in UAE or in the US or in Germany with a partner there, right? Can Indian hospital partner with somebody there to set up a hospital there, also to give regulatory support? So hospital sector feels that the time is right to think about it. A specific requirement to separate, like there is a medical visa, but to create an Ayurveda visa, because there are so many people coming for medical treatment, that will also allow the ministry to know how many people are coming specifically for Ayurveda medical care. And that will become a separate subsector and a hugely valuable, because we believe people from OECD countries, the developed countries, will come to India for Ayurveda medical care, and not only for Because mostly for other medical value travel, people are coming from third world countries, less developed countries. The well-off countries will come to Ayurveda, to India only for Ayurveda. That's the thing. We need to promote Ayurveda medical value travel. So beyond the conventional channels, we need to go to the, like Naturopathy sector has done, we need to get Ayurveda medical value travel events to be sponsored. Ministry of Commerce has got a framework. If together CII can work together with the ministry in doing this, we have put this, has already come in the previous point, globally valid evidence. So one thing we could do is all the Ayurveda hospitals in the country, Vaidyakutecha, if we take 2 diseases and say that we'll follow uniform protocol across 15 hospitals, we'll have 1,000 patients in 6 months or 1,000 patients for a particular condition, as per a common protocol, common outcomes, etc. So it could be a very focused thing. Within 1 year, with minimal costs, we could build across all our Ayurveda facilities who are willing to follow a uniform protocol to build valid evidence. We need to, I don't need to emphasize this, enhance quality of talent. Dr. Dev Pujariji was very, very positive in his earlier session on talking about the quality of talent and the willingness to really practice pure Ayurveda. So he said a new survey is happening. We'll be keenly awaiting this. We need to attract good quality staff, human resources to Ayurveda. So we are talking about DNB like courses. He said all these points are being considered by the CCIM in consultation with the Ministry of AYUSH. The wellness session talked about a very important point. When you look at high value, all the speakers said, including the overseas speaker, Ms. Claudia Wagner from Germany, the other esteemed wellness players from the country, all of them said, we can see that old wellness, casual rejuvenation tourism is now transitioning to medical care tourism. So that part with immunity building, disease reversal, etc., the high value Ayurveda tourism, many of these resorts can upgrade to high end. Some of them are already that they can upgrade to high end Ayurveda hospitals for foreigners who are willing to pay good and will earn foreign exchange for the country. In the short term, however, because of COVID, there will be a shift from international guests to domestic guests. We should retain the Ayurveda intellectual property that comes through in other sessions also. Otherwise, people will dilute it and we have to own Ayurveda. Otherwise, Sri Lanka will take it, Maldives will take it. We need to say that Ayurveda is a sampati of this country. And of course, it's a science for the world, focusing on high quality research papers, etc. So they've also talked about Ayurveda visa for wellness, those who are coming for serious medical care, need for research in European countries, an interim financial relief package for AYUSH facilities in the wellness sector to tide over the zero revenue phase, whether the state government or the central government can do something because there is a complete shutdown of traffic. And there should be a major PR campaign on the benefits of Ayurveda, yoga, and naturopathy in enhancing immunity and the overall holistic approach. So I think correct awareness is being spoken of in India and overseas. And the startup and enabling ecosystem, there were 4 key points that they came up with. We had 3 entrepreneurs in this group, leading entrepreneurs who are there, who have started up and grown. It's focused more on products. However, they talked about creating a national network of Ayurveda startups. I think CII can also help in work with Ministry of AYUSH in doing this so that the entrepreneurship spirit can be further built. There are many, many more Ayurveda entrepreneurs. Because of time scarcity, we could not bring them into this program, but we are looking at a calendar of events which we can do. They would like also to look at to export Ayurveda products, standard formularies, and and then getting it approved overseas. But protect Ayurveda IP, they also come to. I think the first point is a key point, is a concrete point, which will cover the national network. The education part, we would be sending you separately in terms of what kind of support is required from the industry and education aspect. So this is the brief summary, Vaidyakutecha. Now your feedback will be much appreciated.
Thank you, Rajivji, and all participants.
Yes, please.
See that the chairman of the Board of Governors, Sri Vaidya Dev Pujari ji is here, Kishore Patwardhan ji is here, Priti ji is also here. Dr. Zikar, I must compliment her because she's here since the morning.
Yes.
And all dignitaries, all participants. Actually, this is a very robust exercise. I would call it like a marathon, in the morning. And the recommendations came out very robust, and they are very precise, very crisp, and it help us also. Actually, it will help us to visualize our future strategy. So let me compliment and thank the CII team, headed by Rajiv ji and Dr. Trehan. It is very, very, very precise, very focused. So this is one thing. Couple of observations I want to mention, because a lot of things are happening, and I think I should let the audience know. For example, the Health Minister of Kerala, Honorable Shailaja ji, mentioned that if Government of India declares the Ayurveda treatment for COVID care, we will incorporate. There is a little communication gap. Already we have Government of India have issued the guidelines for practitioners, AYUSH practitioners for the COVID patients. So it is already approved. So there is no need of approval. In the morning, I mentioned about bringing in with the protocol into national protocol of COVID care. So it do not mean that AYUSH practitioners cannot treat COVID patients. So this guidelines is already available on the Ministry of AYUSH website, and it is very, very specific to different clinical conditions, asymptomatic, mild to moderate, and we have mentioned that some patients is more than moderate, they should be referred to the critical care hospital of COVID. So this is one very specific thing that everybody should know, that Ayurveda practitioners are legally and formally allowed to treat COVID patients, or AYUSH, all AYUSH practitioners. So there should not be any confusion about that. Yes, please.
Because she referred to the fact that ICMR approval is not there. So I think if a clarificatory press release is issued by the Ministry of AYUSH, telling it's very clear we can treat completely, that would be helpful.
And I have suggested actually to Health Secretary the day before yesterday only, that there is a joint letter between with the signature of Secretary AYUSH and Secretary Health about this certification. So it is with them for the necessary thing, and I hope that it will be coming in next week. So this clarification is already pending, but I would clarify that there is no need of any legal. And based on that only, in Delhi, this COVID care center of Holy Institute of Ayurveda, the Tibia Hospital or Chaudhary Brahma Prakash, they are all treating COVID patients standalone Ayurveda.
Yes.
The Ayurveda College, Chandigarh also, they are treating standalone Ayurveda. So there is no legal hurdles. It depends upon the state concerned. In Rajkot yesterday, the Chief Minister Vijay G. Rupani, he has inaugurated a standalone Ayurveda facility in Rajkot. So there is no legal hurdle. It depends upon the state concerned. So state has to desire to start this. There is no need of any clarification from Government of India. So that, but still we will issue.
I think so. Yeah. Thank you.
Another thing I want to clarify about mixopathy, as observed by Honorable Minister of Health, Delhi government. Actually, on any Ayurveda platform, wherever I go, I always hear this. The participant who is outside of Ayurveda domain, whoever he or she may be, they always make these observations. So I want to cite one interesting example that when I was in Jaipur and was doing my practice in Jaipur so many years back, I think it is a small, I did a small survey of the prescriptions of allopathic hospital like Medical College, SMS Medical College Hospital, with the help of National Medicos Organization and Arogya Bharati. And we did, just simple survey of the OPD prescriptions of the Medical College OPD, which is at that time it was like some 5,000 plus OPD a day. And we found that 31% of those prescriptions did carry an Ayurvedic drug into their prescription. So nobody asked them this question, that you people are prescribing Ayurvedic medicine, and nobody is asking them, because it is deemed, it is considered that they are all allowed to do anything, whatever they want. But an Ayurvedic practitioner cannot do anything. And I strongly support Shuddha Chikitsa. So I'm not arguing that no, Ayurveda practitioners should be allowed allopathic practice. That is not the version. I'm just trying to clarify that this popular belief should be eliminated from the mindset of the at least public servants and at least the leaders, political leaders, because it is damaging. It is damaging for the morale of the people who is actually working like a warrior into this sector. Like I know Dr. Priti Chavda, she's here. She's like a warrior, and she is a Shuddha Ayurveda practitioner, very eminent practitioner. And such kind of great practitioners get demoralized when they hear in every platform they hear that you people are doing mixopathy, and then it is a demoralizing statement. So I want to put my protest in for that kind of statement here. And of course, that there are some practitioners who are doing mixopathy, which we do not acknowledge, we do not approve. And we actually, with the help of CCIM, we are trying to improve the quality of education so that the new generation people who is coming out from the universities and colleges as a human resource product of AYUSH sector, they should be confident enough to do the Shuddha Chikitsa. And it is happening, it is happening. I was Vice Chancellor of Gujarat Ayurveda University in Jamnagar, and then I have seen from my eyes that university was, taken into like one of the top 10, one among the top 10 medical university of the country in a very short span of 3 years. So it is possible, and then the products of that university, most of them, they do Ayurvedic practice. So it depends upon the quality of education. It's not a problem of education and problem of quality providers that we are addressing, and we are conscious about that. This observation of Charity University of osteoarthritis study, I want to let you know that we have government of India have initiated. It's approved by group of secretaries. We have group of secretaries of different sectors. So social group of secretaries, we have decided together what is the next 5 years plan. So we have committed to launch this Chalo Bharat Abhiyan. It is like Chalo Bharat Abhiyan is like a simple management for Ayurveda and Yoga or intervention for osteoarthritis, and to prevent people opt for the replacement of the knee. It is already approved, and then we are introducing this Chalo Bharat Abhiyan initially into the Ayushman Bharat, these health and wellness centers. So
Excellent.
it is. Another thing is happening is that I should let you know that we are also initiating Rashtriya Prakriti Pariksha Karyakram. So we want to integrate into National Digital Health Mission. I already spoke with National Health Authority CEO, and they will be happy. They said it is really good to have such kind of input. So when the National Health Authority launches this National Digital Health Mission, the Prakriti Pariksha will be the the part of probably it is still in pipeline, so I should not say it will happen, but it is possible that for every person's digital health card, the Prakriti we will also be incorporated. We will definitely work for that. I want to share an interesting news about the international collaborations and research. That yesterday only we have agreed with the Brazil and South Africa. So it's the BRICS, on the BRICS platform. BRICS platform, there is a science and technology initiative. It's an agreement between BRICS that 3 of the 5 countries agrees on certain scientific proposals. Then in science and technology division of BRICS secretariat approves such proposals. So we have submitted yesterday only this proposal from Brazil, from India, and from South Africa about initiating the research on Ayurvedic candidates for COVID research. So it is happening. Another example I want to mention is that 2 institutions of UK working with NHS, National Health, and this
National Health Service. Yeah, NHS.
Yes, NHS. So NHS supported 2 universities. We are initiating study of research on COVID-19. So COVID-19 research is happening not only in India, but it will be the same protocol and same kind of vigor. It will happen into other parts of the world also. Of course, we are looking for the opportunity of converting this research initiative and generation of evidence into commerce. And this we call it, of course, this is a pandemic, is a crisis, but crisis, as our Honorable Prime Minister says, that we should learn and understand how to convert the crisis into opportunity. So we are trying to convert this into a future opportunity, because there is a some kind of opportunity available because of the vacuum, because of the people do not like products from China now. It is not only in India but all over the world. So we want to put this, fill in the blank. Our products should be branded, should be robustly, evidence generated, and then we should put some of the products into world market and to make some billion-dollar business about that. So that is also one of the, kind of a long-term vision that will happen because of all these activities. I definitely agree with all most of these suggestions. We'll work on it. For example, you have mentioned Startup Champion Fund of 500 crores. Actually, in Champions in Service Sector scheme, there is a soft loan available for the industry. Whoever wants to start their own center, even if it is a daycare center, even if there is no indoor hospital, it is covered. So from daycare to 100 bed, whichever kind of infrastructure support is required for new generation entrepreneurs, it is available from these Champions in Services.
Is it already available by the
yes, actually, we are about to launch commerce. It is standing at Commerce Ministry. We are talking with the Exim Bank. We need some bank, because the scheme is giving insurance, subsidy on the component of interest. So we are talking with the bank and to freeze one of the bank, which help us to disburse this. So we already have budget for this year, and we are trying to work with the bank and have to fix the memorandum of understanding with the bank so that we can formally start working on it. So it is.
Can we expect it in 2020 calendar year or
yes,
in 2020 calendar year? Okay.
We have a small budget, but it is possible in this year only.
Okay.
So this is also one of the one more thing that I want to also appraise, that there was a mention about this research fund. Research fund also you have mentioned. I want to also appraise, and you were the Rajiv ji was the part of that Niti Aayog deliberations on Ayurveda biology and integrated research program. So now it is pending with expenditure department, and we are pursuing it so that we get this fund of 490 crore rupee. And it is on board. Tomorrow only, ICMR has GB, and ICMR GB also, they have taken up this agenda to endorse this proposal of integrative health research scheme. So I'm happy that there is a kind of
alignment,
synergy.
Alignment. Yeah, that's right.
And that whatever is our team, ministry team, government of India is thinking, most of these things are coming up from the experts and deliberations, and so it is really good for me to know about the evidences. Rajiv ji, one of the recommendation was about generating evidences, by assigning some diseases to certain hospitals. I want to share that Government of India have initiated AYUSH Grid. That you are also part of that, advisors for AYUSH Grid. And AYUSH Grid have now developed this AHMIS. It is like AYUSH-based hospital information management system, and we are doing the pilot with our national institutes and research councils. So once pilot is done and security everything is done, then we will be launching it nationwide. And this HMIS is also aligned with the ICD 11 proposal of AYUSH about the
Namaste portal.
Namaste portal. So Namaste portal alignment is with the AHMIS, and Namaste portal is also an effort of a standardized, kind of documentation of an alignment with all others observations, and then hopefully it will generate big data and big observations in near future. So that is also happening. And medical care tourism, we all know about that initiative I mentioned in the morning also. Ayurveda visa is a good idea, and we'll pursue it. I would suggest that in place of Ayurveda visa, we should call it Ayurveda and Yoga visa, because lot of people come for Ayurveda or maybe Ayush visa, so that all Ayush sciences can be covered. And of course, there are a lot of other suggestions that enabling ecosystem of startups and all those things we'll definitely consider, and we are aware about the importance of those suggestions. It is all boosting for the sector, and I will definitely from Ministry of Ayush, we would like to support this initiative of CII about generating a report about present system of AYUSH, so that we can work, we can have some kind of baseline that in 2020 what was the situation. So there is a question from Saswin Voley from Netherlands that can give you your advice on how we can implement the COVID AYUSH protocol to implement it in Netherlands and for other countries. Actually, these if you can see, if you can visit AYUSH website of Ministry of AYUSH, there are different protocols. One is we have put the guidelines for practitioners. So practitioners guidelines is with medicines and suggested kind of line of treatments for Ayurveda, and Siddha, Unani, Homeopathy, and yoga practitioners. So it is guideline for practitioners. But there is another guideline, is a self-care guideline. Self-care guideline is really simple. It is based on lot of empirical evidences. So it's not just, and then there is a little confusion as mentioned by me in the morning, that it is not immunity boosting, but immunity promotion guidelines. Immunomodulation. Yes. So these guidelines do have simple suggestions, and then it is easy to implement in any part of the world, including these simple pranayama techniques or yoga abhyasa or drinking warm water or applying ghee into nostrils or having oil pulling therapy or turmeric milk and then herbal tea made from different spices at home. So those kind of, it's already available, and it's available with graphics also, how to get it done. So my friend, maybe these self-care guidelines can be easily, and it do not need any medical advice. So it can be propagated in any part of the world. And I would like to mention that these guidelines are available on social media in 8 languages of the world. 5 languages and 3 more languages. So all 8 languages it is translated, and it is available on social media also. On AYUSH social media also it's available. So I think I tried to incorporate so many things, Rajiv ji, and thank you for inviting me. I'm happy. Actually, these are the food for the thoughts. So I must this brainstorm, and it gives us a kind of like insight that what is next. So thank you for all this wonderful effort, and I'm looking for a written kind of a document submitted to ministry so that we can work on it.
We'll give it with separate recommendations in different areas so that they can be taken up separately and acted upon.
Yeah, because we have different departments, different joint secretary, additional secretary looking after different tasks. So it is better to get separate recommendations for each and every other sector. One thing I want to mention, and I forgot to mention, is that it's wonderful to hear about this in place of wellness tourism. It should be termed as medical
Ayurveda medical.
Ayurveda medical travel. Ayurveda medical value travel. So this is precisely what people are coming to India. If they are not coming for wellness tourism, they should go to Morocco and some other parts of the world. Yeah, so they are coming to India for medical value travel. It's not just wellness. So it is a very good value addition for this. We also would like to push this. And as far as insurance is concerned, PMJY is already there, and I thank for the suggestion for ACHS, and we will work with Minister of Health for CGHS, rate compatibility, and we are already working with states to convince them about the insurance coverages into their health schemes. I know you know that in government it is like a big elephant. So things percolating, it takes time, but we are very much optimistic, and lot of things are happening. So we would like to push further, and we'll try to achieve most of these. One thing you mentioned about the medicine plant bridge gap between demand and supply. So I'd like to let you know that we are working with Agriculture Ministry. In principle, they agreed to incorporate into the medicine plant, into the agricultural product, and into the adding it to Girdavri. Girdavri is like it is like assessed as a crop. So once it is as a crop, crop insurance is also possible. So they agreed in principle to incorporate this and providing crop insurance to medicine plant cultivation also. So it is happening. It will happen.
Excellent.
Yeah. So a lot of things are happening, and thank you so much. Namaskar.
Namaskar. I just want to conclude by telling today morning I began, before you spoke, by telling we can see a threshold level of activity like escape velocity. If a rocket has to go to the moon, it has to escape the power which keeps it back on Earth. So I think the Ayush ministry and the Ayush sector, and Ayurveda sector in particular, I can't say about other parts, is now acquiring the escape velocity to go and have a much larger impact towards mainstreaming. Once again, I would like to thank Vaidya Kutecha ji and his colleagues and for his leadership and support to industry. Also to all the eminent panelists from India and overseas, Professor Jayant Devpujari ji, Dr. Simon Hunziker, Dr. Kishore Patwardhan, Dr. Shazwin, all of the people who are there on YouTube and otherwise. And on behalf of CII, I think Ms. Neerja Bhatia is here, Ms. Rakhi Gupta, and Ms. Deepa Mehta, Elizabeth Jacob, all of them have done a fantastic job in supporting industry to come and have this event. So I would like to also thank them.
Rajesh, my compliments to your team also. I forgot to mention their names, Neerja ji and Rakhi and Swati and all them. Yeah.
Thank you, CII. Thank you, everybody. Thank you, Vaidya Kutecha. Yeah, namaste.
Thank you, Mr. Sachudevan. Thank you, Secretary. Thank you, delegates, for joining us today. It was indeed a very interesting and insightful discussion. We look forward to your continued support. Thank you for giving us so much time. You sat through the entire deliberations, and we will come back to you with our proposal for the report and our key recommendations. And I'm sure you will support CII in taking this forward. On behalf of industry, I assure you complete support, and we will be with you in taking the agenda forward and helping you in executing and keeping the teams. Wherever there is a need for industry partnership, we'll be very happy to partner with you.
Thank you so much.
Thank you.
Thank you.
Good evening. Yeah, thank you. See you, Dr. Simon. Yeah, thank you. Bye-bye.
And discuss and divide the sessions. Speaker corner.